Good morning, honourable ministers and delegates, and good morning to all of you. We're about to resume on day 2 of the Directing Council. I would like to bring document agenda item 4.4, scale of assessed contributions for 2026 to 2027. In this regard, I would like to bring document CD 62/7 to the attention of the Council and invite Mr. Ronnie Mazza, Director of the Department of Planning, Budget and Evaluation, the Pan American Sanitary Bureau, to come to the head table. I yield the floor to the representative of the Executive Committee, Minister Anthony, to report on this item.
Thank you very much, Mr. President. Item 4.4, Scale of Assessed Contributions for 2026-2027. The Executive Committee was informed that the scale of assessed contributions of PAHO for 2026-2027 would be adjusted to reflect the outcome of discussions by the General Assembly of the Organization of American States on a new OAS scale of assessments for 2026 and subsequent years. At the time of the committee's session in June, the new OAS scale had not been adopted. It was explained that in event that the OAS General Assembly had not adopted a new scale prior to the date of the Directing Council, the current scale of PAHO assessed contributions would be maintained on an interim basis. Thank you, Mr. President. This concludes my report on this item.
Thank you, Minister Anthony. I now yield the floor to Mr. Mazza to present the item.
Good morning. Mr. President, Dr. Barbosa, honorable ministers, distinguished delegates. I am pleased to introduce item 4.4, Scale of Assessed Contributions for the period 2026-2027, and to update you since we presented this item at the Executive Committee in June. The proposed scale of assessed contributions for the new biennium will be the first to be approved within the framework of the new PAHO strategic plan, which you approved yesterday. The scale, along with the total level of assessed contributions set in the PAHO program budget 26-27 that you will consider later today, determine the amounts to be paid by the PAHO member states. According to Article 24A of PAHO's Constitution, its member states are assessed at the same rates of the OAS scale of assessed contributions. In June, pleased to note that the OAS General Assembly adopted its new scale for the years 2026-2028, which can then now be applied to PAHO. The scale of the OAS is adjusted to PAHO to accommodate assessments for member states that are not part of the OAS, participating member states, and associate member states of PAHO. Please note that your Secretariat is not proposing an increase in the total amount of assessed contributions, which will remain at $194.4 million. And just for the record, this has been since 2012-13, 13 years ago. We take this opportunity to thank you for your commitment to pay your quotas in time, since they're very vital for effective implementation of the program budget and respond to your priorities set out in that document. The Directing Council is invited to take note of this report, provide any comments it deems pertinent. Thank you for your attention. I'll be pleased to address any questions. Thank you, Mr. President.
Thank you, Mr. Mazda. I now invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex C. I open the floor to the plenary to start the discussions on this document. The discussion on the resolution will take place once the rapporteur has read the proposed resolution. Floor is now open. See Barbados. Barbados, you have the floor.
Mr. President, Director of PAHO, distinguished member states, Barbados commends PAHO on its clear and comprehensive report on the scale of assessed contributions for 2026-2027. These contributions are vital. They provide the primary means for PAHO to promote health, prevent disease, and respond to emerging health challenges across the Americas. Without reliable funding, essential programs in areas such as non-communicable disease prevention, health system strengthening, emergency preparedness, and equitable access to care would be limited. In this regard, a clear and agreed-upon scale ensures transparency, fairness, and shared ownership of the organization's priorities. Additionally, it allows PAHO to plan and implement initiatives efficiently, leveraging resources to achieve tangible improvements in population health. Barbados affirms the importance of timely and sustained contributions from all member states, associate members, and participating states. Barbados notes that our scale of assessed contributions for the period 2026 to 2027 have remained unchanged, for which we are eternally grateful. By endorsing the proposed scale for 2026-2027, we strengthen our collective commitment to health systems and population well-being across the Americas. We therefore urge member states to approve the scale of assessed contributions for 2026-2027 and request the Bureau to present detailed amounts of gross and net assessments once the total contribution level is determined. In conclusion, Barbados calls on all member states to support this crucial financial framework, ensuring PAHO has the resources to respond effectively to current and future health challenges. I thank you.
Thank you, Barbados. I now give the floor to the Dominican Republic.
Buenos días, Excelencias, señor presidente.
Good morning, Your Excellencies, Mr. Chairman, distinguished delegates. The Dominican Republic thanks you for this presentation on the scale of assessed contributions for 2026-27 and recognize the importance of having sufficient funds for PAHO so that we can continue supporting member states in strengthening our healthcare systems. However, we would like to express our concern for the increase of 25% proposed for our country's contribution for the 2026-27 period, which is greater than the trend of other countries with similar characteristics and is an additional burden for public funds. In view of the fact that the contributions are defined by each country by the OAS's contributions, we request that you consider the application of a transitional mechanism for the adjustment for something greater than 20% that allows a sustainable and gradual increase once the specific amounts of the contributions have been specified for member states, associate members, and states participating in PAHO. And finally, we underscore that any increase in contribution should be translated in concrete and measurable results in PAHO so that member countries can see effective return on their financial effort, because that's how we are judged in our countries. We believe that the strategic plan 2026-2031 adopted yesterday will allow our vision, objectives, and strategies for improving the health of Americas become palpable results for each one of the member states and our citizens. In a constructive cooperation spirit, the Dominican Republic will always be committed to working together with PAHO and member states to reach a just, equitable, and sustainable scale consistent with the country's needs, particularly in view of the major changes experienced by the world in these days.
I give the floor to Honduras.
Buenos días, señor presidente.
Good morning, Mr. Chairman and distinguished delegates. Honduras, as a member state committed to strengthening public and regional health, recognizes the importance of a scale of assessments that ensures the financial sustainability of the Pan American Health Organization and ensures the quality of its technical operational programs. In this context, Honduras values the adoption of the new scale of assessments based on a scale of scores approved by the OAS for the 2026-2028 period, which includes associate members and non-member participating states of the OAS, respecting the constitutional and governance mandates that are in force. In view, given the challenging economic environment of many member states, including Honduras, and taking into account the real reduction of the general budget of 7% allocated for the 2026-27 biennium, we propose that you implement a flexible adjustment mechanism for the scale of contributions that allows to mitigate the impact of the changing economic situation in each country, ensuring that contributions reflect the current economic capacity and allowing for a periodic adaptation according to updated economic indicators. Thank you.
Honduras, and I'll give the floor to Chile.
Gracias, señor.
Thank you, Mr. Chairman, and good morning, delegates. We thank you for the scale of assessed contributions presented in the document and acknowledge the importance of financing technical cooperation activities of the organization. Member states are the first has to contribute to the budget of the Pan American Health Organization, and as such, we appeal to strengthening the idea that health is an investment for the prosperity of countries in the region. Likewise, we thank the organization for its efforts to obtain the contributions that are still owed and allow for better technical cooperation through partnerships. These partnerships are vital in the current context where uncertainty forces us to cut our national health budgets. We are allowed in technical cooperation, and we understand the ideas that will be undertaken in view of the strategic plan for the next 5-year period. We reaffirm our commitment to health and well-being of the region and support the proposed resolution.
Gracias, señor.
Thank you, Mr. Chairman. Ecuador recognizes the valuable work done by the Pan American Health Organization and the relevance of the scale of assessments for 2026-27, a fundamental tool for our region. This document lays out the financing by states, member states, and other states. It's based on the same quota scale of the OAS, according to the Pan American orders. The Directing Council should look at the report and consider the approval of this scale, even though the specific amounts will be communicated to us once the program budget of PAHO for this biennium is approved. The Ministry of Public Health of Ecuador has shown a strong commitment to strengthening health, and amongst the most important actions are the investment in modernizing health centers and the procurement of high-technology equipment for surgery with the support of PAHO, audition, neurological diagnosis tools for the country. Likewise, the improvement of healthcare workers with a ministry agreement for the payment of medical residencies and nursing, as well as the creation of new public health school and the procurement of medication through centralized purchases led by the Ministry of Health through various pillars to ensure health, access to health. In Ecuador, the scale of assessment for 25-627 is important because it establishes and determines the financing of the budget. It ensures the participation of Ecuador and all member states to be able to participate in the programs and technical cooperation provided by PAHO, which is essential to support the national efforts in public health and to keep the country's voice active in the health agenda of the continent. We thank and ask all member states to review this document and its proposals, because this will allow us to ensure the essential financing of PAHO. In conclusion, Ecuador, as a member state, supports the draft resolution and the scale of contributions of assessments for the 2026-27 biennium. Thank you.
To Mexico.
'em. 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 '
Mr. Chairman, Mexico, take notes of the document scale of assessed contributions for 2036-27. We realize that these contributions are an essential source for financing the program of work of PAHO and to keep the technical cooperation that strengthens our own health systems. However, in a very complex global situation, the payment of international financial commitments implies significant effort for our economies, particularly as we see increases in the contributions both to WHO and PAHO. Thus, Mexico would like to reiterate its commitment to continue fulfilling its obligations with as it goes along with our internal rules. But we urge PAHO to continue finding sustainable funding through the identification of resources, incurring savings, transparency, accountability, and the permanent performance review. We also ask that in its capacity as the regional office of WHO, PAHO continue insisting that the distribution of global funds be done according to the methodology agreed to, correcting the persistent inequity that affects the region of the Americas.
No other requests for the floor. I now give the floor to Mr. Mazda to respond to the comments.
Thank you, Mr. President, and to the 6 member states that have made their interventions: Barbados, the Dominican Republic, Honduras, Chile, Ecuador, and Mexico. If you allow me, I will address a couple of questions, but before, let me reiterate our appreciation for that commitment of our member states to continue with their payments of quotas, which, as you rightly highlight, they're critical. They're critical to respond to your priorities and to keep this organization, again, as relevant and agile in implementing the programs and priorities that you set out. Let me first say that indeed, while the Director is not proposing an increase of the total amount for PAHO, which stays at $194 million, the distribution does change because, again, of the new scale that the OAS approved. And that's because, again, they use the socioeconomic indicators that they use, and they updated their formula, and that resulted in changes in actual amounts by several member states. According to our analysis, 8 member states go down and another 9 go up. That's the result of that, the formula the OAS applies. But let me address a few questions here. In terms of Barbados, we will have the amounts. They are actually included in the proposed program budget document, Annex 2, and they will be formally communicated by our finance departments to each country once these are approved by the Directing Council. República Dominicana, gracias.
Dominican Republic, yes, thank you. This is a 25% increase in keeping with the OAS formula. But I also wish to reiterate here that there's always a plan available, a plan that can be agreed on for payments, and that is something that can also be communicated in the execution during the biennium. Thank you. Now, regarding Chile, Mexico, as to looking for other sources, yes, we're constantly looking into that and constantly working on building partnerships and alliances. On the agenda item on the budget, on initial projections, we will work on this. We continue working with WHO, negotiating so that the allocation will be more equitable. And we've made some progress, but we thank you for your voices, the voices of our member states that are always heard, and we hope that we will continue receiving the adequate amount of resources from WHO for the region. Now, regarding containment, efficiency, prioritization measures, I do wish to reiterate that these are principles that govern our actions at this biennium. Our director is already implementing containing measures for efficiency, always focused on the priorities that you set, the priorities that are agreed on by the members according to the planning that we do with each country. Thank you very much for your support, Mr. President. That is all.
Thank you, Mr. Banzner. Director, do you have any comments?
Yes, Mr. President, thank you. Good morning. Buenos días. Gostaria de agradecer.
I would like to express my gratitude for the different statements made by member states. As you know very well, in keeping with our charter, we have to follow the same scale of quota assessments of the OAS. So when the scale of quota assessments of the OAS changes, we automatically have to adjust within PAHO. For us, the amount is the same, but it changes in the distribution between and among countries, and I acknowledge the comment made by the minister from the Dominican Republic to the effect that whenever we have these changes, some countries pay more and others will pay less because of the discussions that were held at the OAS that will be duly reflected. As I pointed out, the amount for us continued to be the same. As Ronnie Massa has just said,
12 años que no.
for over 12 years, we have not had an increase in the amount of assessed contributions of countries for the organization. And this, in real terms, means that there is a drop of over $70 million, which I believe is an indication of the fact that nowadays we do things in a much more effective way what we used to do in the past. And we did not propose any increase in the contributions precisely due to the fact that countries in the region and all countries of the world approved at the World Health Organization a new increase of 20%. Then it seemed to us that it would be an additional burden for the countries to approve an additional increase for WHO together with another increase at PAHO. But at the same time, and this underscores the importance, and I would like to thank countries in the region for their constant advocacy, so that the increase that was supported at WHO will also be reflected in an increase on the part of the budget and WHO funds that are allocated to the region of the Americas. So we will have the opportunity for countries at the meeting of the executive board to approve the WHO budget. We are holding conversations with Geneva to continue looking for a more equitable distribution amongst the different regions of WHO. Last but not least, it is also important to point out that we're looking for a greater diversity in the sources of funding of the organization. As you will be able to see, the voluntary contributions that we receive, both from countries in the region, from governments, but also from private foundations, grew significantly in the last few years. And this is what enables us, even without having an increase in the amount of assessed contributions by countries, to continue with all the activities on technical cooperation that are being developed and which were increased in the last few years. So I would like to express my profound gratitude for your comments, for your contributions. We take note of these, and we are fully aligned with the need for having an organization with full transparency, with all the measures in order to look for great effectiveness, for reducing the red tape and bureaucracy, so that all operations can be carried out at a lower cost. From the very beginning of this year, we adopted a whole set of measures in order to bring down the cost of the organization without endangering the technical cooperation that is offered to countries, and we will continue with that objective of looking for greater effectiveness so that every cent that we get from countries will be well justified and translated into technical cooperation that can allow us to move forward with national priorities in each one of the countries on health and also the common agenda on health that we have for the region of the Americas. Thank you very much, Mr. President.
Thank you, Dr. Barbosa. I now ask the rapporteur to present the proposed resolution for consideration of the Directing Council.
Thank you, Mr. Chair. Proyecto de resolución.
Proposed resolution, scale of assessed contributions for 2026-2027, the 62nd Directing Council. PP1. Having examined the report of the Pan American Sanitary Bureau on the scale of assessed contributions for 2026-2027 to be applied to member states, participating states, and associate members of the Pan American Health Organization for the budgetary period 2026-2027, document CD 62/7. PP2. Bearing in mind that the provisions of Article 60 of the Pan American Sanitary Code, which establishes that the assessed contributions of the Pan American Health Organization shall be apportioned among the signatory governments on the same basis as the contributions of the Organization of American States. PP3, taking into account Article 24A of the Constitution of the Pan American Health Organization, which states that the organization shall be financed by annual contributions from its member states and member governments, and that the rate of these contributions shall be determined in conformity with Article 60 of the Pan American Sanitary Code. PP4, considering that the General Assembly of the Organization of American States has adopted a scale of quota assessments for the years 2026-2028. PP5, bearing in mind that the total assessed contribution level still needs to be determined, resolves. OP1, to approve the following scale of assessed contributions for 2026-2027. OP2, to request the Pan American Sanitary Bureau to present detailed amounts of the proposed gross and net assessment contributions to be paid by PAHO member states, participating states, and associate members once that the total assessed contribution level is determined. Next, Mr. President, there is a table which includes the assessment rate corresponding to each member state, each participating state, and each associate member. Thank you.
Thank you. I now give the floor to the plenary to begin discussions on the proposed resolution. I see no request for the floor. I declare that the resolution is adopted. Item 4.3, Budget Policy of the Pan American Health Organization. I would like to bring document CD 62/6 to the attention of the Council. And I now give the floor to the representative of the Executive Committee to report on the item, Minister Anthony.
Thank you, Mr. President. Item 4.3, Budget Policy of the Pan American Health Organization. The Executive Committee reviewed the updated budget policy during its June session. The committee welcomed the policy, expressing support for its focus on strengthening technical cooperation at the country level, promoting transparency in budget allocations, and ensuring alignment with PAHO's Strategic Plan 2026 to 2031. The Bureau's effort to improve transparency, efficiency, and responsiveness in budget allocations were commended. The Bureau was encouraged to create clear definitions and a glossary of terms to accompany the policy and to establish a communication and training plan to enhance understanding, transparency, compliance, and accountability. In the discussion of the proposed resolution on this item, several amendments were discussed. Following deliberations, the Executive Committee adopted Resolution CE 176R2 as amended, recommending that the Directing Council approve the proposed PAHO budget policy. Thank you, Mr. President. This concludes my report on the item.
Thank you. I now give the floor to Mr. Mazza to present the item.
Mr. President, Dr. Jarvis, honorable ministers, distinguished delegates, colleagues, I am pleased to introduce and update you on this item 4.3, the budget policy of the Pan American Health Organization. terms of its purpose, this policy aims to ensure, as highlighted by the President of the Executive Committee, transparent, evidence-based, and flexible allocation of resources across PAHO's functional levels. And by that we mean the regional, sub-regional, and country levels in which we operate. In terms of the mandate, this policy responds to the mandate of member states that we revise a budget policy every 6 years, and this coincides also with the presentation of a new strategic plan. As committed when the current policy was approved in 2019, we were to conduct an external evaluation, which was done in 2024, and the new policy benefits from that external review and recommendations. The external evaluation, which has been published in line with the Director's commitment to increase transparency and accountability, highlights the strengths of the current policy, but also its weaknesses. In terms of its strengths, it had a well-structured, data-driven budgeting approach, but also the external evaluators identified that the data that we used remained stagnant and therefore became outdated as soon as we implemented. And the need to continue looking at data and updating the metrics was something that was identified. As noted by the President of the Executive Committee, it was also found out that we needed to improve our communication and training so that there was full understanding of the policy, both internally and with our member states. So the new budget policy determines principles and criteria. We looked at this very carefully, and we indeed have updated the definitions as requested to ensure that there's clarity on the allocation of these envelopes, budget envelopes, by levels. The set of criteria and principles will allow us to adapt during implementation as we review new data as it becomes available. Let me just highlight the guiding principles that are included in the document before you. First, ensuring that we're aligned with the PAHO values, our country-focused commitment to respond to the priorities of member states, the flexibility so that we have dynamic mechanisms to adapt to the reality, prioritization, progressivity, absorptive capacity, understanding that member states have different needs as well, and adaptability. Allow me to note that in terms of the policy, it will guide development, it's already guiding, the development of the program budgets that are being presented to you during the next 6 years. We commit to continue improving in its implementation and learning and applying those lessons learned so that we can continue updating the policy during its implementation as recommended by the external evaluators. We will also report to you, as is required every 2 years, through the program budget implementation reports or end-of-biennial assessment reports, to show to you how we're implementing the policy and where there are areas for improvement. Allow me also to reiterate our commitment to ensure that there is improvement in communication and training. We therefore ask the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in the annex. I thank you for your attention.
Thank you, Mr. Master. I now invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in the annex. I open the floor to the plenary to start the discussions on this document, and the discussion on the resolution will take place once the rapporteur has read the proposed resolution. The floor is now open for comments. Panama, I give the floor.
Good morning. Thank you, Mr. President. Panama takes note of this document on the new budget policy of the Pan American Health Organization, which will provide the office an effective and efficient tool in order to prepare every 2 years the budget policy for PAHO in order to implement the Strategic Plan 2026-2031. It is within that framework that Panama believes that this policy has been designed in order to be transparent, flexible, evidence-based, and with accountability in order to ensure that the office is ready to respond in a proactive fashion and allocate resources strategically in order to maximize the attainment of the objectives set forth together with the member states within the 2026-2031 strategic plan. We support this new policy on the PAHO budget, where we define the principles and criteria in order to establish the corresponding budgetary allocations at the different functional levels of countries, sub-regional and regional. This set of principles and criteria will enable us to adapt the budget levels in order to respond to the needs and the priorities that might arise in each one of the functional levels of the office or in some country offices in the different countries. Last but not least, we ask the Bureau that this new budget policy become part within the framework of PAHO on result-based management, promoting budgetary allocations that will respond to the needs and capacities of countries in keeping with the strategic plan of PAHO and the cooperation strategies with the countries based on available evidence and maintaining sufficient flexibility in order to be adapted to the constant evolution of the health situation in the region. Thank you very much.
Thank you, Panama. I now give the floor to Trinidad and Tobago.
Chair, Director, distinguished delegates, good morning. Trinidad and Tobago expresses appreciation for the thoughtful and forward-looking proposal for a new PAHO program budget policy. We commend the Secretariat for the inclusive consultations and the evidence-informed approach taken in its development. We note with particular satisfaction the stronger emphasis on strategic alignment, transparency, and accountability, elements that are essential to ensuring that limited resources are deployed in a manner that is both impactful and equitable. We support the policy's shift towards prioritized outcome-based budgeting, grounded in the PAHO strategic plan and member states' express needs. This provides greater clarity for implementation and better visibility of results for all stakeholders, including ministries of health. We particularly welcome the use of member state prioritization and methods such as the hand-on process to guide allocation, stronger enterprise risk management and audit oversight, and more frequent monitoring and transparency through the program budget portal. Chair, we believe sustained implementation will require adequate technical support at country level, especially for smaller states managing complex planning and reporting cycles. We therefore encourage the Secretariat to consider simplified tools and templates to support national teams. Finally, we note the importance of mobilizing predictable and sustainable financing aligned with regional and national priorities. Trinidad and Tobago remains committed to doing its part while emphasizing the need for shared responsibility and innovative financing mechanisms across the region. Thank you.
Thank you, Trinidad and Tobago. I now give the floor to the Bahamas.
Mr. President, the Bahamas commends the Pan-American Sanitary Bureau for the presentation of the proposed budget policy. We recognize its value as a transparent, evidence-based framework that balances accountability with the flexibility needed to respond to evolving health challenges in our region. These features are especially critical for small island developing states like the Bahamas, where health system vulnerabilities are compounded by geographic dispersion, limited economies of scale, and the growing impacts of climate change. The Bahamas appreciates the emphasis on progressivity, ensuring that countries with greater vulnerabilities receive proportionate attention, and on absorptive capacity, which allows realistic alignment between needs and resources. We also endorse the principle of adaptability, which recognizing the importance of adjusting allocations when emergencies, such as hurricanes or outbreaks, disrupt national health priorities. Mr. President, the Bahamas reaffirms that sustainable financing of PAHO remains central to regional solidarity. We urge all member states to honor their financial commitments so that the organization can continue to deliver on its mandate. We also urge for stronger efforts to ensure WHO's allocation to the region of the Americas is both fair and equitable. Finally, while the Bahamas supports the resolution and shares the optimism of this new policy brings, we must stress the importance of its meaningful translation at country office level. Too often, requests for clarity on how budget allocations are applied to and used for national program areas go unanswered. For this policy to inspire confidence and deliver on its potential, we urge the Secretariat to publish explicit guidance on what member states can expect in terms of visibility of program allocations and budget utilization, program by program at national level. Such guidance should include the frequency, format, and level of details for country offices to share with member states as part of the improved communication approach. While we recognize the imperative of doing more with less, there is an equally compelling imperative to get it right. Getting it right means member state engagement must not be confined to priority setting alone if we are to work collaboratively and in unison for impact. Thank you.
Thank you, the Bahamas. I give the floor to Brazil.
Thank you, Mr. President. Senhor Presidente, muito
Mr. President, thank you very much. Brazil would like to thank you for the presentation of the budget policy of PAHO and moves for its approval. It has to do with an important update and the recommendations received for the external evaluation for the last period. The update proposed shows the capacity of the organization to receive and integrate proposals that have to do with transparency, effectiveness, and hard work. Brazil supports technical cooperation at the level of countries, as well as budgetary alignment with the strategic plan and with the cooperation strategies with each country. Mr. President, in its recommendations, the report that has to do with the previous agreement on budget policy suggests the elaboration of the dissemination material, not concentrated on specialists, and it's a simple development of the budget. Brazil would like to add its voice to that call and to urge PAHO to prepare that material responding to the budgetary policy. Thank you, sir.
Thank you, Brazil. I now give the floor to the Dominican Republic.
Señoras y señores,
Ladies and gentlemen, the Dominican Republic values the update of this budget policy of PAHO, which reinforces governing principles valued on the effective and efficient use of resources at all levels of the organization. We especially stress the transparent, structured, adaptable approach that will enable us to respond on a timely basis to changing situations and to prioritize technical cooperation at the level of each country. Likewise, we welcome the innovations introduced. Amongst these, the combination of quantitative and qualitative approaches for budgetary allocations, the development of a glossary of terms and a plan of communication in order to facilitate the understanding and transparency of the policy. We stress the importance of this new policy that is to guide budgetary allocations during this new period will take into account the lessons learned in the implementation of the previous policies of the budget policy, as well as the possibility of taking into account the recommendations of the analysis and the assessments performed in this regard. We also value the equity-based approach, understanding as to the allocation of technical assistance provided to countries, which further reinforce justice in the distribution of resources and the priority given to those who need it the most. The Dominican Republic fully supports this policy that shows a commitment with efficiency, transparency, and the capacity to respond to PAHO. We acknowledge that its implementation will allow us to strengthen technical cooperation, optimize available resources, and to make sure that programs and projects, always results-based, will contribute in a tangible way to the strengthening of health systems at a national and regional level. But above all, that the word community, the community, and the people-centered care will be the objective and the main destiny of these budgets, for these to be human and efficient. Thank you very much.
Thank you, Dominican Republic. I now give the floor to Guyana.
President. Guyana thank the Secretariat for the presentation of the PAHO budget's policy and acknowledges the consultation that informs development. We recognize that a sound budget policy is essential for transparency, predictability, and fairness in resource allocation. Guyana supports the adoption of a budget policy that is transparent, equitable, and flexible, ensuring that no member state is left behind and that PAHO remains fit to deliver on its mandate in our region. Thank you.
Thank you, Guyana. I see no further requests for the floor. I therefore give the floor to Mr. Mazda to respond to the comments.
Thank you, Mr. President. Again, to thank our member states who have expressed their support and the value of this policy: Panama, Trinidad and Tobago, the Bahamas, Brazil, the Dominican Republic, and Guyana. Let me just say that we hear you and we commit to implementing what you have asked us. That call for transparent communication, training, dissemination, we are working on it. And I will probably spoil the surprise because I was planning to update you in the next item that we are launching our digital portal, an updated version, which will address your very same question, distinguished delegates from the Bahamas, where we will have full transparency of budget allocations at all levels. And also we'll be working to see how we can take that country by country as well, if we really mean country focus on how we align the budget to the priorities of members. It's something that we monitor already. And yes, to the question about continuing with the results-based approach, that's a commitment, that's a culture here at PAHO, and we continue building on our experience, but also from your feedback. And we can always improve, and we always look forward to your guidance. Thank you, member states. We're looking forward to implementing this policy so it really addresses, as you have highlighted, the needs of the peoples we serve. Thank you, Mr. President.
Thank you, Mr. Mazda. Director, do you have any comments?
Thank you, Mr. President. Very briefly, I just want to thank your comments, the comments from our member states. As you highlighted, this new policy reflects at the same time the results of the external evaluation that we performed, but at the same time the comments and suggestions from our member states. So we are presenting the translation of this new policy in the next topic when we are presenting the program budget for the next biennial, but the general idea, the general principles that you presented to be more focused on technical cooperation at the country level are reflected in the proposal, and also the idea to have a totally transparent ways to show to our member states how the budget is being implemented after your approval at the country level and across the region. I think that this is really important. We are fully committed to fulfill this requirement for our member states. Thank you very much.
Thank you, Dr. Barbosa. I now ask the rapporteur to present the proposed resolution for the consideration of the Directing Council.
Thank you, Mr. President. Proyecto de resolución. Política de...
Proposed resolution, budget policy of the Pan American Health Organization. The 62nd Directing Council, preambular paragraph 1, having reviewed the budget policy of the Pan American Health Organization, document CD 62/6, which presents a new budget policy that defines a new way of allocating budget ceilings within the Pan American Health Organization. PP2, noting the recommendations contained in the published external evaluation of the existing budget policy, preambular paragraph 3, considering the deliberations of the 176th session of the Executive Committee, resolves, operative paragraph 1, to take note of the proposed principles and criteria for developing indicative budget envelopes for functional levels, regional, sub-regional, and country. Operative paragraph 2, to approve the new PAHO budget policy, including its guiding principles and its criteria for the budget allocation, prioritization, progressivity, absorptive capacity, and adaptability. Operative paragraph 3, to request the director to A, apply the new PAHO budget policy when formulating future proposed program budgets for the consideration of the Directing Council or the Pan American Sanitary Conference. B, present to the Directing Council or to the Pan American Sanitary Conference an update on the implementation of the PAHO budget policy every 2 years as part of the report on the end of biennium assessment of the PAHO program budgets. C, collaborate with member states to promote more effective technical cooperation modalities in an environment of financial constraints. That is all, Mr. Chairman.
Thank you. I now yield the floor to the plenary to begin discussion on the proposed resolution. I see no request for the floor. I see no objection. The resolution is adopted. We now move to item 4.2, Program Budget of the Pan American Health Organization 2026 to 2027. I would like to bring document CD 62/5 and addendum 1 and addendum 2 to the attention of the Council. I yield the floor to the representative of the Executive Committee to report on this item.
Thank you, Mr. President. Item 4.2, Program Budget of the Pan American Health Organization 2026-2027. The Executive Committee was informed in June that the overall proposed budget for 2026-2027 had been reduced to $762 million, a 7% net reduction compared with the program budget for 2024-2025. That reduction reflects a $38 million decrease in the WHO allocation to this region. The committee was also informed that there will be no increase in member states' assessed contribution for 2026-2027. In the Executive Committee's discussion of the proposed program budget, delegates welcomed the proposals' alignment with the new strategic plan 2026-2031, reflecting a collective commitment to resilience and sustainability. Delegates also applaud the prudent, realistic, and transparent approach taken in preparing the document and welcome the Bureau's efforts to ensure that the program budget proposal reflects the results of prioritization exercise conducted with member states. Support was expressed for the inclusion of contribution and change indicators as a means of quantifying the work done by PAHO and demonstrating the organization's impact. Delegates were pleased to note that no increase in assessed contributions is proposed and express appreciation to the Bureau for recognizing the financial challenges faced by member states. At the same time, the need to ensure predictable and sustainable financing for the organization was acknowledged, and the Bureau was encouraged to continue its resource mobilization efforts. The Executive Committee adopted Resolution CE 176-R3, recommending that the Directing Council approve the program budget for 2026-2027. Thank you, Mr. President. That concludes my report on the item.
Thank you, Minister. I now yield the floor to Mr. Mazda to present the item.
Mr. President, Dr. Jarvis, honorable ministers, distinguished delegates, I am pleased to introduce this item, the proposed program budget of the organization for the 26-27 biennium, and to provide a few updates that have emerged since its presentation to the Executive Committee in June. Before I go into the presentation, let me share with you that At your table, you will find a blue folder that has 2 brief papers, a one-pager that summarizes the strategic plan that you approved yesterday, and also a brief on the program budget that is before you for your consideration. At the bottom of the page, you will find a QR code, which is our digital portal for the strategic plan, the program budget, and our evaluation work. There you will find details on the document, but also the priorities of member states, the budget that you approve, and as we implement it, we will be updating it so that you can see again how the resources are being allocated and how they are also being implemented. Again, this is our commitment to you to continue building on efficiency, transparency, and accountability. This program budget is the first to operationalize the strategic plan. It therefore is critical for us to maintain that momentum on the work that is ongoing, but also looking at opportunities where we can accelerate as outlined in the strategic plan. The proposal responds to the extensive analysis of the situation we present in the strategic plan and also a summary presented in the program budget, and also considering the emerging public health challenges. We looked at the country context, the sub-regional as well integration mechanisms, and also as a collective, how the program budget responds to those priorities that you have identified jointly with the Secretariat. It builds on the lessons and successful experiences. As we conclude the implementation of a 6-year planning cycle and the last program budget, we carefully look at the lessons learned, not just to document, but how we can put them in practice as we continue building forward. We also look at the opportunities on where we can accelerate progress and where your organization, together with you and our partners, continues to modernize, to be responsive, relevant, and addressing your priorities. In line with the vision of our director through the PAHO Forward, our constant commitment to continue building on efficiency, transparency, and accountability, as I mentioned before. What you have here is a summary of the consolidated results of the country prioritization. And again, we'd like to thank the 43 countries and territories who undertook this exercise with our country offices and teams at country level. So we have this clear guidance from you on where you see PAHO's most value added in this technical cooperation. This is where you're asking us, the majority of member states, as you can see from the graphs, the number of member states who have said, this is where we see PAHO adding its most value with its limited resources. And that's the principle of prioritization. We cannot do everything, and not everybody needs everything. But we can tailor the technical cooperation that was highlighted yesterday to respond to that. As you can see at the top, it's no surprise, and this has been for the past 10 years, that the NCDs, mental health, have been at the top. And here is the commitment again to respond, not just, of course, planning, but during implementation, and to mobilize resources. And when you look at the proposal before you, you will see that we make an effort to align the budget allocations to these priorities. The reality is a challenge to mobilize resources aligned to these priorities, and therefore the flexible resources become so critical so that we, here your Secretariat, can direct them to respond to these priorities. In second place, again, not surprising that you have the stewardship, the strengthening of the health system, which includes the priorities that you have highlighted, human resources for health, health financing, and so on. And in third place, you will see there the issue of communicable diseases and also antimicrobial resistance and immunizations. Important topics that you continue to highlight in this August body that we need to continue responding. Fourthly, you will see, again, another important topic on preparedness and response to health emergencies. Constant need and constant attention is needed. And these priorities, again, outlined in detail in the program budget, will inform our efforts to respond, but also to mobilize resources and allocate the flexible resources when they become available in line with those priorities. Going into the proposed budget before you, as informed by the President of Executive Committee, we are presenting a proposal that is reduced by 7% overall. We believe that this is realistic after we have looked at the financial outlook. And you will see that in the graphic before you, at the bottom you have base programs. These are all the strategic objectives and the outcomes that are approved in the strategic plan. And then at the top in orange, you have what we call the outbreak crisis and response component of special programs, where we again put a placeholder in the event that there's a need to respond to an emergency, we can receive and allocate those resources. That we have reduced, as you can see there, because again, we are not in the pandemic mode, but it's important to keep that space there so we can receive the funds and implement it. The budget space, as we call it here in PAHO, is not funded, it's not fully funded. It's a space that allows us to mobilize the resources, first, your assessments, your quotas, and then the rest we have to mobilize, and I will go into details in a bit. I also want to highlight, as mentioned before, that we made every effort here so that the proposal responds to your priorities, the priorities that you have approved, but also the regional mandates, the mandates that you endorse in these governing bodies of the organization, but also where we continue need, there's need for attention with ongoing commitments. This is the expected, as we call it, this is the distribution of the budget by strategic objective. In the document before you, you have the details by outcome. And as you can see here again, in line with the priorities that you have identified collectively, you see the budget allocation, for example, in strategic objective 2, resilient health systems based on primary health care, and also disease prevention control, where the NCD's component is, with a slightly higher allocation. This is just to highlight again on the approach we use to allocate the budget by strategic objective. In terms of the expected financing sources, to the left on this table, you have what are the expectations we have in terms of the funding, and I want to highlight here, in the PAHO budget, in summary, has three main sources. The assessed contributions, the voluntary contributions, and the PAHO and the WHO resources that we also receive. Here on this table, you have a bit more of detail. And you will see that we have an asterisk there next to the assessed contributions. In line with our financial regulations, we take 100% of the quotas that you commit to pay as available to finance the program budget. It's not equal to, it's not actually, it's commitment that we will receive those resources, and therefore we budget them fully. That's why you see 100% of them. The second line there, you have the miscellaneous revenue, where we're seeing an important amount, an increase compared to the last biennium of $52 million. We expect to receive those funds as well. They should become available, and they're actually funds. And the third line, you will see the PAHO voluntary contributions on the resources, where we commit again to continue intensifying resource mobilization efforts, but again, with the outlook at this time, and that initial projection we make is that we can estimate $150 million of the $160 we propose in the budget. And then the WHO allocations. WHO usually provides an allocation of budget space that is larger than the funding. At this time, it's $254.8 million. That's what was approved at the World Health Assembly. And since June, I'm pleased to update you that the amount that is there, 142.7 expected funding, is a commitment already received from the Director General to our Director of Flexible Funds. We are not reflecting there yet any voluntary contributions. We're in negotiations with WHO to update these figures. In summary, our projections are that at the start of next biennium, we would have 81% funding of that proposed program budget in base of $662 million. Again, with the caveat that we count in 100% of your quotas payments. And also, I want to take the opportunity of highlighting a new item that we've included in the proposal to fund the program budget, which is core voluntary contributions. We haven't used that in the past. These are more flexible voluntary contributions that we invite not just donors, but our member states to provide to the organization so that we can respond to the priorities. So while we're not asking for an increase in assessed contributions, we plead to member states to see where possible if they can also contribute with core voluntary contributions to the organization. Pleased to announce and to thank Spain for the first contribution in CVC, or core voluntary contribution, that was done earlier this year, and which will help us also to put additional resources to the priorities that you have asked us to work on. Again, this is an initial projection. We will continue to update those figures as the implementation of the program budget and as we continue to mobilize resources. With WHO, it's important that you continue to advocate for that equitable allocation to the region. And again, we should see that number there growing as we implement. Again, and thanks for your advocacy. We kindly ask you to consider this proposal before you. We have in annexes the details of the budget and also the proposed amounts. But this, again, will be communicated to you in terms of the payments of quotas through our finance department. We ask you to consider this proposal and provide us with any comments you believe are pertinent at this time, and to consider also adopting the proposed resolution. I thank you, and I remain available for any questions.
Thank you, Mr. Mazza. I now invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolutions presented in Addendum 1 and Addendum 2. I now open the floor to the plenary to start the discussion on this document. The discussions on the resolutions will take place once the rapporteur has read the proposed resolutions. The floor is now open. I give the floor to Panama.
Gracias, señor presidente.
Thank you, Mr. Chairman. We value the proposed program budget of the Pan American Health Organization for 2026-27, which is the first drafted on and executed under the new strategic plan 2026-2031, which reflects the renewed commitment to move forward with health equity, the establishment of resilient health centers, and the promotion of sustainable development throughout the regions of the Americas. We believe that the member states should invest on a global health architecture that is more solid and coherent, which protects all countries, supports the most vulnerable people, and ensures the collective preparation and response to future health threats. In this regard, we'd like to highlight that the region of the Americas, in spite of being one of the most vulnerable regions at the global level, has the lowest budget amongst the WHO regions. And especially with that, we have the lowest budget situation, which minimizes the flexible funds and therefore affects the people living in the Americas. We therefore ask that the final allocation could lead to guiding the flexible funds that the organization has to serve as a basis for the mobilization of resources and drafting the relevant biennial work plans for the biennium 2026-27. In conclusion, we thank you for including the contributions made by member states through consultation on this program and health budget and the budget for the WHO program 2026-27. Thank you, Mr. Chairman.
The floor to Colombia.
Gracias, señor presidente.
Thank you, Mr. Chairman. We'd like to begin by acknowledging the work done by PAHO during a period where there are many budgetary restrictions, and we thank the Secretariat for their effort to ensure technical cooperation in spite of these limitations. We are aware of the financial challenges facing PAHO and WHO and agree that it's important to move forward to more predictable and sustainable financing that supports the solidity of our health systems in our region. Likewise, we cannot but recognize that member states also have fiscal restrictions that force us to seek balance between financial sustainability and response capacity. Therefore, we feel that the budget proposal presented by PAHO is reasonable. It envisages a reduction of 7% for the 2020 compared to the 24-25 biennium. It is a responsible and realistic approach given the current situation. We value the desire not to increase contributions for the next biennium. This measures is a help to the public finance of our countries and will allow us to keep a balance between financial sustainability and the technical support that's essential to our member states. And finally, we'd like to say that for us, it's valuable that even under this context of restrictions, the implementation of the budget should continue to be inspired on the principles of the 2030 agenda, those related to equity, climate change, gender focus, and the social determinants of health, which guide all of our efforts so that no one is left behind. We reiterate our commitment to multilateral commitment in the health sector and with the strengthening of PAHO as a key organization for the well-being of our populations.
And I'll give the floor to Canada.
Thank you very much. Canada also thanks the Secretariat for the proposed program budget, which is the first under the new strategic plan and will be vital to set in motion this new strategic vision for the next 6 years. We appreciate that this program budget reflects current regional needs given PAHO's active engagement with member states in the priority setting exercise. Noting the overall decrease in budget and subsequent changes in budget allocation by outcome, we further appreciate the principles applied, guided by this priority setting exercise, to ensure PAHO is continuing to allocate resources in a responsive and transparent manner. Recognizing that this proposed budget remains subject to an evolving and uncertain global financing landscape, we acknowledge that the Secretariat has just shared regarding the organization's vital need to remain realistic and prudent, and are encouraged that PAHO will apply the principle of risk-based prioritization to guide strategic allocation of organizational resources, giving special attention to addressing risks that impact country-level operations and the fundamental priority regarding the delivery of technical cooperation. We also encourage the Secretariat's continued implementation of the PAHO Forward initiative to maximize efficiencies, streamline approval processes, and reduce the overall administrative burden to ensure the organization is operating optimally while helping to mitigate pressures on the staff and organization as a whole. In the event of substantial changes to the financial landscape that may significantly affect programming, member states, of course, have the opportunity to guide decisions in response to potential reductions. And finally, we'll take this opportunity to again emphasize our collective responsibility in ensuring that we are paying our assessed contributions in full and on time in order to enable PAHO to implement this critical work. Thank you.
Thank you, Canada. I now give the floor to Trinidad and Tobago.
Thank you. Chair, Director, distinguished delegates, Trinidad and Tobago thanks the organization for the presentation of the proposed program budget for 2026-2027. We note the envelope of US $762 million and commend its focus on country-level operations, health system resilience, and essential public health functions. We recognize PAHO's achievements in reinforcing technical cooperation after COVID-19, advancing the PAHO forward reforms, and elevating country ownership. At the same time, tighter resources and past challenges in procurement and human resource deployment highlight the importance of strengthening efficiency, transparency, and equity in implementation. We note with concern that the budget envelope reflects constrained resources, and we invite the Secretariat and partners to continue exploring innovative financing mechanisms to sustain essential functions. We also take positive note of the increased share for country-level operations, the integration of climate and health, and the emphasis on non-communicable diseases, digital transformation, and epidemic intelligence, all of which align with our national priorities of workforce rebuilding, climate resilience, and modernizing digital health. Trinidad and Tobago underscores the importance of PAHO, ensuring that delivery remains timely and responsive to national and sub-regional contexts. We reaffirm our commitment to regional solidarity and to working with PAHO for the benefit of all member states. Thank you.
Thank you, Trinidad and Tobago, and I'll give the floor to Barbados.
Thank you, Mr. President, Director of the Pan American Health Organization, distinguished delegates. Barbados expresses strong support for the proposed program budget 2026 to 2027, as set out in Resolution CE 176.R3. The program budget is strategic and forward-looking and results-driven, aligned with the Strategic Plan 2026 to 2031. It ensures clarity, accountability, and measurable impact. By prioritizing resilience, equity, and cross-cutting actions, PAHO is ready to meet the evolving health challenges and to support member states in achieving universal health coverage. The budget also demonstrates innovation, efficiency, and targeted actions in the time of constrained resources. Barbados welcomes this framework, which addresses the pressing health priorities of our region, strengthening health systems, advancing equity, and improving preparedness for current and emerging threats. At home, non-communicable disease remains our greatest challenge, accounting for 80% of premature mortality. The budget focus on prevention, early detection, and health promotion aligns directly with our national priorities. Equally important are the commitments to sustained high immunization coverage, improved maternal and child health, expanded mental health services, all which are key areas in addressing primary health care. Barbados is also encouraged by PAHO's commitment to transparency, accountability, and country-focused cooperation, especially in health emergencies and climate resilience, recognizing our vulnerabilities as small island developing states. In closing, Barbados reaffirms its support for the resolution CE 176.R3. We look forward to working with PAHO and fellow member states to turn this budget into real results, improving health, reducing inequities, and building resilience across the Americas. I thank you.
Thank you, Barbados, and I'll give the floor to Grenada.
Honorable President, distinguished delegates, good morning. On behalf of the government of Grenada, I extend our sincere commendation to the Pan American Health Organization for the preparation and presentation of the program budget for the biennial 2026-2027. The budget reflects not only technical excellence, but also deep understanding of the realities facing our region. We recognize the considerable effort that went into this development, an effort that was inclusive, constructive, and responsive to the evolving health landscape of the Americas. Alignment with the Strategic Plan 2026-2031 is both timely and visionary, offering a clear roadmap for advancing health equity, strengthening primary health care, and building resilient health systems. Mr. President, we are particularly appreciative of PAHO's acknowledgement of the challenging funding environment. the decision to maintain assessed contribution at current levels while still striving to deliver impactful technical cooperation speaks to PAHO's commitment to efficiency, innovation, and accountability. We understand the constraints this imposes and commends the organization's effort to mobilize flexible resources and introduce mechanisms such as core voluntary contributions to sustain essential programs. Importantly, we know the gratitude that the regional context was carefully considered in the budget formulation. The prioritization exercise, which identified non-communicable diseases, mental health, health system governance, and communicable disease control as high priority areas, resonates strongly with Grenada's national health agenda. These are areas where we continue to face significant challenges and where PAHO's support has been both strategic and transformative. Grenada has benefited immensely from PAHO's technical cooperation, whether through strengthening our surveillance system, enhancing our immunization program, supporting mental health initiatives, or guiding our health system reforms. The allocation of resources to country-level work, including the indicative budget for Grenada, is a testament of PAHO's country-focused approach and its unwavering commitment to leaving no one behind. As we move forward, Grenada reaffirms its commitment to support PAHO's mission. We stand ready to work collaboratively to ensure the successful implementation of this budget and to contribute to the shared goal of achieving the highest attainable standard of health for all peoples of the Americas. Thank you, Mr. President.
Thank you, Grenada. I now give the floor to Brazil.
Thank you so much, Mr. President.
Thank you very much, President. We are grateful for the presentation of the 2026-2027 program budget. We support its adoption. We recognize the meaningful effort that PAHO has made to adopt this budget, facing the current fiscal challenges faced by the region, and to the effort made to align the budget to the 2026-2031 strategic plan to ensure sustainability, resilience, and equity in health systems throughout the Americas. We also recognize the approach adopted in the drafting of this document based on evidence, having heard countries and working in all of the lessons learned during COVID-19. Mr. President, we underscore the very open and transparent way in which PAHO has tackled recent challenges, especially proposing a zero growth budget as regards fixed costs. We recognize the difficulties should not be underestimated, but we also understand that this offers an opportunity for us to reassert the clarity and purpose of PAHO and the shared goals of the Americas that we seek to meet through open dialogue and technical assistance. We appreciate the strategic goals set forth, which offers a precise structure for us to take on the next couple of years. Resilient, equitable systems to prevent diseases and emergency responses, and all of this translates into integrated, measurable results. We also recognize the importance of broadening the sources of financing for PAHO for there to be greater budgetary flexibility. We also underscore the need to strengthen our strategies and collaborate with other actors to strengthen the results and to ensure the effective implementation of our proposals. We congratulate the team of PAHO for the progress made in mobilizing resources and building partnerships, and we see this as key. So, Mr. President, we reiterate Brazil's commitment to bolster PAHO as a frame of reference for regional health. We stand by to collaborate in the implementation of this budget, contributing for a region of the Americas that is more equitable, resilient, and healthy. Thank you.
Thank you, Brazil, and I give the floor to Chile.
Thank you, Mr. President. Chile is grateful for the work carried out by the Secretariat and the member states in its program budget of the member states, as well as updates to keep the strategic plan cohesive with this. Even though there are different levels of action within states, they are quite similar. Mental health, stewardship based on primary health care, AMR, and strengthening the immunization programs, which are a priority for Chile. We celebrate the commitment of the organization to move toward the highest level of health for all people, the reestablishment of resilient healthcare systems, and promoting sustainable development. The national context within our countries is difficult, which calls for strategic partnerships with the IDB and the World Bank, among others, for us to strengthen further health in the states of the region. We celebrate, on the one hand, the design of concrete products within a framework that's cohesive with the strategic plan to enhance people's well-being and health, along with the Sustainable Development Goal and the technical cooperation co-created with sovereign states and in keeping with each country's specific needs and realities, all of which are geared toward ensuring that health be sustainable in our countries and resilient vis-a-vis any threat that we may face, and with the focus on health and social determinants of health and primary health care as well, to ensure progress made by countries and that progress be equitable. As far as the accountability worked into this budget, strengthens the responsibility and accountability and the good use of resources and transparency so that we move toward global health. We support the proposed resolution. Thank you.
Thank you, Chile. I now give the floor to the United Kingdom.
Thank you, Mr. President. The UK would like to thank PAHO for developing the programme budget for 2026 to 2027, the first aligned with the Strategic Plan 2026-2031. We would also like to thank the Secretariat for their presentation. We note the existing gap in projected funding for the biennium and would welcome further information on scenario planning that has been carried out to prepare for potential future budgetary pressures. We encourage PAHO to ensure that core functions and delivery of key strategic priorities are protected in implementing the programme budget for 2026 and 2027. In particular, PAHO's vital work in preventing, preparing for, and responding to health emergencies. The UK reaffirms our commitment to a strong, efficient, and sustainably financed PAHO and WHO that continues to play its vital role in global health and to provide crucial leadership in the Americas region. Thank you.
Thank you, United Kingdom. I now give the floor to Ecuador.
Thank you, Mr. President. Ecuador is pleased to take part in the 62nd Directing Council underscore the importance of the program budget, a document presented by the Pan American Health Organization for this period. This is crucial for us to project our strategy. Now, this budget is the first cycle aligned with the new 2026-2030 one plan. This reflects a general 7% reduction vis-a-vis the prior budget, and it shows the necessary funds to ensure resilient healthcare systems with the context based on results, which is essential for its effective implementation as well as accountability. Ecuador, through the Public Health Ministry, has carried out the following impact activities to address NCDs and mental health and violence. The country has the STEPS survey to address chronic diseases with the support of PAHO to strengthen surveillance of NCDs and to prevent teenage pregnancy as a priority, to reduce maternal deaths as well in coordination with the Vice President of the Republic and PAHO. This reflects a comprehensive response to our health needs. A priority of governance and stewardship in the primary health care. We have the agreement for the payment of resident doctors and nurses, which is necessary to strengthen the healthcare system's ability to respond as far as transmissible diseases. We are bolstering our essential intervention in the case of COVID and quality immunization so that we can make available necessary medicines, and so that our system is more able to respond to these actions, consolidate Ecuador's focus to strengthen the operational capacity and the necessary technical cooperation with PAHO. As a member state, it's important for us to bring down the financing gap that's been forecast through more flexible voluntary contributions. That's why Ecuador is grateful, and we would ask that this very important document be reviewed by the Directing Council and to consider its approval in the corresponding draft resolutions. Thank you.
Thank you, Ecuador, and I give the floor to Mexico.
Thank you, Mr. President. Mexico recognizes the effort carried out around this program budget 2026-2027, recognizing the need for projects to be aligned with the main mandates at the national level, but also regionally and worldwide, such that we can respond to national emergencies and priorities in health. Especially, we would like to commend the support given by the team in Mexico so that we can identify our priorities at the national level within this broader exercise of PAHO. Thank you very much.
Thank you, Mexico. I see no other requests for the floor. I yield the floor to Mr. Mazda to respond to comments.
Thank you, Mr. President, to the 11 delegations that have provided with their comments and suggestions, but also to reiterate our thanks to all member states for this engaging process that we concluded a couple of weeks ago. Indeed, as highlighted, let me start by Barbados' comments on how we translate this proposal now into real results is where we are now. And I would like to address also the UK question about scenario planning, is that we are, as we speak, already doing operational planning. So after the program budget is approved, we go into operational planning, which we develop specific work plans for each entity, we call them here. Every country office, every department is required to present this proposal to the director for his approval, where they present the concrete results and the budget they need to operationalize the program budget. So we are doing that, and as part of that, and considering the financial outlook, we're looking at scenario planning, where we're looking at what is mission critical, what can be scaled down, and also what can be sunsetted, where those areas where member states have capacity, but also where there are other partners that can deliver. So we'll be looking at that to complete that process between now and November. I'd also like to highlight the point on the assessed contributions. Yes, indeed, as we keep them at the same level, as we noted before, over 13 years now, you would realize that, and our director mentioned, a reduction of, in real terms, of more than $70 million. We are already doing more with less. But there's only so much that can be done. And that's why it's important that we're guided by the priorities that you have asked us on, where you see the most value added of PAHO's technical cooperation. Prudency, efficient management is not new to PAHO. Because of our commitment to respond to the scope of technical cooperation, to your demands, we always are looking at innovative ways here, and all our teams at country level, sub-regional and regional level, on how we can innovate and how we can partner. And again, the partnership with the Ministries of Health, where we have co-location offices that are hosted by our Ministries of Health as well, and where we share human resources and where we implement in innovative ways to ensure that we implement the activities that are planned, even when the resources are reduced. So there is that way of working with you, but also during the consultation, we heard our partners saying, where can we help? And we welcome that, and we'll follow up on that commitment to see concretely where our partners can also come in and add that value to the technical cooperation that we have identified with you. Going from prioritization to actual action is important. How do we remain aligned to the priorities when we mobilize resources is critical, as we've said before. So we also are looking at opportunities somewhere with our current partners, but also the new ones, and opportunities to find additional resources. Let me just note here, our director always highlights this, the budget is a space also that this is where we say is the envelope that we need at this time based on the financial outlook that we have looked at very carefully. But if any member state or any donor would like to bring in resources, we can always exceed the funding of it as well. So if we were to look at it on that way. So we welcome any contribution. I'd like to thank you, Canada, for that explicit commitment for the timely payment, but also your additional contributions from voluntary contributions for priority programs that we continue to implement in the countries. And to the other donors who will also look at us and see where we can, where we need resources to respond to the member states' priorities. The other point that I would like to highlight is on our commitment to continue building forward on the Director's Initiative, as we said before, PAHO Forward, which looks at continued innovation where we can improve efficiency, transparency, and accountability, as we said before, and to end our country focus. Country focus, indeed, is a way of doing business here at PAHO, and we're happy to say that in addition to the program budget, we have country cooperation strategies, but also country by country, our leaders, the PAHO WHO representatives, plan with the Ministries of Health. They monitor and report on implementation. As we implement this program and budget, we remain committed to you for increased transparency and accountability, results-oriented organization, and that we align the resources with the priorities, ensuring that we deliver the results that we commit to. I thank you again, and we look forward to implementing this program budget with you, our member states and partners. Thank you, Mr. President.
Thank you, Mr. Mazda. Director, do you have any comments?
Thank you. Thank you, Mr. President. I want to thank all member states for their comments, suggestions. I think that we take note of them, and it will be important for the process that we are dealing now. First, I want, of course, that nobody's happy when we are proposing a reduced budget compared to the previous biennium, but we need to be realistic. For this reason that we propose in the Executive Committee approved, this reduction is a reduction of 7% on the total budget, 5.4% on basic programs. Basic programs are all the technical programs, with the exception of public health emergency response. So this is already a reduction that I think that's more realistic than the original budget that was proposed. But as Ronnie Maza mentioned, we are talking about an envelope that we need to fill with the real funding that we receive. Very important part of this funding comes from the assessed contributions that the member states pay. Other part is the voluntary contributions that we are mobilizing, and we are doing an extraordinary effort to diversify our donors, our partners, and also to increase the volume. Another part from WHO, and another one from other sources that we have. As Ronnie Maza mentioned, due to our financial regulations, we need to plan in advance, counting that we will receive 100% of the assessed contribution. And why is that? Because assessed contribution should be a commitment by member states. Should be a commitment. Should be a commitment that brings together all the member states of the organization to support the activity of that international organization. For this reason that all international organizations, they plan in advance, relying that 100% of the assessed contribution will be paid. So we'll have this situation. I can tell you that PAHO, when we compare with other organizations, we are a lean organization. And we didn't make the mistake to increase the structure of the organization, the number of staff, based on the voluntary contributions that we received during the pandemic response. Others didn't do that, and now they are facing more challenges than we are doing. Just to tell you an example about how prudent we were in the current biennium, all the new positions that were approved were limited duration positions. So this, I think that, I think that the member states that participate in the executive committee meeting clearly view that the number of staff of the organization is almost the same that we had several years. For several years now, we have almost the same number of fixed-term positions in this organization. We increase the number of consultants because we are mobilizing more voluntary contributions, and to implement this voluntary contribution, we need to hire more consultants. But the fixed-term positions are almost the same. We have almost the same numbers that we had for several years now. Secondly, we implemented some important initiatives to reduce the cost of the organization. I think we already mentioned the Shared Service Initiative Hub that will move from Washington, D.C. to a low-cost country, several enabling operations that can be performed in another country, and also will provide more efficiency due to the standardization of the processes to the organization. For this reason, that we think that is important, the approval of this budget. But for the sake of transparency, I'm telling you that we are in the process of the biennial working plan and the human resource for next biennium, and all the entities are preparing two scenarios. One scenario is that, like the current biennial and the previous biennial, we receive all the funding that we are expecting, but we are also preparing a scenario with a 20% reduction. This process will be completed by November, and after the end of this process, I will brief our member states about the results, what are the activities that you need to reduce, what are the opportunities that we are identifying to reduce overlapping, to provide a more efficient way to deliver our technical operation, but also what are the activities that we will need to sunset or to postpone due to these challenges, financial challenges that we are facing, not only PAHO, but I think that unfortunately all the international organizations. So I think that it's important to have this budget, and someone could ask, but why PAHO is not proposing, the Secretary is not proposing a reduction, not only the 7%, but maybe a more important reduction, because this is the budget, this is the envelope. So there is no problem if you can only fill 80%, 75%, 90 or 95% of this budget. But it's important to have this budget as our goal to look for resources, to talk with the member states to pay the assessed contributions, to talk with the donors, the partners, to be more generous with the voluntary contributions so we can fill this envelope and to develop the activities that you are tasking us to do, and totally aligned with the prioritization process that all the countries have contributed to with the Secretariat to have very clear what are the priorities that you point out that the organization should work on. So I really want to thank you for your comments. Also during the Executive Committee, we had a very good conversation, a very good discussion about the budget, and let's work together to mobilize all the sources that we have ahead, but at the same time to be very realistic and very prudent with the planning process that we are performing at this moment in the organization. Thank you, Mr. President.
Thank you, Dr. Barbosa. I would like to inform that this document contains two proposed resolutions. I propose we take them one by one, and I will now ask the rapporteur to present the first resolution, Program Budget of the Pan American Health Organization 2026-2027, Addendum 1.
Proposed resolution. Program Budget of the Pan American Health Organization 2026-2027. The 62nd Directing Council, PP1, having considered the program budget of the Pan American Health Organization, document CD 62/5, BP2, considering the report of the 176th session of the Executive Committee, document CD 62/2, BP3, noting the efforts of the Pan American Sanitary Bureau, PASB, to propose a program budget that takes into account the health situation and context, the priorities for technical cooperation identified with member states of the Pan American Health Organization, and the shared responsibility of member states and PASB in achieving public health mandates, BP4, welcoming the focus of the PAHO program budget 2026-2027 on the acceleration required by or to advance the implementation of the PAHO strategic plan 2026-2031, PP5, bearing in mind Article 14C of the Constitution of the Pan American Health Organization and Article 3, paragraphs 3.4 and 3.5 of the Financial Regulations of the Pan American Health Organization, resolves OP1 to approve the program of work of PAHO with a budget of $662 million for base programs and $100 million as a placeholder for special programs as outlined in the program budget of the Pan American Health Organization 2026-2027. Official Document 375, OP2, to encourage all PAHO member states, participating states, and associate members to continue to make timely payments of their assessed contributions in 2026 and 2027 and of arrears that might have accumulated in the previous budgetary period. OP3, to encourage member states, participating states, and associate members to continue advocating for an equitable share of the World Health Organization's resources and specifically for WHO to fully fund the budget space allocated to the region of the Americas. OP4, to encourage member states, participating states, associate members, and observer states to make voluntary contributions that are aligned with the PAHO program budget 2026-2027, and, where possible, to consider making these contributions through core voluntary contributions to increase sustainability and predictability of funding for the program budget. OP5, in establishing the contributions of member states, participating states, and associate members, assessed contributions shall be reduced by the amount standing to their credit in the tax equalization fund, except that credits of those states that levy taxes on the emoluments received from PASB by their nationals and residents shall be reduced by the amounts of such tax reimbursements by PASB. OP6, to finance the approved base programs from the indicated sources. There are two columns, source of financing and amount in US dollars. First line, net assessed contributions from PAHO member states, participating states, and associate members, $194,400,000. PAHO budgeted miscellaneous revenues, $52 million. PAHO voluntary contributions and other sources, $160,800,000. WHO allocation to the region of the Americas, $254,800,000. Total, $662 million. OP7, to authorize the Director to use the sources of financing indicated above to fund the PAHO program budget 2026-2027, subject to the availability of funding. OP8, to request the Director to prepare a report on the implementation of the PAHO program budget 2026-2027, including the assessment of results to be presented to the governing bodies in 2028. That is all, Mr. President.
I yield the floor to the plenary for any comments and discussion. I see no requests. I will declare the resolution adopted. I will now ask the rapporteur to present the second proposed resolution. Assess contributions of the member states, participating states, and associate members of the Pan American Health Organization for the years 2026 to 2027, Addendum 2.
Proposed resolution. Assess contributions of the member states, participating states, and associate members of the Pan American Health Organization for 2026-2027. The 62nd Directing Council, PP1, considering that Article 60 of the Pan American Sanitary Code and Article 24A of the Constitution of the Pan American Health Organizations provide that the scale of assessed contributions to be applied to member states, participating states, and associate members be determined on the basis of the assessment scale adopted by the Organization of American States, PP2, bearing in mind that the Directing Council in Resolution CD 62R adopted the scale of assessments for the member states, participating states, and associate members of the Pan American Health Organization for the biennium 2026-2027, resolves, operative paragraph, to establish the assessed contributions of the member states, participating states, and associate members of the Pan American Health Organization for the financial periods 2026 and 2027 in accordance with the scale of assessments shown below and in the corresponding amounts. There is a table following this showing all the figures. Thank you very much, Mr. President.
Objections to the proposed resolution? I see none. I declare the resolution adopted. We have now reached a delayed coffee break, but before we go, I'm going to ask the Secretary to give us a...
Thank you, Mr. President. I would like to inform that the Committee on Credentials there's a second meeting, then will take place in room 714, 7th floor, during the coffee break to continue with the verification process. Thank you in advance.
Thank you so much. We will now take a coffee break. We will resume at 11:30, and we will continue on the agenda as published, item 2.3, then 5.1, and then 4.6. Thank you.
Antes, planear la adquisición de vacunas, medicamentos y suministros podía tomar a los países horas y múltiples hojas de Excel. Hoy, todo se hace en minutos en un solo portal. Este cambio inició en el 2023 con el lanzamiento del portal de Estados miembros de los fondos rotatorios de la OPS, una plataforma en línea para los países que permite centralizar la información y los procesos de compra del Fondo Rotatorio de Vacunas y el Fondo Estratégico. Cada año, los gerentes de programas nacionales de salud pública que participan en los fondos consolidan las necesidades de medicamentos, vacunas y otros suministros para sus poblaciones y las envían a la OPS, quien realiza una compra conjunta con todas las solicitudes recibidas de la región. En el pasado, los gerentes de programas realizaban estas solicitudes completando hojas de cálculo, pero hoy solo toma unos cuantos clics. Esta plataforma es una ventanilla única que agiliza el trabajo y fortalece la salud pública.
parece que es algo muy positivo para nosotros, nos agiliza mucho más. Obviamente estamos viendo que todo se va modernizando y se van generando herramientas digitales, me parece que está muy bueno.
Tras su lanzamiento, el portal ha incluido mejoras, como un rediseño de su interfaz y 2 nuevos módulos en junio de 2025. Seguimiento a finanzas y compras, con los cuales los usuarios pueden monitorear recursos, línea de crédito y el avance de sus pedidos en tiempo real.
Nos permite dar seguimiento a nuestros pedidos, a nuestros inventarios, a nuestras necesidades, y eso siempre representa una ventaja para el funcionamiento de la cadena de suministros, especialmente para nuestras instituciones que somos prestadores de servicios de salud.
Tras 2 años de su lanzamiento, el portal tiene 800 usuarios activos. Los módulos de finanzas y compras se han consultado más de 1.500 veces y ha permitido la entrega oportuna de los planes de demanda anuales por su facilidad de monitoreo en tiempo real.
I'm happy for the digitalization. This is an easier way of doing it.
Los fondos rotatorios regionales de la OPS continuarán buscando mejorar la experiencia y la transparencia en la información, facilitando así la rendición de cuentas en sus Estados miembros para ofrecer cooperación técnica sólida, demostrando que juntos somos más fuertes.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Yo me llamo Daniela Gómez, me dedico a pintar, ilustrar y hacer murales también, pinturas en formatos grandes sobre nuestro entorno, con nuestra cultura. Me gusta mucho pintar.
Está muy bonito y muy alusivo a lo que en estos momentos está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del Foco Sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
Entonces nosotros queremos mediante el arte poder llegar a la gente y poder invitarlos a que lo vean como algo amable, que se dejen de lado los mitos de que es algo malo y pues tomen la decisión de vacunarse para salvar las vidas.
Tu salud es tu poder. Claro que sí, porque es lo más indicado. Uno puede tener muchas cosas y puede tener todo, digamos. Pero si no tiene la salud, que es lo primordial, no puede disfrutar, no tiene nada si no tiene salud.
Estamos haciendo este mural como parte de una estrategia para llegar a la comunidad, para sensibilizarlos de la importancia de la vacunación. Queremos que la comunidad entienda que acceder a la vacuna es de manera gratuita, que es solo una dosis para prevenir la enfermedad durante toda la vida y que es el poder que nosotros tenemos como personas, como humanos, para enfrentar este brote de fiebre amarilla en el departamento del Tolima y en todo el país.
Me parece excelente idea para que la gente tome conciencia y se vacune.
Me siento inmensamente agradecida que este proyecto se haya cumplido, que es un sueño hecho realidad.
Con el trabajo conjunto con el Ministerio de Salud Pública y Protección Social, la Secretaría de Salud del Amazonas, el personal de salud en este hermoso territorio y el apoyo del Gobierno de Canadá, se ha logrado instalar un puesto de vacunación autosustentable en La Chorrera, que nos va a permitir almacenar vacunas y otros elementos, la distribución y hacer que la vacunación sea una realidad permanente en La Chorrera y los territorios, las veredas aledañas.
Uno de los puntos autosostenibles es este, que tuvo una inversión aproximada de 380 millones de pesos, más o menos $93.000. Estos recursos han permitido la modernización del punto de vacunación de La Chorrera y mejorado la calidad de prestación del servicio de vacunación en esta zona.
Cuando la Organización Mundial de la Salud sueña con la cobertura universal en la salud, es esto, que todas las personas, sin diferencia, sin distinción, puedan tener acceso a tecnologías sanitarias tan eficientes y que han salvado tantas vidas como son las vacunas.
Acá en Chorrera tenemos 22 comunidades.
Nosotros tenemos comunidades que nos podemos demorar hasta 5 horas en llegar. Las temporadas de sequía o las temporadas de invierno nos impactan también negativamente. Cuando esos largos veranos llegan, el río se seca.
La cadena de frío en río.
Que baje la cava a hombro o el termo de vacunas a hombro por en medio de la selva, por trocha.
A las cercanas que están aquí si llegamos por tierra, caminando. Y ahora con esto, o sea, me favorece mucho porque pues ya puedo tener la funcionalidad del congelador eléctrico y el congelador 24 horas.
Decimos que es autosostenible porque tiene 3 principios fundamentales. El primero es que usando energías limpias manejamos energía solar al 100%, ya que en la comunidad no se tiene conectividad eléctrica, sino ciertas horas del día. Tenemos recolección de aguas lluvias y tenemos unos filtros que nos purifican el agua para que el agua en el servicio sea limpia para el proceso de lavado de manos, desinfección y también para la limpieza de los equipos. Y tenemos una antena Starlink que nos va a permitir tener el sistema de información, diligenciarlo en tiempo real. Nos va a mejorar esos atrasos que tiene el sistema de información. Nos va a permitir tener el servicio completo, como la norma lo dice, pero también como la comunidad lo necesita.
Y ha sido de conocimiento y mandato de los submayores de que las dos medicinas son muy importantes, la medicina tradicional y también la medicina occidental, desde todo el conocimiento que ellos tienen. Esos dos conocimientos, esas dos medicinas, tienden a cuidar la vida.
Nos permite brindar a la comunidad seguridad y confianza para que puedan volver a acceder al servicio de vacunación.
Creo que sí, se van a acercar más familias, las mamitas van a tener confianza en que sí, ya tenemos un punto apropiado donde ellos pueden llevar a sus bebés a vacunar con toda la confianza del mundo.
Ver este cuarto frío aquí en nuestra comunidad, en plena selva, mejor dicho, es un beneficio para la niñez hasta los adultos mayores. Gracias, muchas gracias, gracias a Dios, gracias a ustedes por este proyecto hecho realidad.
Este proyecto permite facilitar la logística y asegurar que la vacunación, que es un derecho fundamental de la salud, esté permanente para la población de La Chorrera y las veredas aledañas.
Eu só ficava com o olho parado olhando para cima. E eu me desesperei, eu achei que ela ia morrer.
Ele não respondia, a gente falava, ele não respondia. Usando fralda, né? Estava bem magro.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia. A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa.
E a gente ter um método diagnóstico rápido para ter certeza do que a gente está tratando faz muita diferença.
Melhorou do padrão ventilatório, também melhorou.
Agora eu já caminho um pouco sozinha, né? Evolucionei.
Aprendendo a caminhar de novo que nem um bebê.
Pra quem tava em cima de uma cama, sem falar, sem se mexer, isso é ótimo, né?
Eu me levantei, caí, tomava banho com a mãe, aqui consegui tomar banho sozinho, e agora sim, tudo eu agora.
Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS. Então eu chego até a me emocionar para falar deles. Mas que de fato é uma equipe que faz muita diferença assim, no trabalho aqui em Porto Alegre. E que tem muita vontade de mudar as condições materiais de vida das pessoas.
alineadas con la evidencia y con las recomendaciones de los...
Hola, hoy vamos a conocer el alfabeto de las hepatitis virales. Las hepatitis A, B, C, D y E pueden dañar el hígado y muchas de ellas se transmiten por contacto sexual. Comenzaremos explicando qué es la hepatitis viral. La hepatitis es una enfermedad causada por un virus que provoca la inflamación del hígado y puede producir epidemias, cáncer de hígado y hasta la muerte. Los síntomas de los 5 tipos de hepatitis son similares: fiebres, náuseas,
Honorable Ministers, delegates, we now move on to agenda item 2.3. The first report of the Working Party to study the application of Article 6.b of the Constitution of the Pan American Health Organization. I now yield the floor to the delegate of El Salvador, chair of the working group, to present the first report.
Muchas gracias, Presidente.
Thank you, Mr. President. The report of the working group to study the application of 6B of the Constitution of the Pan American Health Organization. 1. The working group established to study the application of Article 6B of the Constitution of the Pan American Health Organization met 29th of September of 2025 to examine the situation of the collection of assessed contributions in light of that which is established in 6B of the Constitution of PAHO as regards the suspension of the right to vote of any member state that has arrears exceeding the amount of the corresponding quota of 2 years of their quota. Now, in Article 6.5 of the financial regulations of PAHO, it is established that it be considered that the annual assessed contributions are only 1 year late at January 1st of the following year. Article 6B is applicable to those member states that have pending the payment of their payments corresponding to 2022 and prior years. Number 2, it falls to the working group to recommend if we should reestablish the right to vote of countries according to Article 6B. The directing council may allow said member to vote if it's considered that the payment or not the non-payment is outside of the control of the government. 3, the members of the working group are the delegates of El Salvador, Jamaica, and Uruguay, presided over by the working group, that is the delegate of El Salvador presides over that group. 4, at the time of the opening of the 62nd Directing Council, one member state was in that situation under 6B. 5, the Bolivarian Republic of Venezuela owes 18,220,000, 16 million of the corresponding assessed contributions of 2017 to 2024, as well as 2025, which is 1,700,000. The Pan American Bureau sent formal communications to the Bolivarian Republic of Venezuela regarding its situation under 6B in February and August of 2025. 6. In 2020, at the opening of the 58th Directing Council, the right to vote of the Bolivarian Republic of Venezuela was suspended in accordance with that established in 6B of the Constitution. At the beginning of that session, the Bolivarian Republic of Venezuela had pending the contributions that were from 2017 to 2018 and through 9 and 2020, 7,854,000. In the application of 6B and the resolution CD 58.R8 of 2020, CSP 30R5 of 2022, CD 70R7 of 2023, and that which corresponds to 2021, the right to vote of the Bolivarian Republic of Venezuela continues suspended at the time of the opening of the 62nd Directing Council. The Bolivarian Republic of Venezuela has not made any payment toward its assessed contribution since May of 2017, nor has it presented a deferred payment plan since the 54th Directing Council in September of 2020. 9. The working group analyzed Article 6B of the Constitution of PAHO and it also looked at those resolutions, CD15R2 of in which it calls for the government that has any pending contributions to establish a payment plan with the office and that it actually comply with it. The Directing Council, should it have done that, could allow the country to exercise its right to vote. 10, the working group has analyzed and debated the delay in the payments by the Bolivarian Republic of Venezuela, noting that its participation in technical cooperation offered by PAHO, as well as its right to intervene at the directing bodies, would not be affected by application of 6B. The working group underscored the importance that that receiving those assessed contributions as approved by member states and recognizes fully that when those amounts are not received on time, that jeopardizes implementation of those activities that are called for, including the very continuity of the organization. Recommendations of the working group. 11. The members of the working group noted that the assessed contributions of PAHO members are an important part of those resources that support the program budget of PAHO, and that arrears and those pending contributions that have accumulated from prior years, as well as the assessed contributions currently, could have an impact on the organization's ability to fully execute its technical cooperation programs. Members also expressed their concern about the state of the arrears of Venezuela going back to 2017, observing, furthermore, that the Bolivarian Republic of Venezuela has not presented a payment plan to the Bureau as called for in Resolution 15R12 to reestablish its right to vote. The members also expressed their dismay given this situation because and the lack of a payment plan, and owing to that, we recommend that the Directing Council continue to keep suspended the right to vote by Venezuela, and we will take a look at this situation in future sessions of the directing bodies. The members commended the member states who have done everything they can to meet their financial commitments vis-a-vis the organization. Thank you very much, Mr. President.
Thank you, El Salvador, for the report. Is everyone in agreement with the recommendations of the report? I see no objection. The report is approved. We move to agenda item 5.1, report on the collection of assessed contributions. I would like to bring document CD 62/11, REV 1 and Addendum 1 to the attention of the Council and invite Mr. Christos Casantonio, Director of Financial Resources Management of the Pan American Sanitary Bureau, to come to the head table. Thank you. I now yield the floor to the representative of the Executive Committee to report on the item.
Thank you, Mr. President. Item 5.1, report on the collection of assessed contributions. The Executive Committee was informed that as of June of this year, 3 member states were in arrears, to the extent that they were potentially subjected to provisions of Article 6B of the PAHO Constitution. The committee was also informed that 11 member states, participating states and associate members, had paid their 2025 contributions in full. 5 had made partial payments, and 26 had yet to make any payments at all for 2025. As of June 2025, the Bureau had been forced to use the entire balance of $50 million from the Working Capital Fund and an additional $10 million from the Special Program Support Cost Fund in order to meet commitments funded under the assessed contribution budget. In the committee's discussion, concern was expressed about the high level of outstanding contributions and the need to utilize the entire Working Capital Fund and additional unrestricted funding to meet financial commitments, a practice that was considered unhealthy and unsustainable. Member states were urged to honor their financial commitments to the organization, in order to ensure the continued provision of technical cooperation and the fulfillment of the mandates entrusted to it by the member states. The committee adopted Resolution CE 176R1, thanking those member states that have made payment in 2025 and strongly urging other member states to pay their outstanding contributions as soon as possible. Thank you, Mr. President. This concludes the report on this
Thank
item.
you. And I will yield the floor to Mr. Casaptonio to present the item.
Thank you, Mr. President. Director, distinguished delegates and colleagues, I'm pleased to present item 5.1. The assessed contributions from the member states constitute a significant part of the resources supporting the organization's biennial programming budget. Prompt payment of both the accumulated arrears and the current 2025 assessments is imperative for the organization to effectively implement the full program of work. Assessed contributions that countries have committed to pay annually are due on January 1st of each year. Under the International Public Sector Accounting Standards, these contributions are considered revenue for the relevant year, regardless of whether they have been collected or not. On this slide, you can see on the left in blue the collections per year, and we have an update as of September 2025. And on the right side, you can see the unpaid balances comparison September of previous year versus September 2025. You can see that the unpaid amount in 2025 is 116 million, including member states, participating states, and associate members. This is as of 26th of September. 17 members have paid their assessed contributions in full. 6 have made partial payments towards their 2025 assessed contributions. However, 19 members have not made any payment for their 2025 assessed contributions. As described earlier, one member state owed assessed contributions since 2017, Venezuela. This member state is in arrears and such that is subject to Article 6b of the Constitution. The total outstanding balance, including arrears, amounts to $18 million. As of August 31st, 2025, the organization had to fully utilize the 50 million of the Working Capital Fund and 16.5 million from the Special Program Support Cost Fund in order to meet commitments of the assessed contributions budget. The organizations look forward to receiving the balance of assessed contributions in a timely manner in order to implement fully the biennial program of work as approved by the member states. Thank you, Mr. President.
Thank you. I now invite the Directing Council to review the information presented in this document, provide any comments it deems pertinent, and consider approving the proposed resolution presented in Annex C. And I open the floor to the plenary to start the discussions on this document. The discussions on the resolution will take place once the rapporteur has read the proposed resolution. I see no requests for the floor. Director, do you have any comments? Oh, sorry. Brazil, sorry.
Thank you very much, Mr. President. Muito obrigado.
Brazil is grateful for the presentation of the report on collection of assessed contributions as opposed to the proposed resolution. We are fully up to date with our PAHO assessments. We are committed to the organization, but furthermore, this demonstrates the importance that we give to this entity. We want to support an international organization that is based on multilateralism and cooperation. Brazil sees with concern the lack of payments of the assessments that have not yet been made, which is $116 million at this point in time. We make a call together with PAHO for all member states, participating members and associates, made their full payment of their obligations. The fixed obligations is a crucial element for continuing the sustainability of the work carried out by PAHO in our region, in particular technical assistance that is such a benefit to so many of our countries. Thank you very much.
Thank you, Brazil. I now give the floor to Honduras.
Good afternoon, Mr. President, delegates. Honduras concurs that the collection of the assessed contributions be carried out under the principle of solidarity and equity in health, and commits to continue making its payments of the contributions. The larger countries help the smaller ones, and thus we benefit from the organization's support. And this allows us to implement our national strategies and align the regional ones in benefit of the population in general, and suggest to PAHO conduct the necessary actions in order to ensure this contribution and this payment of assessment that is benefit for all. Honduras calls upon member states to make updated payments of their assessed contributions, and thus encouraging continuity of the clearly defined processes. Thank you very much.
Thank you, Honduras. I see no further requests for the floor. Mr. Casap, Tonio, do you want to respond?
I want to thank the delegations of Brazil and Honduras for the comments and the support, and all the member states that have provided their payments in due time. Cash flow is very important. Of course, as we explained, we budget from the beginning of the year as if we receive the funds, but as more and more accumulation of arrears, of unpaid balances accumulate, it makes it really very difficult to implement the plans which of technical cooperations which we have approved. Even the 50 million of working capital that we have, it's always at a strain. Again, thanks again for your support and the prompt payment of the assessed contributions.
Thank you. Director, do you have any comments?
Thank you, Mr. Chair. Gracias.
I would like to thank members. As we made clear in the previous item, it is important for the contributions to be made because they're an important part of funds received by PAHO in order to operate as an organization and be able to provide the technical cooperation. So it's a very brief comment I want to make. I would ask countries to make an effort, in particular those who have not yet made their 2025 assessed contributions or who have arrears from previous years, to please make payment as soon as possible. Thank you very much.
I now ask the rapporteur to present the proposed resolution for consideration by the Directing Council.
Proposed resolution. The 62nd Directing Council, PP1, having considered the report on the collection of assessed contributions, document CD 62/11, Rev 1 and Addendum 1, and the concern expressed by the 176th session of the Executive Committee with respect to the status of the collection of assessed contributions. PP2, noting that the Bolivarian Republic of Venezuela is in arrears in the payment of its assessed contributions such that it is subject to Article 6b of the Constitution of the Pan American Health Organization. PP3, noting that as of 29 September 2025, 19 member states, participating states, and associate members have not made any payments toward their 2025 assessed contributions. PP4, noting that as of 29 September 2025, only $31,859,451 have been received of the current year's assessed contributions has been received, and as of 31 August 2025, 50 million of the working capital fund has been utilized, jeopardizing the full implementation of the biennial program of work for 2024-2025 as approved by the member states. Resolves. OP1, to take note of the report on the collection of assessed contributions, document CD 62/11, Rev 1 and Addendum 1. OP2, to express appreciation to those member states, participating states, and associate members that have already made payments in 2025. OP3, to strongly urge all members with outstanding balances to meet their financial obligations to the organization in an expeditious manner in order to efficiently implement the program budget for 2024-2025. OP4, to request the President of the Directing Council to notify the delegation of the Bolivarian Republic of Venezuela that its voting rights continue to be suspended as of this 62nd Directing Council. OP5, to request the Director to A. Continue to monitor the status of assessed contributions and the impact of delays on the financial health of the organization. B. Advise the Executive Committee of members' compliance with their financial commitments to the organization. And C. Report to the 63rd Directing Council on the status of collection of assessed contributions for 2026 and prior years. That concludes this report, this resolution, Mr. President.
Thank you. I now yield the floor to the plenary to begin discussions on the proposed resolution. I see no requests for the floor. The resolution is adopted. We now move on to agenda item 4.6, policy for expanding equitable access to high-cost and high-price health technologies. I would like to bring document CD 62/9 to the attention of the Council and invite Ms. Maria Luz Pombo Castro, Unit Chief of Quality and Regulation of Medicines and Health Technologies of the Department of Innovation, Access to Medicines and Health Technologies of the Pan American Sanitary Bureau to come to the head table. I now yield the floor to the representative of the Executive Committee to report on this item.
Thank you very much, Mr. President. Item 416, policy for expanding equitable access to high-cost and high-price health technologies. The Executive Committee expressed appreciation for the Bureau's effort to expand access to high-cost and high-price health technologies and build sustainable capacity for the production of medicines, vaccines, and other health technologies in the region. The policy's emphasis on enhancing capacity for health technology assessment was welcome. The emphasis on innovation and technology transfer was also applauded, although it was stressed that any sharing of technology, expertise, or proprietary information should be voluntary and on a mutually agreed terms. Delegates expressed support for the proposed use of the revolving funds as a means to increase the availability and affordability of health technologies and to strengthen the resilience and preparedness of member states in addressing the current and future public health challenges. In the discussion of the proposed resolution on this item, several amendments were suggested reflecting points raised during the discussion of the plan of action. Informal consultations were held to discuss the proposed amendments, but the committee was unable to reach consensus and therefore adopted decision CE 176D4, requesting the Bureau to facilitate the consultation process with member states during the intercessional period prior to this directing council. Thank you, Mr. President. This concludes my report on the item.
Thank you. And now you yield the floor to Ms. Pombo Castro to present the item.
Señor Presidente.
Mr. President, Dr. Barbosa, and distinguished delegates and colleagues, it is my pleasure to introduce Agenda Item 4.6, Policy for Expanding Equitable Access to High-Cost and High-Price Health Technologies. Today, we are gathered to face a priority challenge in public health to ensure that the benefits of high-cost and high-price health technologies may effectively reach our populations. Despite advances, citizens in the Americas still face structural obstacles to access health technologies. In a context of scientific advance and new available solutions, the true challenge is to ensure that these technologies are within reach of those who need them in a timely, sustainable, and more equitable way. To address this challenge requires a joint effort, dialogue, and regional collaboration. In carrying out this policy, member states identified concrete barriers that make it difficult to access health technologies, and these range from insulin to treatments for rare diseases or advanced therapies, and that may also affect the sustainability of health systems. We acknowledge this is a complex topic with coexistence of legitimate positions. Therefore, it is fundamental to understand and respond to the concerns of all parties involved and build bridges to reduce existing gaps. The objective is clear. Health technologies need to be affordable in a sustainable manner. Those present here, representing governments, have the enormous responsibility of protecting the health of citizens and in time manage limited resources. For this reason, to expand access to high-cost and high-price essential health technologies is a priority and a challenge that furthermore requires evidence, joint effort, considering the realities and capacities of each country. In June of this year, the Executive Committee at PAHO discussed the development of a new regional policy that we are presenting today for your consideration. This document that was drafted or prepared with active participation of over 28 member states provides a shared framework to promote collaborative solutions through 5 strategic lines of action identified as priority by the very member states. The first, to strengthen innovation and regional production capacities. For this, we want to promote the right environment through public investment, public and private investment and collaboration, and technology transfer to promote access from the very first phases of development. The second is to propose the selection to process and select incorporate health technologies and help reduce just judicialization, giving priority to evidence-based decisions and involving the judicial power through dialogue and development of capacities. The third strategic line of action seeks to strengthen regulatory frameworks and promote competition. The policy seeks to find balance between innovation, access, and safe ways for generics and biosimilars and encourage affordability without compromising quality. The fourth line of action, promote the use of PAHO's regional revolving funds as mechanisms for cooperation with who have shown their effectiveness to access these technologies that make it easier to procure them and support regional manufacturing. The last line of action, promote the generation and use of evidence and the monitoring of strategic data to inform decision-making through a regional platform to share information, training, and multi-sectoral dialogue. Approval of this policy is an important step forward to build a more resilient efficient and resolutive health system. Its implementation will be clear to translate the principles of solidarity and sustainability into tangible results. Lastly, we'd like to thank member states and technical teams whose contributions have made this interprogrammatic effort possible. With regards to the consultation process mentioned by the President, we'd like to report that the Secretariat received comments from the United States of America that were not or could not have be discussed with other member states and that are not reflected or included in the policy document or the resolution that we are presenting today. We invite the Directing Council to make its comments as it deems appropriate and consider adoption of the proposed resolution as a collective commitment to strengthen access to health technologies. Thank you very much.
The Directing Council is invited to review the information presented in this document and provide any comments it deems pertinent. The discussions on the proposed resolution presented in Annex A will take place once the rapporteur has read the proposed resolution. I now open the floor to the plenary for discussion on the document presented. I give the floor to Canada.
Thank you, Mr. President. Very briefly, we thank the Secretariat for the proposed policy, which reflects the sophisticated set of factors which member states can navigate and also influence to promote equitable access to health technologies. We also very much appreciate the important focus on bolstering the ecosystems that enable sustainable innovation, R&D, and production in our region. We are pleased to share a success from our own efforts in this area, having recently announced the production of the first made-in-Canada doses of a COVID-19 vaccine at a new mRNA vaccine biomanufacturing facility. Crucially, the policy highlights the importance of sharing member states' experiences and expertise across the life cycle of health technologies, and we welcome the Secretariat's commitment to facilitate ongoing exchanges. Thank you.
Thank you, Canada. I now give the floor to Guyana.
Thank you, Mr. President. Guyana, on behalf of Guyana expresses its appreciation to PAHO for advancing the policy on expanding equitable access to high-cost and high-priced health technology, which is timely, much needed, and aligned with the region's objective of universal health and reducing financial hardship for our most vulnerable population. We fully endorse the policy focused on regional cooperation, transparency, and evidence-based prioritization. Guyana specifically calls for strengthening of joint procurement mechanisms, especially for small island states, expanding technical support for health technologies and assessment, and cost-effective analysis, supporting innovative financing strategies to ensure sustainable access without displacing basic health services, and reinforcing regulatory systems and pool price negotiation across member states. Guyana reforms that equitable access to high-cost health technology is not a luxury, but a moral and a public health imperative. This policy, if backed by technical cooperation, financing innovation, and strong governance, can meaningfully shift the balance from exclusion to inclusion, especially for small states and vulnerable population. We look forward to collaborating with PAHO, other member states, and civil society to make this policy operational, transformative, and sustainable across our region. We thank PAHO for its leadership and call on all member states to work collectively to make equitable access to life-saving technology a regional reality. Thank you.
Thank you, Guyana. I now give the floor to Costa Rica.
Muchas gracias.
Thank you very much, Mr. President. Costa Rica recognized the importance of the policy for expanding equitable access to high-cost and high-price health technologies. We welcome that the process has gathered the observations of all member states, and we underline the importance or urgency of guaranteeing that these technologies reach in a fair, sustainable, and accessible manner to those who most need them. Our region faces important challenges when it comes to equity, financing, and sustainability. For this reason, there are three priority aspects we want to shed light on. First, the need to strengthen regional efforts for negotiation to negotiate fairer prices and facilitate joint procurement. Two, the importance of creating regulatory frameworks to promote transparency and efficiency when incorporating new technologies. And 3, the urgency to ensure sustainable financing without compromising the coverage of essential health services. Costa Rica supports the resolution, and we're grateful for the presentations we have heard today and reiterate our commitment to work with member states and with PAHO officials to move forward in concrete solutions to ensure that equitable access to health technologies become a reality for the populations of the Americas. Thank you.
Thank you, Costa Rica. I now give the floor to Antigua and Barbuda.
Mr. President, distinguished delegates, Antigua and Barbuda recognizes PAHO's comprehensive and research-based policy for expanding equitable access to high-cost and high-price health technologies, which addresses the challenges of inequitable access to high-cost and high-price technologies seen globally, and particularly in the Americas, where socioeconomic disparities propagate widening gaps. This policy highlights the need to improve availability and access to essential health technologies, including high-cost medicines and treatments for communicable diseases, chronic diseases, and rare conditions. Antigua and Barbuda is in a peculiar position as a country of the Organization of Eastern Caribbean States with a population of less than 110,000. We rely heavily on pooled procurement system, which tackles gaps in regulation and high importation prices. The Ministry of Health notes that the policy outlines key challenges that affect small island developing states, including limited negotiation capacity, lack of price reduction mechanisms, and the impacts of lack of transparency in procurement mechanisms. We support the lines of action found in document CD 629, particularly line action 4, promote the use of PAHO's regional revolving funds. Antigua and Barbuda is a beneficiary of PAHO's revolving fund for strategic public health supplies and the revolving fund for access to vaccines, which have been the foundation for the country's expanded program in immunization and cervical cancer elimination program. The regional revolving funds have improved the availability of and access to high-cost vaccines such as the Gardasil 9 and the pneumococcal conjugate 20 valent vaccine, PCV20. Training on safe vaccine handling and cold chain assessment has been incorporated into our national disease elimination strategies. Antigua and Barbuda commits to implementing the policy, which will involve monitoring, regular assessments, information sharing, and reporting on progress. We commit to the collaboration with PAHO as mechanisms and frameworks are developed to enhance healthcare in the region for the Americas. Thank you.
Thank you, Antigua and Barbuda. I now give the floor to the Bahamas.
Thank you, Mr. President. The Bahamas welcomes and commends the emphasis on equity, sustainability, and evidence-based approaches to expanding access to high-cost and high-priced health technologies, recognizing its critical importance, particularly for small island developing states like ours, where access to innovative medicines and vaccines is often constrained by limited fiscal space, market size, and dependency on imports. As a nation, the Bahamas is actively engaged in PAHO's innovations, leveraging the strategic fund and other financial support, such as the revolving fund, to secure high-cost medicines, vaccines, and diagnostics efficiently and cost-effectively. We have also benefited from training, education, and technical support from PAHO, particularly in strengthening health technology assessments, regulatory capacity, and sustainable financing tools invaluable to small health systems like ours. We strongly encourage enhanced regional convergence to help streamline the approval of alternatives and generics and move forward. By working together, member states can use collective bargaining power to negotiate more affordable pricing and implement pooled procurement mechanisms, ensuring equitable access across the Caribbean and the wider region, noting the proposed tariff increases on imported pharmaceuticals, which will drive up costs, strain health budgets, limit access to essential medicines, and risk stockouts of critical drugs. The Bahamas calls for continued emphasis on the unique challenges faced by small island developing states, including the high and limited markets and logistical barriers. A tailored approach combining enhanced use of health technology assessment, technical cooperation, and expanding the scope of PAHO's revolving fund, shared regulatory frameworks, data transparency, and innovative financing strategies to close the access gap will prove beneficial. Mr. President, in closing, the Bahamas affirms its commitment to implementing this policy and urges continual technical cooperation to ensure its successful implementation by using cost-effective funding, technical assistance, and regional collaboration to ensure that fair access to high-cost health technologies is not a privilege for some, but a reality for all members. Thank you.
Thank you, the Bahamas. I now give the floor to the Dominican Republic.
Thank you. The Dominican Republic appreciates the presentation of this policy, which seeks to broaden equitable access to high-cost and high-price health technologies. This is very important for the whole region. We recognize that unequal access to medications and devices continues to be a critical challenge in our region, especially for patients that face costly treatment and out-of-pocket expenses. We fully support the line of action proposed in this policy, the innovation and technology transfer of regional, or the use of regional revolving funds, and the promotion of regular frameworks that would facilitate access to new technologies. Our country has made efforts to ensure the availability of essential treatment, to strengthen primary health care, and to protect patients vis-a-vis catastrophic costs, reflecting the commitment to equity regarding the most vulnerable. We have tripled our budget to help these patients. However, the waiting list continues to grow, which shows just how urgent it is for there to be regional responses. Your Excellencies, we propose looking into a bioequivalency regional center, availing ourselves of the accreditation of some labs in the region to avoid duplication, to bring down costs, to harmonize regulations, to ensure the availability of bio equivalents and generic medicines at an accessible cost. We think we should take availability or avail ourselves of private centers, and that there should be collaboration of industry to ensure the scientific equivalency, bioequivalent and generic medicine, so that people have access to affordable, equitable medications, to broaden access to high-cost medicines, and also to enhance the economies or the savings of our healthcare system. We reiterate our commitment to the regional multilateral cooperation, because we believe that implementing this policy, as well as the technical analysis, as we propose, will strengthen our healthcare systems to offer timely access to those who most need these services. Thank you.
Thank you, Dominican Republic. I now give the floor to Brazil.
Thank you very much.
Thank you very much, Mr. President. Brazil is grateful for the presentation of this document, and we express our support to the draft resolution that establishes a policy for the equitable access to high-cost and high-price health technologies. We appreciate the work done by the PAHO team throughout this whole process, including the necessary negotiations and consultations for us to arrive at a consensus document. This is an important framework to strengthen the region's commitment to equitable access and to overcome structural difficulties that still persist in our systems. During the 61st Directing Council, we had already showed our support for this, that there be a new policy on this subject matter. We underscore how urgent it is for us to tackle technological dependence and to promote models of innovation and production that would not perpetuate inequalities. Today, we reassert this outlook because we stress the importance of there being a comprehensive approach taking into account the life cycle of technology, sustainability of the healthcare systems, and strengthening of local production as well as at the regional level. To that effect, we welcome the emphasis placed on innovation, technology transfer, the use of strategic revolving funds of PAHO, and the assessment of health technologies that be evidence-based. This is all important for health policies to be based on principles of efficiency, transparency, and equity. We would also like to stress the launch of the Coalition for the Local and Regional Production, Innovation, and Equitable Access of and the signing of the Geneva letter of the 68th World Health Assembly. This is an initiative that the President of Brazil at the G20 raised to ensure access to treatment for neglected diseases, and that could also be used for other diseases and health needs. We also, that is the agreement for pandemics, which was a landmark agreement in Geneva, something else we support. That's an agreement that recognizes the strategic importance of regional production and international cooperation to ensure fair and timely access to critical technologies in a context of emergencies. We also reiterate our support to this proposed resolution. We call upon all countries of the region to join in this collective commitment. We reassert our commitment to the implementation of this policy and to the principles enshrined in it and the concrete actions that need to be taken to make these technologies more affordable. Thank you.
Brazil, I now give the floor to Suriname.
Thank you, Mr. President. My name is Andre Misikaba, Minister of Health, Welfare and Labor, and this is my first time here, and I'm learning. On behalf of the government of Suriname, allow me to express my appreciation to the Pan-American Health Organization for the development of the policy for expanding equitable access to high-cost and high-price health technologies. This is a timely and important policy. Across our region, and certainly in Suriname, the rising cost of essential medicines, diagnostics, and innovative therapies continues to present barriers to equitable access and threatens the sustainability of health systems. For smaller economies and small population countries, these challenges are often even more acute, limiting our ability to provide timely and affordable care to those who need it most. We believe that this policy offers a critical framework to strengthen collective action, promote regional solidarity, and ensure that all member states, regardless of size or resources, can benefit from fairer pricing, improved procurement mechanisms, and enhanced regulatory collaboration. Suriname is committed to work with PAHO and fellow member states in rolling out this policy. We see this as a pathway not only to improve access to life-saving technologies, but also to advance equity and resilience in our health system. We thank PAHO for its leadership and urge continued support for implementation so that the promise of universal access and universal health coverage can be realized across the Americas. Therefore, Suriname supports this very important policy. Thank you, Mr. President.
Thank you, Suriname. I now go over to the Secretary for announcements before we take our lunch break.
Thank you, Mr. President. I'd like to remind delegates that we have a briefing session on advances the innovative approaches in the use of the regional revolving funds. This will take place in Room B during the lunch break. A light lunch will be provided for our delegates that are joining this briefing session, and we sure hope we see everyone there. Thank you.
Thank you. As I said just now, we've reached our lunch break. When we resume at 2:30, we will resume. We will start at item 2.1, the second report on the Committee on Credentials, and then we will continue this item 4.6, and when that is completed, we will go to item 4.5 and 7.5. This deals with NCDs and the strategy for prevention and control. And then 6.1. Then 6.1, obviously the very important PAHO award, we will have to do that this evening. Thank you. See you at 2:30.
Confusing, but we have the 4-7 and okay, the immigration.
I have children at home. I have 4 of them, so this is the 5th one. And it's first time in life I have to come to hospital to get my baby. My name is Sandra Francis and I'm from Yarong Paro Village, the beginning of Region 9. It's actually like 160 kilometers from here to there. And I find it strange from being far from home. But now I'm comfortable and as you can see, I find it like living with others and finding new friends, you know, and mixing around and we learn from each other in there.
Region 9 is a very vast area. We have 62 facilities. We have 5 sub-districts, and each sub-districts. The SIP Plus program came into existence in Region 9. So we had an online training course, and then we had face-to-face training, where the facilitators from Georgetown came down. The region is doing well in terms of maternal death because we haven't had a maternal death like 3 or 4 years now.
We enter the data into the computer. Whenever we have admissions, we enter them into the computer. When you pull up that mother's information, you will find it there, but in a hard copy, something you might not find the card anymore. It might be put away somewhere else that you can't find it.
I've worked at Georgetown Public Hospital before the system was implemented, so I know how it was to use the paper base. And transitioning to the electronic base, I have to tell you, it has been like such a great thing for us. I actually have a great example of when the system was very helpful to us. So we had a patient come in, she was unconscious, she actually had a seizure, so she was diagnosed with eclampsia. Being able to look at the system, we could tell like what her labs were right away, we could tell what her blood pressure was before, we could get a very clear picture of her trajectory throughout the pregnancy and up to when she was. We were able to tell her gestational age, we were able to know if to give her corticosteroids and how to best deliver her. So in the end, she had a good outcome.
This has been quite a transformation for our department, because prior to SIP, what we would have had is there was tremendous paperwork that had to be done.
When patients comes to admission, we used to have an increased surplus or increased volume of patients waiting for admissions. With the digital way, it's faster because physicians are pretty much aware of how the perinatology system works, so we input the information quicker and you don't have to do multiple copies in order to share to the different wards.
This is a very, very good decision-making tool in terms of maternal health policy and planning at the national and the regional level.
I think in Guyana over the last 4 years, we have made significant progress as it relates to reproductive health. We have PAHO, we have the Canadian government who has helped us. And so because of this assistance, we have accelerated what we've been doing. So I think in terms of sustaining what we've started, with our resources and with some help from our partners, we certainly would be able to sustain these gains.
My delivery date is anytime because I'm 38 weeks. Good. Yes. Yes. So I could feel my baby's really. I will stay. I have names, but I did not choose my baby name as yet. So when the baby born, then I will choose the names for my baby.
Today, we're going to tell you a story based on real events. By Dengue, Chapter 4, Dengue Warning Signs. Felipe had been resting at home for several days after the staff at the health center told him he had dengue. He had followed all the advice, drinking oral rehydration salts and water, using a mosquito net over his bed, and taking proper precautions. And his fever had gone down. "I don't have a fever anymore," he said, though he still had other symptoms. When he got out of bed, he felt extremely tired and a little dizzy. Soon after, he developed a strong stomach ache and felt like throwing up a number of times. When he looked in the mirror, he noticed a small nosebleed. He then remembered what the doctor had told him before sending him home. If you feel dizzy, have severe stomach pain, feel very tired, restless or anxious, repeated vomiting, fainting, or notice any bleeding from your nose, gums, vomit, stools, or urine, you must return to the hospital right away. So, without thinking twice, Felipe called Viviana, and in no time, they were on their way to the hospital to ensure everything was okay. Because taking care of your health is what matters the most. And the sooner you notice a warning sign of dengue fever, the sooner you can save lives. So, that's all, folks. But remember, always take care of your health.
With the rising prevalence of non-communicable diseases, the Ministry of Health and Wellness Belize, supported by the European Union's Health Sector Support Program, EUHSSP, and PAHO, is proactively strengthening its health system. Through the development of targeted policies and collaborative frameworks, the nation is addressing these challenges on multiple fronts. From integrated primary care services, building capacity of healthcare workers, to empowering communities, strengthening health systems, saving lives.
In Belize, over the last 5 consecutive years, non-communicable diseases have been in the top 5 causes of morbidity and mortality for our country. So we knew that we needed to address this head-on. We were able to successfully launch our nutrition policy, and we're able to put a nutrition plan with objectives onto this policy.
And the support that is being provided to the Ministry of Health and Wellness for the development of the National Cancer Plan and the National Cervical Cancer Plan will also contribute to ensuring the management of non-communicable diseases.
By defining clear objectives and strategies, we are building a future where NCDs are effectively managed and the health of our population is prioritized. Integrated health service delivery networks are revolutionizing healthcare delivery in Belize. By ensuring comprehensive care at the primary level and bringing services closer to where people live, these networks are making a significant impact.
Through integrating the comprehensive management of non-communicable diseases such as hypertension, cardiovascular disorders, also mental health conditions, this really helps to strengthen the capacity of primary care providers and also community health workers in the knowledge and understanding of prevention and management of these conditions.
By standardizing care with global best practices and introducing new treatment modalities, healthcare professionals are better equipped to manage chronic illnesses. Health education is a crucial element in preventing and managing NCDs.
Through PAHO, we have been able to successfully, over the last 12 to 18 months, do caravans in some of the least accessible places, very rural communities that had significant population. So the health caravans were basically fair for the community to come out, learn more about health in different aspects. The blood pressure was done, your weight, your height, your body mass index. The pharmacist was there, nutritionists were there to give nutrition counseling. It was just an effort to try to improve health literacy in the hardest to reach populations.
By empowering communities with knowledge and education, we can inspire behavioral change and improve overall health outcomes. Access to essential medical equipment is vital in the early detection and management of NCDs. With the right tools, our healthcare providers are better equipped to serve the community.
There are a number of new blood pressure measuring devices that have come onto the market, but it is important to ensure that these are clinically validated so that the readings that we receive from them are accurate. In order to ensure that as we roll out the HEARTS initiative for the proper management and control of hypertension, we want to ensure that the equipment that are being used in the primary care facilities have been standardized.
The National Cancer Plan and the National Cervical Cancer Plan are groundbreaking initiatives aimed at reducing the burden of cancer across the country.
Through the EU project, PAHO has been able to give us tremendous technical cooperation for us to have a very solid and usable plan when it comes to reduction of all cancers, not just cervical cancer, but it's the National Cancer Plan.
The important thing about cancer and any cancer plan is to ensure that it is very comprehensive and covers the broad spectrum from prevention to rehabilitation and to care at the end of life. In addition to that, the clinical management. How do you diagnose? How do you manage these conditions? Which medications to use? So those are components that are also in the plan.
Together, with the support of our partners and communities, we are building a healthier, stronger Belize. One step at a time, we are ensuring better care for NCDs through integration in primary health care.
En nuestra región, donde las distancias y la dificultad para el acceso a los servicios de salud se han transformado en una problemática frecuente, la telesalud se presenta como una solución innovadora y accesible. La telesalud combina la tecnología con los servicios de salud para llevar la atención a quien más lo necesita, sin importar su ubicación. Desde consultas virtuales hasta seguimiento de patologías de manera remota, estas herramientas están transformando el acceso a la salud. La Organización Panamericana de la Salud, OPS, está apoyando este cambio a través de su propuesta de telesalud. La OPS ofrece una plataforma todo en uno para el registro clínico electrónico y la realización de videoconsultas, que está disponible como bien público digital. Además, la OPS proporciona recursos educativos mediante estrategias de simulación que capacitan a los profesionales, permitiéndoles brindar atención de calidad. Esto incluye un telekit, que consiste en dispositivos médicos seleccionados para el seguimiento de patologías crónicas a distancia y una caja de herramientas con recursos para implementar programas de telesalud.
Súper buena, porque no se demoran en llamarla. Entonces la hora se la dan por el mismo teléfono. Entonces no es un tema que uno tenga que venir para acá como lo hacía uno antes, que levantarse temprano. Lo encuentro súper bueno. Pues me manejo mucho en esto internet, así que le dije a mi hija que me enseñara cómo era el tema y es súper fácil.
Más cómodo para uno, no estar saliendo de la casa, lo puede hacer a cualquier hora, yo que trabajo todo el día.
La telemedicina acerca a los profesionales con sus pacientes, cuidándolos en tiempo real, mejorando el manejo de su salud y acercándoles cuidados de calidad.
Minha formação acadêmica está na área da telesaúde. Minha profissão é na área da telesaúde. Isso aí, para mim, É como fosse realizar um sonho que está acontecendo.
En conclusión, la telesalud está dando acceso a muchos pacientes. Con la OPS apoyando estas implementaciones, se están reduciendo brechas, mejorando la calidad de vida y proporcionando a cada persona la atención que merece. Es hora de sumarse.
Amid a challenging security environment, vital work by the Ministry of Public Health and Population is strengthening routine immunization services in Haiti. Supported by PAHO and funded by the Canadian government through the Can Give initiative, these efforts seek to ensure equitable access to life-giving vaccines for vulnerable communities and groups, including girls and pregnant women. Through 3 regional exercises, 105 department-level trainers receive important updates on vaccination norms and protocols, including on COVID-19 vaccines, which have been integrated into Haiti's national immunization program. Through cascade training, these regional trainers then share their knowledge with nearly 400 health providers. In addition, 124 health providers involved in epidemiological surveillance were trained in specific protocols for surveillance of vaccine-preventable diseases. And 221 health facilities benefited from supportive supervision to ensure their compliance with vaccination quality standards. In 2024, more than 421,000 Haitian children received critical vaccinations through catch-up campaigns and routine services. And as Haiti faced recurring cases of deadly diphtheria, PAHO supported the vaccination of more than 340,000 children against the disease.
Oh oui, vaccin li gen an pile importance dans cadre routine et raison c'est parce que gen zone qui vraiment éloigné. Des fois, parents pas de possibilité pour les mener ti moun dans centre là pour les venir faire vaccin. Des fois, négligence parents tout et les nouveaux équipes souterrain comme ça vraiment aider parents yo, aider ti moun yo pour capable joindre vaccin dans localité côté qui yo vivre là.
Parler des maladies évitables par la vaccination, nous apprenons et diphtérie. Effectivement, c'est un cas de diphtérie suspect que l'équipe aidée là a fait réponse. Et nous en pleine activité de réponse. J'en ai remarqué, nous cherchons rougeole, rubéole, nous cherchons syndrome rubéole congénitale, qui est moins d'un an. Nous cherchons catankou paralysie flasse aiguë. Nous cherchons surtout Kaiti et moun qui gagne moins que 15 ans.
Hearts is an initiative of the Pan American Health Organization and the Ministry of Health, which aims to improve heart health and save lives by standardizing hypertension treatment, promoting healthy lifestyles, and strengthening primary health care.
The chronic non-communicable diseases are the leading cause of death in Grenada. Within the top 3, we have the cardiovascular diseases. For these reasons, we welcome the introduction of the Hearts Initiative.
At the core of the Hearts Initiative is the Hearts Protocol, which provides a standardized approach to hypertension management and cardiovascular disease prevention in primary health care. It includes standardized treatment, effective and accessible medications, risk-based care, team-based approaches, healthy lifestyle promotion, and the strengthening of primary healthcare systems.
The integration or initiation of Hearts has introduced a standardized approach to the way we manage high blood pressure patients.
The Hearts protocol includes simple, standardized, proven treatments and interventions that can be easily incorporated into primary health care.
As part of the Hearts program, we have standardized blood pressure reading, ensuring that all categories of staff know how to check blood pressure. So in case a patient comes to the facility, anyone can assist them in checking their blood pressure.
The Hearts Protocol emphasizes a team-based approach which expands the responsibilities of hypertension management beyond primary healthcare physicians to include nurses, pharmacists, nutritionists, and other healthcare professionals, so that they too play a significant role in saving lives.
As nurses, we ensure that our patients are compliant, making sure that they monitor their blood pressure as often as possible, take the medication, come to visit the doctor when they are low on the supplies, follow up with the nutritionist as well. And if they have any issues or concerns that they are, feel free that they can come in. If they're not feeling well, they could come in at any time and speak to any one of us for advice. And we can do the proper referral if it's hospital or to doctor.
So as nutritionists and dietitians within the healthcare, whether it's primary healthcare or secondary care, we employ what is called medical nutrition therapy. This involves doing a comprehensive assessment. We look at body measurements, we look at the biochemical markers, the labs and so forth. We look at lifestyles, we look at dietary indication, and we also do a full physical exam. Once we're completed, we do a nutrition diagnosis, and then we will recommend and put together a targeted care plan with interventions as to how we can get that person to improve the overall lifestyle. So whether it's becoming more physically active lifestyles, whether it's changing diet, whether it's ensuring that person gets adequate amount of nutrients and filling the gap where there are deficits. We know that if we can correct the diet, also if we can maintain an adequate foundation for health, we know that we can see better outcomes when it comes to heart health.
The Hearts Protocol emphasizes the use of effective, affordable, and widely available medications to improve hypertension management.
The medicines that we'll be using as part of the Hearts Initiative, they're somewhat designed to be less burdensome on the patient because the number of pills that the patients would be required to use to control their conditions are reduced, because now we are making use of combination therapy. So one pill will contain maybe your 2 high blood pressure medication that you're taking at present.
Medication that are available through the Hearts Initiative are heavily subsidized, right? Patients that are less than 60 would pay a small fee. Those who are over 60 and over, it would actually be free as per protocol that already existed.
Following the introduction of the Hearts Initiative, we anticipate better compliance among our patients. We anticipate a reduction in the number of individuals who have uncontrolled high blood pressure. And at the end, we anticipate that in the long run, a reduction in the number of complications and the number of deaths that we are seeing as a result of high blood pressure and cardiovascular disease.
El cáncer infantil afecta a miles de familias en el mundo cada año, generando angustia y sufrimiento. En la región de las Américas, los gobiernos, la OPS y sus socios se han unido en la iniciativa Cure All para afrontar este desafío y devolver la esperanza.
Desde el año 2019, la Organización Panamericana de la Salud, en colaboración con el St. Jude Children's Research Hospital, trabaja incansablemente para mejorar la detección oportuna del cáncer en niños, niñas y adolescentes. En Latinoamérica y Caribe estamos logrando que más países prioricen el cáncer infantil y lo incluyan en políticas públicas que contemplen actividades para promover el diagnóstico oportuno. En los últimos 5 años se ha incrementado por lo menos en 3 veces el número de países que cuentan con una guía nacional de detección precoz y sistemas de referencia. Ya estamos viendo los primeros resultados y se está logrando que más niños puedan llegar temprano a su diagnóstico, que más niños puedan tener estadios precoces de enfermedad y que amplíen la posibilidad de curarse.
En el Perú hemos logrado reducir el 50% del tiempo diagnóstico en un lapso de 5 años, principalmente desde la Iniciativa Mundial de Cáncer Infantil. El tiempo en el que los profesionales de la salud, médicos y enfermeras, demoraban para hacer el diagnóstico en niños desde la sospecha de cáncer se ha reducido de manera significativa. Actualmente, los niños y adolescentes llegan más rápido a los establecimientos de salud. Este logro es un trabajo conjunto desde el Ministerio de Salud a través de políticas públicas que impulsan la detección temprana de cáncer infantil, asimismo el fortalecimiento de las capacidades de los profesionales de la salud, la sensibilización de la comunidad para poder realizar un diagnóstico oportuno y, por supuesto, la participación de la sociedad civil organizada.
Hemos logrado disminuir en un 50% los casos de estadios avanzados de cáncer en los niños. Esto significa que más familias reciben un diagnóstico temprano y más niños tienen una oportunidad de vida, educando y sensibilizando al personal de salud y a la población.
La Organización Panamericana de la Salud pone a disposición de los países diversos recursos técnicos, como cursos virtuales, talleres y guías interactivas para fortalecer la capacitación de los profesionales de la salud, así como materiales para campañas de comunicación dirigidas a los padres y a la comunidad en general.
A través de Cure All Américas, también se está apoyando a los gobiernos en el monitoreo sostenible y uniforme de sus progresos, así como en la implementación de políticas de salud que fortalecen el acceso al diagnóstico temprano, tratamiento y cobertura financiera. Todo con un objetivo, un diagnóstico temprano que salve vidas y mejore el futuro de nuestras familias y comunidades.
Cada intervención en salud pública, cada acción coordinada y cada esfuerzo compartido son pasos hacia un futuro donde hay más niños que puedan superar el cáncer.
Un diagnóstico temprano salva vidas.
Es una enfermedad infecciosa que afecta principalmente a los párpados, posteriormente a la córnea y puede dejar invalidado a un paciente produciéndole una ceguera permanente e irreversible. Se contagia de forma directa, es decir, de persona a persona.
En especial los niñitos, digamos, se tocan y pueden estar dando la mano a otro niño y así se puede contagiar, ¿no?
Cuando ya tiene triquiasis ya se van sacando las pestañas, sino depilando, le estorba ya.
Esta enfermedad se ve principalmente en zonas con poca o ninguna sistema sanitario.
Donde no haya agua segura.
Con dificultad en sistemas de alcantarillado.
Han levantado ya hace más de un año un tanque, han puesto agua, han hecho pozos, pero el agua no es buena.
Cuando estamos mal de los ojos nos afecta, ¿no?
No solo en las flores, ¿no?, sino en distintas comunidades. Hay deficiencia, ¿no?, en el tema de lo que es salud y educación más que todo, ¿no?
Nunca me hablaron del tracoma. No sabía de esta enfermedad.
Nunca había escuchado del tracoma.
Para nosotros es por primera vez que han venido a ver los ojos de nosotros.
Nunca había escuchado esa enfermedad tracoma.
Nunca había escuchado de que se pueda contagiar la enfermedad tracoma así con la mano sucia.
Dentro del registro que nosotros manejamos como Ministerio de Salud, no tenemos incidencia, ¿no?, a nivel nacional, ¿no? Sin embargo, tenemos países vecinos en los cuales sí ha sido un problema de salud pública. Es por ello que estamos ejecutando este proyecto, que es una evaluación rápida para tracoma ocular en comunidades vulnerables, ¿no? Una vez termine este proyecto, nosotros vamos a tener la capacidad de poder determinar si tenemos o no y si realmente el tracoma ocular para nosotros es un problema en salud pública.
En esta actividad también hemos diagnosticado otras patologías además del tracoma y bueno, como Ministerio de Salud estamos programando ya actividades también para poder atender esta otra patología como son las cataratas y terrigio, que son de mayor relevancia en la población adulta o mayor. Estaremos visitando el departamento de Pando, las comunidades indígenas, posteriormente el departamento de La Paz, el norte de La Paz específicamente, porque son las comunidades indígenas que estamos priorizando para poder ampliar la cobertura en la búsqueda de la patología denominada tracoma. Esta enfermedad puede tratarse con una higiene adecuada. No se trata solamente de venir y curar, se trata de venir y enseñarles cómo cuidarse. Eso es más importante que, te diría, el mismo tratamiento por sí mismo.
Estamos a 15 kilómetros de la cabecera municipal que es San Lucas Tolimán.
y a 250 kilómetros de la ciudad capital de Guatemala.
Tuvimos una semana de capacitación bastante intensa en la cual nos dieron a conocer sobre tracoma, que era una enfermedad infecciosa prevenible, tratable y que es también una de las causas de ceguera a nivel mundial, que está producida por una bacteria que se llama Chlamydia trachomatis y que normalmente nosotros pues, podemos manejar a nivel domiciliar con tratamiento.
La enfermedad del tracoma, ¿verdad?, que es lo que estamos ahorita manejando, pues se ha dado en diferentes comunidades del país. Entonces lo que se quiere ahorita es verificar la prevalencia que existe esta enfermedad dentro de la comunidad. Entonces la temática es pues realizar visitas domiciliarias, realizar el examen ocular a todas las personas que vivan en la vivienda de 1 año en adelante, ¿verdad?, para detectar en qué tipo de población se está dando la enfermedad.
El cual consiste en una inspección exterior del ojo, ¿verdad? Luego se les solicitará a la persona muy amablemente a que pueda inclinar la cabeza hacia arriba y nosotros poder visualizar el párpado superior, ¿verdad?
Según la OPS, existen unos antecedentes en la cual se ha desarrollado esta enfermedad, por el cual pues estamos realizando estas actividades y es importante verificar en cada una de las casas, ¿verdad? Específicamente en los lugares más postergados, en donde existen pobreza, se podría decir también, como deficiencia de agua o la contaminación de letrina.
Esta jornada es muy importante porque viene a apoyar a las personas. Recordemos de que los puestos de salud quedan en los pueblos y hay personas que por el escaso recurso que tienen pues les es difícil y muchas veces también de repente sienten los síntomas, pero las personas no acuden a los puestos de salud.
Parte de la prevención para esta enfermedad sería el adecuado lavado de manos y cara, específicamente la región de los ojos. Entonces, dentro de los planes que nosotros tenemos es, aparte de realizar la evaluación, darle un buen plan educacional a la familia para que ellos puedan comprender la necesidad de la higiene que deben de tener en el domicilio. Aparte de eso, también tenemos que hay comunidades que tienen dificultades con el agua y también darles explicación de cómo poder utilizar el agua de mejor manera y que con eso pues, pueda mejorar el lavado o la limpieza general.
Conformamos parte del equipo nacional de tracoma conjuntamente con el apoyo de Canadá, Organización Panamericana de la Salud y parte del Ministerio de Salud también. Conjuntamente lo hacemos esto para detectar y eliminar la enfermedad de tracoma.
Welcome. Let's take a journey to understand how PrEP, or pre-exposure prophylaxis, can protect you from HIV. We'll explore the science behind this powerful prevention tool.
Oral PrEP are pills used to prevent HIV. But how exactly does it work?
Once you take the pill, it dissolves in your stomach and gets absorbed into your bloodstream, where it travels to areas where HIV might enter, like genital and rectal tissues. PrEP is made up of 2 main medications, tenofovir and emtricitabine. HIV typically targets CD4 cells, which are crucial for your immune system. But this is where PrEP steps in.
The medications in PrEP block the virus from replicating in CD4 cells, preventing it from establishing an infection.
By stopping HIV from copying itself inside your CD4 cells, eventually it dies off. This keeps your CD4 cells healthy and strong, effectively preventing HIV from spreading and thus transmission.
PrEP is highly effective when taken as prescribed.
It's a powerful tool that allows you to take control of your sexual health and live without fear. For those who prefer not to take a daily pill, there's an alternative called PrEP on demand or event-based PrEP. This involves taking 2 pills 2 to 24 hours before potential HIV exposure, followed by 1 pill 24 hours after the first dose and another pill 48 hours after the first dose. This method is ideal for people who don't have frequent sex and can't plan ahead. PrEP is recommended for people at higher risk of HIV, Side effects of PrEP are rare and usually mild, like nausea or headaches, and they typically go away after the first few weeks.
The best part, PrEP is over 90% effective at preventing HIV when taken as prescribed.
Talk to your healthcare provider to see if PrEP is right for you.
If using condoms isn't an option, PrEP puts you in control of your sexual health.
For more information, visit PAHO.org or talk to your healthcare provider today.
Life is better with PrEP.
On November 14, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force. In 2024, a century after the signing of the Code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita paho.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age, adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
Antes, planear la adquisición de vacunas, medicamentos y suministros podía tomar a los países horas y múltiples hojas de Excel. Hoy, todo se hace en minutos en un solo portal. Este cambio inició en el 2023 con el lanzamiento del portal de Estados miembros de los fondos rotatorios de la OPS, una plataforma en línea para los países que permite centralizar la información y los procesos de compra del Fondo Rotatorio de Vacunas y el Fondo Estratégico. Cada año, los gerentes de programas nacionales de salud pública que participan en los fondos consolidan las necesidades de medicamentos, vacunas y otros suministros para sus poblaciones y las envían a la OPS, quien realiza una compra conjunta con todas las solicitudes recibidas de la región. En el pasado, los gerentes de programas realizaban estas solicitudes completando hojas de cálculo, pero hoy solo toma unos cuantos clics. Esta plataforma es una ventanilla única que agiliza el trabajo y fortalece la salud pública.
Me parece que es algo muy positivo para nosotros, nos agiliza mucho más. Obviamente estamos viendo que todo se va modernizando y se van generando herramientas digitales. Me parece que está muy bueno.
Tras su lanzamiento, el portal ha incluido mejoras, como un rediseño de su interfaz y 2 nuevos módulos en junio de 2025. Seguimiento a finanzas y compras, con los cuales los usuarios pueden monitorear recursos, línea de crédito y el avance de sus pedidos en tiempo real.
Nos permite dar seguimiento a nuestros pedidos, a nuestros inventarios, a nuestras necesidades, y eso siempre representa una ventaja para el funcionamiento de la cadena de suministros, especialmente para nuestras instituciones que somos prestadores de servicios de salud.
Tras 2 años de su lanzamiento, el portal tiene 800 usuarios activos. Los módulos de finanzas y compras se han consultado más de 1.500 veces y ha permitido la entrega oportuna de los planes de demanda anuales por su facilidad de monitoreo en tiempo real.
I'm happy for the digitalization. This is an easier way of doing it.
Los fondos rotatorios regionales de la OPS continuarán buscando mejorar la experiencia y la transparencia en la información, facilitando así la rendición de cuentas en sus Estados miembros para ofrecer cooperación técnica sólida, demostrando que juntos somos más fuertes.
Our success has been through governments and the dedication and commitment of our health workers and our policymakers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Muy bonito y muy alusivo a lo que en estos momentos se está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del Foco Sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
Entonces nosotros queremos mediante el arte poder llegar a la gente y poder invitarlos a que lo vean como algo amable, que se dejen de lado los mitos de que es algo malo y pues tomen la decisión de vacunarse para salvar las vidas.
Tu salud es tu poder. Claro que sí, porque es lo más indicado. Uno puede tener muchas cosas y puede tener todo, digamos, pero si no tiene la salud, que es lo primordial, no puede disfrutar, no tiene nada si no tiene salud.
Estamos haciendo este mural como parte de una estrategia para llegar a la comunidad, para sensibilizarlos de la importancia de la vacunación. Queremos que la comunidad entienda que acceder a la vacuna es de manera gratuita, que es solo una dosis para prevenir la enfermedad durante toda la vida y que es el poder que nosotros tenemos como personas, como humanos, para enfrentar este brote de fiebre amarilla en el departamento del Tolima y en todo el país.
Me parece excelente idea para que la gente tome conciencia y se vacune.
Me siento inmensamente agradecida que este proyecto se haya cumplido, que es un sueño hecho realidad.
Con el trabajo conjunto con el Ministerio de Salud Pública y Protección Social, la Secretaría de Salud del Amazonas, el personal de salud en este hermoso territorio y el apoyo del Gobierno de Canadá, se ha logrado instalar un puesto de vacunación autosustentable en La Chorrera, que nos va a permitir almacenar vacunas y otros elementos, la distribución y hacer que la vacunación sea una realidad permanente en La Chorrera y los territorios, las veredas aledañas.
Uno de los puntos autosostenibles es este, que tuvo una inversión aproximada de 380 millones de pesos, más o menos $93.000. Estos recursos han permitido la modernización del punto de vacunación de La Chorrera y mejorado la calidad de prestación en esta zona.
Cuando la Organización Mundial de la Salud sueña con la cobertura universal en la salud, es esto: que todas las personas, sin diferencia, sin distinción, puedan tener acceso a tecnologías sanitarias tan eficientes y que han salvado tantas vidas como son las vacunas.
Acá en Chorrera tenemos 22 comunidades.
Nosotros tenemos comunidades que nos podemos demorar hasta 5 horas en llegar. Las temporadas de sequía o las temporadas de invierno nos impactan también negativamente. Cuando esos largos veranos llegan, el río se seca.
La cadena de frío en río.
Que baje la cava a hombro o el termo de vacunas a hombro por en medio de la selva, por trocha.
A las cercanas que están aquí llegamos por tierra, caminando. Y ahora con esto, o sea, me favorece mucho porque pues ya puedo tener la funcionalidad del congelador eléctrico y el congelador 24 horas.
Decimos que es autosostenible porque tiene 3 principios fundamentales. El primero es que usando energías limpias manejamos energía solar al 100%, ya que en la comunidad no se tiene conectividad eléctrica, sino ciertas horas del día. Tenemos recolección de aguas lluvias y tenemos unos filtros que nos purifican el agua para que el agua en el servicio sea limpia para el proceso de lavado de manos, desinfección y también para la limpieza de los equipos. Y tenemos una antena Starlink que nos va a permitir tener el sistema de información, diligenciarlo en tiempo real. Nos va a mejorar esos atrasos que tiene el sistema de información. Nos va a permitir tener el servicio completo, como la norma lo dice, pero también como la comunidad lo necesita.
Y ha sido de conocimiento y mandato de los mayores de que las dos medicinas son muy importantes, la medicina tradicional y también la medicina occidental, desde todo el conocimiento que ellos tienen. Esos dos conocimientos, esas dos medicinas, tienden a cuidar la vida.
Nos permite brindar a la comunidad seguridad y confianza para que puedan volver a acceder al servicio de vacunación.
Creo que sí, se van a acercar más familias, las mamitas van a tener confianza en que sí, ya tenemos un punto apropiado donde ellos pueden llevar a sus bebés a vacunar con toda la confianza del mundo.
Ver este cuarto frío aquí en nuestra comunidad, en plena selva, mejor dicho, es un beneficio para la niñez hasta los adultos mayores. Gracias, muchas gracias, gracias a Dios, gracias a ustedes por este proyecto hecho realidad.
Este proyecto permite facilitar la logística y asegurar que la vacunación, que es un derecho fundamental de la salud, esté permanente para la población de La Chorrera y las veredas aledañas.
¡Gracias, OPS!
Eu só ficava com o olho parado olhando para cima. E eu me desesperei, eu achei que ela ia morrer.
Ele não respondia, a gente falava, ele não respondia, usando fralda, né? Estava bem magra.
Tuberculose, criptococose e histoplasmose são as 3 principais infecções oportunistas que mais matam pessoas com AIDS hoje em dia. A diferença dos testes rápidos para os métodos convencionais é que em 30 a 40 minutos nós conseguimos saber qual é a infecção oportunista que está acometendo essa pessoa.
E a gente ter um método diagnóstico rápido para fazer, ter certeza do que a gente está tratando faz muita diferença. Agora eu já caminho um pouco sozinha, né? Evolucionei.
Aprendendo a caminhar de novo que nem um bebê.
Porque estava em cima de uma cama, sem falar, sem se mexer. Isso é ótimo, né?
Eu me levantei, caí, tomava banho com a mãe, aqui com cima eu tomo banho sozinho. E agora sim, tudo eu agora.
Nós somos um grupo que se sensibiliza muito com as questões de HIV e AIDS. Então eu chego até a me emocionar para falar deles. Mas que de fato é uma equipe que faz muita diferença assim, no trabalho aqui em Porto Alegre. E que tem muita vontade de mudar as condições materiais de vida das pessoas.
Hola, hoy vamos a conocer el alfabeto de las hepatitis virales. Las hepatitis A, B, C, D y E pueden dañar el hígado y algunas de ellas se transmiten por contacto sexual. Comenzaremos explicando qué es la hepatitis viral. La hepatitis es una enfermedad causada por un virus que provoca la inflamación del hígado y puede producir epidemias, cáncer de hígado y hasta la muerte. Los síntomas de los 5 tipos de hepatitis son similares: fiebres, náuseas, vómitos, dolor abdominal, erupciones en la piel, pérdida de apetito e ictericia.
Comrades, let us continue. We go to item 2.1, the second report of the Committee on Credentials. I now yield the floor to the delegate of Mexico, Chair of the Committee on Credentials, to present the second report of the committee.
Muchas gracias. Thank you very much, Mr. Chairman. Second report of the Committee on Credentials. In accordance with Rule 231 of the Rules of Procedure of the Directing Council, the Committee on Credentials, appointed at the first meeting, held its second session on September 30th, 2025 at 11:10 in the morning. The committee examined the credentials delivered to the Director of the Pan American Sanitary Bureau in accordance with Rule 4 of the Rules of Procedure of the Directing Council. The credentials of the delegates of the member states and participating states and associate members and observer states listed below were found to be in good order, and the committee therefore proposes that the Directing Council recognize their validity. Antigua and Barbuda, Argentina, Bahamas, Barbados, Belize, Bolivia, Brazil, Canada, Chile, Colombia, Costa Rica, Cuba, Dominican Republic, Ecuador, El Salvador, France, Grenada, Guatemala, Guyana, Haiti, Honduras, Jamaica, Mexico, Netherlands, Panama, Paraguay, Peru, St. Kitts and Nevis, St. Lucia, Suriname, Trinidad and Tobago, United Kingdom, United States of America, Uruguay, Aruba, Curacao, Puerto Rico, Portugal, and Spain. Thank you, sir.
Thank you. Thank you, Mexico. Is everyone in agreement? Is there no objections? I declare that the report is approved. We'll now return to item 4.6, and when we took our break for lunch, a number of countries had requested the floor.
We need a minute.
Peru, you have the floor.
Muchas gracias, señor presidente.
Thank you very much, sir. Peru expresses its gratitude for the information presented and the documents submitted. We stress the access and sustainability of health systems by including valuable initiatives such as the strengthening of the capacity of regulatory authorities based on harmonization and the inclusion of health technologies within a technical and legal sound framework that will promote social participation, transparency, and accountability. We reaffirm the commitment of Peru because access to high-cost technologies is not only a financial matter, but one of social justice and human rights. The high prices of innovative technologies endanger the sustainability of health systems as well as the judicialization of access to these and the dependence on imports that raises vulnerability before crisis. Therefore, we believe that the proposals are key on how to promote the production of regional innovation, to promote joint procurement and regional procurement, taking advantage of the revolving funds of PAHO, harmonize funds, particularly for high-cost medicines, to institutionalize the innovation of technologies, and subject the results by implementing managed results and transparency in strategic data through open platforms which constitute the roadmap to be followed in order to ensure access to safe technologies and cost-effective technologies. It is within that context that Peru has been developing significant progress in this field of optimization of its regulatory authority as specialized technical authority with a technical, administrative, and financial independence, as well as the inclusion of a technical and normative framework for the implementation of health technologies assessment through the national network of agencies of the assessment of technologies with the purpose of standardizing the process, thus ensuring methodological soundness, transparency, and by making sure that decision-making for the coverage of these technologies will be developed within the framework of an adequate analysis of the therapeutic value and the cost-effectiveness of each technology. For Peru, these guidelines constitute an important proposal that enables us to respond effectively to the growing development of disruptive, high-cost and price technologies, a significant out-of-pocket expenditure, and growing judicialization. At a regional level, the proposal favors the integration, the harmonization, regulatory standardization, and reduction of inequities. We respectfully submit to your consideration to include in Action Line 2 a mechanism of technical assistance and cooperation that will enable member states to share better practices in the processes of inclusion of a managed shared risk process, because it is a complex process that needs for technical, normative, and legal processes. We take note of what is pointed out in the document, and we support the proposed resolution submitted to us in this council. Thank you.
To Panama.
Gracias, señor presidente.
Thank you, sir. Panama welcomes with pleasure this policy, whose main purpose is to expand equitable access to health at high-cost technologies and high-priced technologies through strategies that will promote comprehensive public health approaches that consider the life cycle of health technologies, its contribution to quality of attention and care, and the greatest life expectancy that they offer to the population, as well as barriers of access, gaps, and opportunities. This integrated approach covers all health technologies, bearing in mind their impact on public health, the public budget, and the out-of-pocket expenses. The follow-up and the evaluation of this policy will be standardized with the framework of management based on results during the process of formulating the national health policy and its strategic guidelines for 26 to 25 in our country, which represents a historic opportunity in order to evolve from a fragmented model to the first model of a sectoral participation in Panama. We support this policy because it does offer a regional common framework with 5 strategic lines of action that have been prioritized in order to guide the work of member states and the Pan American Sanitary Bureau in connection with the expansion of access to health technologies, high-cost, high-price technologies, bearing in mind the epidemiological profile in the national context of the different countries. We are in favor of having concrete actions in order to reduce the barriers to access through comprehensive approaches and evidence-based by covering the whole life cycle of these technologies, from innovation and production all the way to their use. Last but not least, we greatly appreciate the support for the strengthening of coordination mechanisms, the platforms, and the collaboration, interinstitutional collaboration networks in order to promote synergies and the efficiency in technical cooperation, attempting to improve accessibility and availability of high-cost, high-price medicines in the region of the Americas. Thank you very much.
Thank you, Panama. I now give the floor to Guatemala.
No microphone for Guatemala. No microphone.
Muchas gracias.
Thank you, Mr. Chairman. These have designed integrated policies that allow us to improve access to medicines and other health technologies. The 8th Congress of the Cuban Party points out to prioritizing the National Program on Medicines, the effectiveness and control of pharmaceutical products, to develop and consolidate the natural and traditional medicine by stimulating its therapeutic process. The different programs established in concordance with the National Economic and Social Development Plan until 2030 have enabled us to establish follow-up to the policies approved. Amongst these, updating the National Medicine Program, the flexibilization and introduction of new forms of management in the network of pharmacies, and the development of natural and traditional medicine. There is a policy of generic drugs where 62% are of national production. The procurement and centralized distribution of wholesale medicines for hospitals are free, and the retail prices are protected by the states. As part of the legal provisions of the state, at the end of 2024, the National Committee on Forms was updated to ensure multidisciplinary and intersectoral processes of proposals of introduction studies or withdrawal of medicines. The basic cater of medicines and natural products for 2025 has 651 products, 401 of national production. 358 have level of distribution to assistance units, and 293 to community pharmacies. We've implemented the strategy for the rational use of medicines, having for that the National Network of Pharmacoepidemiology and the Program for the Efficiency of Resources in the National Health System. The surveillance of prescription is done on the basis of audits in assistance units and community pharmacies, where we assess the use of high-cost medicines. In order to strengthen these practices, we're interested in this tool in order to assess the quality of pharmaceutical services based on primary health care, which is valued for the implementation of the network of pharmacies. PAHO has been providing the country medicines and medical devices and supplies, standard kits as a response to large epidemic and outbreaks. Please allow me to conclude that the blockade of the United States continues to represent a halt for the development and strengthening of the national health system in Cuba. And only in the last year, the economic impact in the health sector reached $228,833,000 US dollars. Thank you.
Thank you, Cuba. I now give the floor to Guatemala.
Muchas gracias, presidente.
Thank you very much, sir. Guatemala would like to thank you for the presentation and acknowledges the importance of the policy to provide equitable access to health, high-cost and high-price technologies. It is a pleasure to see that the policy attempts to seek access for all people through integrated public health strategies that will consider the life cycle of health technologies. Along these lines, Guatemala has taken a significant step in beefing up a health system with the approval of the National Policy on Medicines and other health technologies. This policy responds to an urgent need by ensuring that our population will have timely, safe, and rational access to high-cost and high-price and quality technologies. Our policy is focused on 5 strategic lines, ensuring the quality and the safety of medicines and technologies, the sustainable state support, accessibility for the entire population without any distinction, the rational use, and transparency in all processes. Likewise, we promote mechanisms of international procurement and joint procurement in order to take advantage of scale economies and promote regional cooperation and promote solidarity amongst our peoples. However, we do acknowledge that we're still facing important challenges. There are challenges on adequate financing, the development of operational standards that will ensure effective implementation of the policy, in transparency of production and marketing costs, the establishment of fair prices, training and continuous updating of our health personnel, and strengthening institutional infrastructure. These hurdles call for urgent care, innovative solutions built on dialogue, evidence, and technical cooperation. Guatemala is committed to the implementation of effective strategies that will ensure equitable access to high-cost and price technologies, particularly those that are essential in order to provide care to rare diseases or those of high impact on public health. We know that this is a challenge shared by many countries in the region, and therefore we reaffirm our willingness to work together with all member states, learning from each other and building collective solutions. We are profoundly grateful for the support and the technical cooperation provided by PAHO throughout this process. This support will enable us to strengthen innovation and regional production of drugs, medicines, and technologies, taking advantage of platforms such as a regional innovation and production platform, expanding the use of regional funds that have achieved significant drops in the prices of technologies, treatments, and vaccines. Guatemala reiterates its commitment to health as a fundamental human right and the strengthening of regional mechanisms that will enable us to move forward towards universal, equitable, and sustainable coverage. Thank you.
Thank you, Guatemala. I now give the floor to Jamaica.
Thank you, Mr. President. Jamaica formally commends the Director and the Pan American Health Organization for the work done on preparing the policy for expanding equitable access to high-cost and high-price health technologies, providing a comprehensive analysis which clearly delineates the persistent regional challenges in accessing high-cost health technologies. The document effectively highlights critical disparities among member states, including insufficient negotiating power, underdeveloped regulatory capacity, and the significant fiscal burden associated with procuring essential health technologies. Jamaica endorses the resultant policy proposal as a vital guide for a collective, sustained effort to expand access to high-cost and high-price health technologies within the framework of the diverse epidemiological profiles and national context of member states. We acknowledge the 5 proposed lines of action intended to address the identified challenges. We note that Jamaica is already actively pursuing or contemplating initiatives aligned with these actions. Health technology assessment is currently being employed to evaluate new drugs for inclusion on our vital, essential, necessary drug list. Managed entry agreements are under assessment to ensure compliance with Jamaica's public procurement legislation. And legislative review is underway to incorporate regulatory reliance into our national drug registration process. We further acknowledge and endorse the regional revolving funds. Jamaica has successfully relied on this mechanism for vaccine procurement at affordable prices. While it has not yet been extended to our pharmaceutical products or technologies, we remain open to exploring its feasibility as an alternative or complement to existing procurement methods, with the aim of replicating the success achieved in vaccine acquisition. Jamaica also notes and supports the policy's call for increased use of generic and biosimilar medicines. Since the 1990s, through legislative reforms, we have empowered our pharmacists to substitute bioequivalent generics for branded medicines with patients' consent, thereby improving access to affordable treatment options. We welcome PAHO's proposal to establish a regional platform for evidence sharing and knowledge dissemination. In closing, Jamaica has reviewed the information presented in the document and formally supports the adoption of the proposed resolution. Thank you, Mr. President.
Thank you, Jamaica, and I'll give the floor to Paraguay.
Muchas gracias.
Thank you, Mr. Chairman. Paraguay strongly supports the policy being discussed because we believe this initiative is highly relevant to deal with a common challenge in our region, the limited access to medicines and innovative therapy because of their high costs, which leads to inequality and compromises the sustainability of our health systems. Our country recognizes the urgency to ensure access to therapy for rare diseases, and it is because it's a significant burden for families and health systems. We, therefore, have made steps forward in strengthening our regulatory framework for the cost and price of medicine through the National Health Surveillance System, ensuring the availability of safe, effective, and quality products that provide transparency and good practices. Likewise, the Ministry of Public Health has skilled workers whose experience can contribute in a significant way to the successful implementation of this initiative. Paraguay believes that for the policy to be really applicable, we need to make equity the central axis of any innovative therapy and medication. We also believe it's a priority to establish sustainable financing mechanisms that protect the viability of health systems. We need to strengthen the assessment of health technology and rules based on evidence, and reduce misuse through the reference lists, clinical guidelines, and a better interinstitutional dialogue. At the same time, we need to develop information systems and tracking systems for health results that allow us to rigorously measure the effectiveness, the safety, and cost-effectiveness of high-cost technologies. In the area of regional cooperation, my country would like to reaffirm its interest in actively participating in the joint procurement using the revolving fund to improve prices and availability. We are also willing to collaborate in developing pharmacoeconomy skills and abilities through methodologies that are standardized. We also believe in sharing experience learned through interinstitutional agreements or national agreements that could serve as a reference point for national coordination purposes. Thank you.
To Honduras.
Buenas tardes, presidente.
Good afternoon, Mr. Chairman. Honduras agrees with the policy to expand equitable access to high-cost and high-price health technologies because we acknowledge the urgent need to overcome the barriers that limit access to vital technologies for public health, specifically in a region such as the Americas, where the socioeconomic disparities and the high dependence on imports affect accessibility and availability. The document presents a clear update on the progress, challenges, and measures needed, with specific emphasis on making access greater, the fragmentation of the market, and the monopolic control of the market and high prices. The discussion of the Council has been very effective in helping us strengthen technical cooperation using evidence-based science, improving regulatory frameworks, and strengthening financing mechanisms. Honduras values this integrated effort that takes into account the whole life cycle of a technology, from the moment of innovation to being used at the regional level, promoting mechanisms such as the regional revolving fund to increase joint procurement and economy of scale. However, Honduras suggests including measures aimed at strengthening technological production transfer at the national regional level, supported by intellectual property policies that reduce imports and increase self-sufficiency. We also recommend intensifying the training of operators, health operators, to avoid having to use the courts to mediate, and establish media platforms that increase transparency and access. We also need to establish robust tracking systems and assessment systems to ensure financial sustainability and an effective health impact. Finally, Honduras reiterates its support to these improvements that will improve equity, efficiency, and sustainability, and access to high-cost, high-price health technologies. Thank you very much.
Go to Colombia.
Gracias, presidente.
Thank you, Mr. Chair. Colombia supports the views expressed in the proposal, supports the technical document, and believes the countries should reach a consensus on this. For us, it's satisfactory to see that the content presented is consistent with the reforms undertaken by Colombia in the last few years in order to provide more equitable and sustainable access to health technologies, particularly in the area of generic multi-source medications and the application of health evidence-based health technological strategies. We have improved our health system not only at the national level but also the regional one. We have moved forward the regional self-sufficiency plan, encouraged the National Agency of Medication that would allow us to improve and develop a common market and increase our regional and sub-regional capacity to produce vaccines and medication, and move forward towards integration and regulatory convergence amongst the region that meets the highest international quality standards, as well as safety and effectiveness, and are consistent with the WRR regulations that are being adopted. One of the major challenges our country faces is access to a high-cost medication. So we're very pleased that the organization is continuing to address this issue for countries, and we urge you to redouble your effort to move forward in the system for buying a high-tech medication through the revolving funds. In Colombia, we've been working with PAHO to centralized procurement of orphan drugs to improve coverage and more effectiveness. This is one of the main strategies faced by the health systems recently in order to provide equity. We highlight the need to have deal with the high cost and high demand medications for countries, and therefore improve the prices for countries. We agree with the importance of having the health system strengthen their institutional capacity by adopting intellectual property with a focus on the public's needs. For this, we need tools from the regulatory health authorities and procurement authorities to increase the coherent implementation of health policies, science, and trade policies. We therefore value this document because it refers to the Doha Declaration and on public health. However, we also appeal to not only adopting consistent legal frameworks that are agree with international organizations, that we take into account the APIC agreements, so that states that wish to make use of flexibility do not have to face diplomatic reprisal, because such action weakens the ability of a country to implement internationally recognized tools that protect public health. Colombia is committed to moving forward in improving the health of the region and thus provide universal health care. We're also working to adopt this document by consensus. Thank you.
Trinidad and Tobago.
Chair Director of PAHO, esteemed delegates, Trinidad and Tobago joins the many member states who have already welcomed this proposed policy on expanding equitable access to high-cost and high-price health. Our country continues to grapple with the growing burden of NCDs such as cancer, diabetes, and renal failure, which demand access to sophisticated and often costly medicines, diagnostics, and treatment modalities. The fiscal pressures posed by these high prices limit our ability to provide equitable care to all citizens, particularly the most vulnerable populations. We recognize the value of PAHO's emphasis on fostering regional cooperation, including mechanisms for pooled procurement and price transparency, which could substantially enhance negotiating power. However, we urge the Secretariat to also prioritize capacity building in health technology, assessment, and management to enable countries to make evidence-based decisions and optimize limited resources. We also call on PAHO to continue to support member states in advocating for sustainable financing options, including exploring innovative payment models and engagement with international partners to mobilize funds dedicated to high-cost technology. Finally, Trinidad and Tobago reiterates its commitment to collaborate with PAHO and all partners to implement this policy effectively, ensuring that advances in health technology translate into real health gains for our populations. We support the proposed resolution. Thank you.
Thank you, Trinidad. I now give the floor to Chile.
Gracias, Presidente.
Thank you, Mr. Chairman. Chile thanks you for the policy to expand equitable access to high-cost, high-priced health technologies, which deals with the toughest challenges that threaten health. We share the diagnosis on the multiple barriers to access in the region. In Chile, out-of-pocket expense on medication represents a significant part of health expenditures, and the cost has increased. We value the comprehensive approach that takes into account the whole life cycle of health technologies. This is an approach that's fundamental to deal with the cost of high-impact health technologies. In assessing health technologies, we have a system that links the evaluation of technology with the need to finance this through guarantee systems. We use regional funds from the organization to strengthen any information we've compiled at the regional level, as well as to share our experience with counterparts. In the regulatory framework, we've implemented significant changes to improve the system and strengthen our public health system. We're in the process of having biosimilar interchangeability and a reliance strategy for assessments and improved internal systems to keep high-level standards that comply with international standards. The revolving fund has evaluated the systems that have been shown to be effective. As a result, we've reduced price for hepatitis 6 and the vaccine against HPV. We have reconciled our regional demand for these funds, allows us to have purchasing power against concentrated markets and better access. We strongly support using this for high-cost technologies. We've seen some very promising first results, and we are awaiting what new technologies will be included. Strategy has adopted a multifaceted strategy for high-cost, high-price technologies, which includes shared risk agreements to improve access, to share financial risk with the providers based on effectiveness results, and a joint procurement of high-cost medications through the revolving fund of PAHO, the establishment of regulatory frameworks for diagnosis and high-cost technologies, the development of rules for biosimilar products. We believe that sustainability and equity are guiding principles and supports this policy at the regional level, and we promise to commit to the implementation of it by adapting it to our own national context and sharing experiences with other member states. We thank the PAHO for its leadership and hope to continue working in collaboration so as to achieve greater and more equitable, sustainable access to health policies in America. Thank you.
And this is for the benefit of the ministers and the delegates, but some of you are speaking a bit too quickly for the interpreters, so we're going to have to balance it. You're going to have to slow down, but yet you're getting 3 minutes. I now give the floor to Ecuador.
Muchas gracias, señor presidente.
Thank you, Mr. Chairman. Ecuador would like to express a special recognition to this Directing Council and the leadership shown by having significant progress in the policy to expand equitable access to high-cost, high-priced health technologies. This is a priority, not only for Ecuador, but all of our states, because these technologies, although they're innovative, still face financial, logistical, and regulatory barriers that limit their implementation. The document that has been presented gives us some very valuable strategies, as rigorous evaluation, fair prices, and innovative payment systems. Thus, Ecuador has made progress in this in several fronts. Through the strengthening of regulations with rules based on evidence and transparency, through consolidated procurement based on the principle of budget efficiency and access to more accessible and fairer prices, interinstitutional constitutions with academia to strengthen our technical capacities, the use of local and regional evidence that supports the most solid and informed decisions, and the exploration of innovative payments such as results-based payments or shared risks. We also acknowledge, however, that there's still some challenges left, and that's why we intend to continue working together with PAHO to look for more innovative negotiation systems, ensure their financial sustainability, close the regional gaps in knowledge and development, and ensure that new technologies reach all patients in an equitable manner. Mr. Chairman and distinguished delegates, Ecuador reiterates its imperative need to strengthen the assessment of health technologies by being more efficient and using more scientific effectiveness by buying consolidated and using new tools such as artificial intelligence, also to promote greater social participation. Only in this way will we be able to ensure sustainable financial models that have more fair prices. Finally, Ecuador supports the approval of this document, CD 62/9, because we believe this will contribute to having a more resilient, sustainable, and equitable health system throughout the region. Thank you.
Ecuador. And now I will give the floor to a number of non-state actors who have requested to make statements on this agenda item. I want to remind you, you have 2 minutes. I give the floor to International Federation of Medical Students Associations.
Good afternoon, Honorable Chairperson, distinguished delegates. My name is Ian, and I come on behalf of the International Federation of Medical Students Associations. We welcome the discussion of equitable access to high-cost and high-price health technologies. Across the region of the Americas, many life-saving technologies, from innovative medicines to diagnostic and therapeutic tools, remain inaccessible to large segments of the population due to financial, structural, and systematic barriers. The resulting inequities deepen health disparities and directly threaten progress toward universal health coverage and the Sustainable Development Goals. As future health professionals, we are concerned about the sustainability of health systems in the face of escalating costs and the moral imperative to ensure that innovation benefits all, not just the privileged few. Thus, we commend the PAHO's leadership in advancing regional dialogue and policies that balance innovation, affordability, and equity. Furthermore, we urge member states to strengthen regional cooperation and pool procurement mechanisms to reduce cost and enhance collective bargaining power. Increase transparency in pricing and technology assessments to support evidence-based decision-making. Prioritize investments in health systems, strengthening inclusion, workforce capacity, so that new technologies are integrated effectively and equitably. Ensure that youth and civil society are meaningfully engaged in shaping policies that will define the future of healthcare access in our region. In the Americas, inequity remains one of the greatest barriers to health. Expanding equitable access to high-cost technologies is not only a policy choice, but also a question of justice. We, as the next generation of health workers, stand ready to support this mission. Thank you.
Thank you. I now give the floor to the International Pharmaceutical Students Federation.
Honorable Chair, distinguished delegates, the International Pharmaceutical Student Federation Pan American Regional Office represents over 60,000 pharmacy students and recent graduates in 15 countries. Student pharmacists witness a stark reality. Cancer drug prices have risen from $12,000 annually in the early 2000s to over $120,000 today. That's several times the per capita GPD for any Latin American country. The Pan American Health Organization Strategic Fund procured over $800 million in health technologies in 2024, yet our members see patients in underserved communities unable to access life-saving biologics, gene therapies, and specialized devices. The International Pharmaceutical Student Federation Regional Office urges the Pan American Health Organization, World Health Organization to establish regional pooled procurement mechanisms with university-based research support for technological evaluation, and to support student-led initiatives developing innovative access models and affordability solutions for high-cost technologies. We stand ready to contribute pharmaceutical expertise to achieve equitable access to life-saving technology and strongly support the Pan American Health Organization's initiative to expand access to high-cost health technologies. Thank you.
Thank you. I now give the floor to the Latin American Federation of the Pharmaceutical Industry.
Presidente,
distinguidos delegados.
Mr. Chairman, distinguished delegate, the Latin American Federation of the Pharmaceutical Industry for Research and Development, thank you for the opportunity to participate in this space, and we value the leadership of PAHO in encouraging regional policies for equitable access to health technologies. Let me share 3 messages. First, the access should be flexible, sustainable, and based on therapeutic value and the safety of patients. According to the Weight Indicator 2025 study in Latin America, patients wait on average 67 months, more than 5 years, in order to have access to innovation, almost 3 times more than other countries. This affects their quality of life and demands more efficient regulatory frameworks, evaluations based on evidence that will benefit them clinically in their health. Second, health is an investment, not expenditure. The evaluation of results increases productivity. In Latin America, there's a gap in terms of health expenditure, both from public and total perspective. Closing this gap would strengthen our system, it would reduce the burden of disease, and would lead to more resilient and equitable economies. And third, the mechanisms, such as a strategic fund, guarantee sustainable access to innovation if it's based on a structured demand, on solid criteria and negotiation with industry. It requires good governance and evidence-based decisions, budgets and criteria that take into account the impact on public health and reliability, global access and agreements that are long-term. All of this will allow for effective implementation, whereas monitoring system will allow for good procurement policies based on the conditions of the market. We iterate our willingness to work with PAHO. The partnerships based on common goals will allow the Americas to make innovation on a timely, safe, and equitable basis.
I now give the floor to Public Service International.
Mr. President, distinguished delegates, PSI is a global trade union federation representing more than 30 million workers worldwide, almost 60% of them in the health sector. PSI supports this policy, and further we urge member states to address the structural causes of inequitable access, such as intellectual property regimes that give endless privileges to large transnational pharmaceutical companies. Otherwise, we will only be treating the symptoms. We welcome the recognition that exorbitant prices compromise public budgets and exacerbate inequalities, and also urge member states to pay sufficient importance to strengthening public production. It is unacceptable that gene therapies cost millions while health systems lack basic resources. In fact, pharmaceutical patents that guarantee billions of dollars in profits sound like a mechanism that transfer wealth from the poorest to the CEOs of such corporations. We strongly support the strengthening of regional revolving funds. We also understand that the health sovereignty of our region necessarily involves strengthening regional public production. However, intellectual property privileges are obstacles to such initiatives. Therefore, we are concerned that the document does not sufficiently question the intellectual property frameworks that perpetuate pharmaceutical monopolies. TRIPS flexibilities must be used assertively, strategically, and continuously. We need radical transparency in production costs and profit margins. We demand A, priority public production of essential medicine, B, the use of compulsory licenses and suspension of other intellectual property rights when necessary, C, trade union participation in technology assessment committees, and D, an end to corporate influence in technology and corporation decisions. Health is a human right, not a commodity. Thank you.
Thank you. I now yield the floor to Ms. Pombo Castro to respond to the comments.
Thank you, President. Me gustaría comenzar con agradecer.
Let me begin by thanking all the member states, 19, who spoke. I took notes through it when the comments were made. And it's, of course, difficult to summarize in a few minutes the sustained efforts made by each and every one of the member states to improve the opportunities to access to health technology and maintaining the flexibility of our health systems. But I would like to underscore a few without undermining all the others that have been mentioned, such as the reference to the need to use training spaces when including evidence-based health technologies. Also, opportunities for creativity and creation based on existing capacity in the Americas. For instance, taking advantage of existing good practices at centers which today have been accredited for bioequivalence and bioavailability studies, for example, and others pertaining to dialogues that would promote the exchange of good practices in technical cooperation mechanisms, which is the story behind technical cooperation in this organization. I don't think I'm wrong if I were to say that the experiences and best practices of each one of countries in different areas that are covered by this policy throughout the life cycle of health technology is a tacit example of how a joint effort can allow us to move forward. Someone mentioned the relevance of all the lines of action that are included in this policy. In some cases, a mention was made of the relevance that regional platforms have for the exchange of information that has been envisaged when we go to implement the actions for which we urge countries and the organization to support. And overall, I think this summary does cover most of the comments that have been made about the life cycle of health technologies. Also, we talked about the rigorous evaluations, fair prices. All of that has been included in the situation analysis of the policy and the 5 areas of action that are being promoted. Many of the topics mentioned remain as regional challenges for most countries. There were a lot of reference made to the differences between countries who have smaller structures, but yet there's still a lot in common with countries that have a more solid infrastructure but have a lower capacity or population. To the non-state agents that have official relationships with PAHO and WHO, what I would summarize from what they said is how good it's to hear the commitment of all of those actors present here, of their commitment to help us ensure that the challenge of ensuring that health technologies are affordable and accessible. It's very encouraging to see that international federations of students in medicine or in pharmacology are aware of this issue. This is the new generation, and obviously they're going to be setting the course in the future for health systems. So I would like to thank each and one of them for the comments they have made, and we are now ready and willing to help member states implement this. Thank you.
Thank you. I now give the floor to the director.
Thank you, Mr. President.
First of all, I'd like to express my gratitude to all member states for the process and the discussion followed that has improved the policy with the many regional consultations that we held before the Executive Committee and after the Executive Committee. What guarantees, it seems to me, the submission of a policy that is quite aligned with the concerns voiced by all member states, that in a very broad way, it proposes that 5 strategic lines of action that are going to guide our cooperation on those issues. The ministers, delegates, have greatly underscored the challenges that we face today in health systems. At the same time, we deal with new medicines and new technologies that are currently available, and the difficulty encountered in ensuring equitable access to these new technologies in order to benefit the entire population. The policy proposes a broad approach to strengthen the production capacity in the region, and there are different initiatives undertaken by PAHO, those that are already being supported by PAHO, even for mRNA vaccines, the project in Argentina, the project in Brazil, the projects of transfer of technology that are already being signed. We just signed the first one this year in January with Argentina for the pneumococcus PC20 vaccine and others that are currently in negotiation, and several other initiatives because the experience that countries had during the pandemic showed clearly that we cannot have this huge dependence on export and import of technologies. Many a times we're talking about simple things such as gloves and masks for the region to be able to better respond to the current needs and the current challenges and also future challenges. So it seems to me that we have opportunities for the production of syringes, personal protection equipment production, the production of medical equipment, simpler pieces of equipment that can be better and widely used in the region, besides those of more complex production where we have to look for more complementarity between countries that can work together in order to develop that capacity. So it seems to me that this is well proposed, being submitted as an important need faced by the region nowadays. And we are also, as we see in the document, they draw our attention to the issue of regulation. Many of you mentioned this. The Minister Atala from the Dominican Republic, with great emphasis, and also Peru, brought up the issue of bioequivalence and also the exchangeability for biosimilars. We have a tool. We have a tool in order to promote standardization, regulatory standardization, that the network, the PARCI, with a network with 25 years of existence. But it seems to me that, yes, all of this was important 20 years ago. Nowadays, it is urgent. Because talking about a harmonization or standardization process for medicines that cost $2 or $2.50 is not the same than medicines that nowadays cost hundreds or thousands of dollars, talking about technology. So it seems to me that we have to make the best of this moment so that with more dedication, with will, we can identify what the main priorities that we have in there are in order to move quicker in dealing with the standardization, regulatory and health standardization in the region. And I take note of this request made by the minister in order to look from among the centers that we already have in the region to have some sort of accreditation so that this could be used for other countries, because it is a guarantee that we use generic medicines of quality that is assured. Another important issue that is mentioned in the document is the issue of assessment and the inclusion and incorporation of new technologies. In the past, it was a luxury that developed countries had, others did not, but today it is essential. We cannot respond to the issue of judicialization if the health sector does not many times offer the technical, cost-effective evaluations so that the judge can take this into account when a decision is made. In the dialogue with the judges, many times they say, I know nothing about health. I have here a prescription that says that only this medicine can save the life of my patient, of this patient that we have here. And that is why I am making a favorable decision. So we need to have that capacity and that ability to work on the incorporation of new technologies, which is a key nowadays, and it is very well proposed in this policy that you considered. And last but not least, the revolving funds. Nowadays, they play a dual role. The traditional role of facilitating access, in principle, to vaccines, later on to medicines, antiretroviral, TB, malaria, but now with a new portfolio that we have of medicines for cancer and for orphan diseases, such as was stressed by some of you as an urgent need that some countries have. the funds have to expand the supply in order to ensure and guarantee more access by countries to vaccines, to medicines, and even high-price, high-cost medicines. But it also plays another role, which is to promote the production. This year, we're already going to achieve that 65% of all the vaccines on flu that are offered by the fund are produced in the region. Though that guarantees or assures us a very favorable position in the case of, knock on wood, I knock on wood 3 times, should a pandemic happen again because of a flu virus, the region will not have the capacity. Now it does have the sustainable capacity to produce the entire vaccine needed, all the stock of vaccines, because a seasonal vaccine, it is a vaccine of 3 or 4 viruses. The pandemic vaccine with 1 virus, it multiplies by 3 or 4 the capacity to produce. So only with the production that we currently have and with the high quality, standard, and certified manufacturers, we can now be ready to respond to this request. Also, in the process itself of procuring high-cost medicines, we have to look for manufacturers of biological and biosimilar medicines in the region that do comply with the requirements of quality, so that they would have a preference in the offers for the fund if they offer compatible prices. So this is an appeal that we make so that countries, all countries, can have policies to create an ecosystem, as is stated in the document, that can favor in a sustainable way the development of these production mechanisms. So it is a great pleasure for me to see how this issue was very well covered by all the comments that you made. And it seems to me that therein we will be able to take all the actions that are already taken, technical cooperation in a coordinated fashion in order to support you in this, which is a very important challenge for all the countries in the region now. Thank you very much, sir.
I now ask the rapporteur to present the proposed resolution for consideration of the Directing Council.
Thank you, Mr. Chair. I will read it as slow and clear as my national identity allows. Proyecto de resolución.
Proposed resolution. Policy for expanding equitable access to high-cost and high-price health technologies. The 62nd Directing Council, PP 1, having reviewed the policy for expanding equitable access to high-cost and high-price health technologies, document CD 62/9. PP 2, recognizing that scientific advances and the improvement of access for all to and rational use of health technologies contribute to the achievement of universal access to health and universal health coverage, the objectives of the Sustainable Health Agenda for the Americas 2018-2030, and other national, regional, and global
in the Americas,
goals to
as around the world,
sustainable development.
cardiovascular diseases are the leading cause.
Recognizing that the incorporation of some high-cost or high-price health technologies into health systems does not necessarily provide substantial added value, and that it may displace other effective technologies that are lower in cost and price. PP 4, recognizing the need to improve access through comprehensive approaches that take into account the life cycle of health technologies and focus on improving availability, affordability, and rational use in health systems, and on improving selection and the financing processes. PP 5, recognizing also the challenges currently facing the region of the Americas in ensuring access to and rational use of health technologies, and recognizing the increasing use of judicialization mechanisms to gain access to health technologies, especially high-price and high-cost technologies. Resolves. OP 1, to approve the policy for expanding equitable access to high-cost and high-price health technologies, document CD 62/9. OP 2, to urge member states, considering their national context, needs, and priorities, to, little a, promote the implementation of the lines of action set out in the policy. Little b, promote access to health technologies throughout their life cycle. starting from the innovation and production processes, including the implementation of incentives, conditions, and other strategies to ensure the registration, distribution, and affordability of the resulting technologies and promote mutually agreed technology transfer. Little c, optimize the selection, assessment, and financing of evidence-based health technologies, including strengthening of the assessment of such technologies as a criterion for coverage, considering cost-effectiveness and financial sustainability, and promoting the exclusion of obsolete or high-cost and high-price technologies with no clinical benefit, streamlining the approval of biosimilar and generic products and other new technologies with clinical benefits, and seeking greater access and efficiency in public spending. Little d, adopt appropriate and effective measures to improve access to single-source or limited-source products that will make it possible to strengthen pricing policies and strategies and promote competition and the use of biosimilar and generic products consistent with the adoption of frameworks on intellectual property in line with existing international agreements. Little e, strengthen capacities to reduce judicialization relating to the use of high-cost and high-price health technologies, strengthening the planning and availability of these strategic inputs, promoting alternative dispute resolution mechanisms, and seeking to ensure that judicial decisions are evidence-based and consonant with the sustainability of health systems, and promoting the training of judges, legal professionals, and prescribers in the use of evidence in the health field. Little f, support expansion of the scope and sustainability of regional revolving funds of the Pan American Health Organization with respect to high-cost and high-price health technologies, consolidating regional demand, and seeking effective participation. Little g, promote the development of structured mechanisms for the generation, monitoring, and exchange of information on high-cost and high-price health technologies, and also on financing schemes, costs, and conditions for innovation, production, procurement, and availability, and promote the use of platforms and networks to access information to facilitate strategic planning and evidence-based decision-making. OP3, to request that the director to little a, provide technical cooperation to member states to strengthen capacities that will contribute to the implementation of this policy. Little b, support the strengthening of coordination mechanisms, platforms, and interinstitutional collaboration networks to promote synergies and efficiency in technical cooperation, seeking to improve the affordability and availability of high-cost and high-priced medicines in the region of the Americas. Little c, to support the development of intersectoral policies at the national and regional levels, including regulatory frameworks and capacities that will increase access for all to high-cost and high-price health technologies in a more sustainable manner. Little d, report periodically to the governing bodies of PAHO on the progress made and challenges encountered in the implementation of this policy through progress reports to be submitted every 5 years, with a first report in 2030. That is all, Mr. President. Thank you.
Thank you very much. Are we all in agreement? Obviously, consensus has been reached. I declare the amended resolution adopted. We will now take a coffee break, but before we do so, I just want to inform members we'll return at 4:15, and at that point we will start with item 6.1, the PAHO Award for Health Services Management and Leadership 2025, and after that we will go to items 4.5 and 7.5. Thank you. Okay. Costa Rica, you wanted to?
Muchas gracias, señor presidente. Thank you very much, Mr. Chairman. With your permission, in the head table, with your permission, Minister Walcott, I'd like to let delegations know that next week we will be celebrating at the Organization of American States, together with PAHO, the first Inter-American Week on Mental Health. This is based on a resolution that was recently adopted at the General Assembly that was held in Antigua and Barbuda, thanks to the leadership of this country, Antigua and Barbuda, and it is the first time that we're celebrating this at the OAS. And therefore, we're being asked, if possible, each head to participate with a very brief message so that we can project it next week within the framework of the opening that will take place on October 6th at the OAS. If each head of delegation in their free time between today and tomorrow can approach our dear colleague Leticia Link, who's sitting in the back waiting for you, so that you can record a very brief message between 10 and 15 seconds. She will give you a script so that we can project this to all the children and adolescents in the Americans, that they're not alone in this process in dealing with mental health problems, and that the OAS and PAHO wish to send this support message. Thank you very much.
Thank you so much, Costa Rica. I believe all of the heads will do so. Thank you. We return at 4:15.
In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita paho.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's the decade of healthy aging in the Americas, adding life to years.
On November 14, 1924, in Havana, Cuba, history was made for public health in the Americas. The Pan American Sanitary Code was signed ad referendum by representatives from 18 nations at the Assembly Hall of the Academy of Medical, Physical, and Natural Sciences, now known as the Carlos J. Finlay Historical Museum of Science. This code, later ratified by all countries in the Americas, defined the duties of the Pan American Sanitary Bureau, today known as the Pan American Health Organization, PAHO. It established clear responsibilities for countries to report disease outbreaks, standardize prevention and control efforts, and gather crucial health data. This collaborative approach, rooted in the values of Pan-Americanism, recognized that health cooperation was essential, not only for the well-being of each country, but for fostering safe international trade across borders. Even today, a century later, the Pan American Sanitary Code remains a guiding force, continuing to shape PAHO's mission to promote the health and well-being of individuals, families, and communities across the Americas. This code stands as one of the most remarkable achievements in health policy, uniting nations under a shared commitment to public health excellence. In 2024, a century after the signing of the code, we honor the legacy of its architects, as PAHO and its member states persist in their efforts to improve the health and well-being of all people in the Americas.
Our success has been through governments and the dedication and commitment of our health workers and our policy makers.
Everywhere where there is a community, you can train people from the community in doing diagnosis and treatment and report to you.
Próprio esforço do grupo, nós temos pessoas aqui dentro da malária que realmente estão dispostas a fazer o trabalho com motivação e carinho. Trabalhar com a própria comunidade foi a chave para chegar onde chegamos.
I would like really to congratulate these health workers in this area because I experienced the challenge they are facing to reach these places. You can't do that if you are not committed.
I think in the foreseeable future, we can envision a malaria-free Amazon.
We can change the life of many people by reaching this elimination goal.
Yo me llamo Daniela Gómez, me dedico a pintar, ilustrar y hacer murales también, pinturas en formatos grandes sobre nuestro entorno, con nuestra cultura. Me gusta mucho pintar.
Está muy bonito y muy alusivo a lo que en estos momentos está pasando con lo de la fiebre amarilla.
Estamos en el municipio de Ataco, un municipio que queda al sur del departamento del Tolima, hace parte del foco sur. Es uno de los municipios que tiene un número importante de casos y una letalidad bastante alta, es decir, tenemos 9 muertos como producto de la fiebre amarilla.
In the Americas, as around the world, cardiovascular diseases are the leading cause of death. But so many of these lives could be saved with better control of hypertension. If we could raise population control from 36 to 50%, we would prevent nearly 440,000 deaths and almost 3 million cardiovascular events. From the global vision of the World Health Organization came hearts. The Pan American Health Organization, with leadership from the Ministries of Health of the region, expanded that vision into Hearts in the Americas, a strategy for quality improvement. Today, 33 countries are committed. More than 9,900 health centers are implementing Hearts, reaching 42 million adults. We are transforming primary health care with the Hearts clinical pathway, promoting team-based care and the use of data for continuous cycles of improvement. In 2025, over 6.3 million adults are receiving treatment, and more than half already have their blood pressure under control. But our story is still being written. Over 200 million adults in the Americas live with hypertension. And our goal is clear, that everyone has access to better care. This is Hearts in the Americas.
Los casos de sífilis están en aumento en América Latina y el Caribe, con un aumento del 30% entre los adultos de 15 a 49 años. Esta enfermedad afecta a personas de todas nuestras comunidades y se propaga rápidamente, pero tenemos el poder de detenerla. La sífilis congénita representa una amenaza seria para los recién nacidos, pero podemos prevenirla. Ahora es el momento de actuar. Las pruebas integradas y el tratamiento oportuno son esenciales para proteger a nuestras comunidades. Para más información, visita PAHO.org.
Aging opens up a world of possibility. The possibility of continuing to do what we love and be who we are. But without the right support, aging can also bring limitations. Poor health, vulnerability, loneliness. We believe that a safe, caring, and supportive environment can turn aging into an opportunity to be healthy, to live fully, to embrace change, and keep learning and developing. We believe all people have the right to thrive at any age. Adding dignity to years, well-being to years, life to years. It's a decade of healthy aging in the Americas, adding life to years.
Colleagues, we resume at item 6.1. The PAHO Award for Health Services Management and Leadership 2025. I would like to bring document CD 62/13 to the attention of the Council and ask the representative of the Executive Committee to report on the decision of the Award Committee.
Thank you, Mr. President. Item 6.1, PAHO Award for Health Services Management and Leadership 2025. The Award Committee of the PAHO Award for Health Services Management and Leadership met during the Executive Committee's June session. The committee consisted of representatives of Chile, El Salvador, and Guyana. After examining the information on the candidates nominated by member states, the Award Committee recommended that PAHO Award for Health Services and Leadership for 2025 be conferred on Dr. Julie Esther Caballero Peralta of Peru for her leadership in the expansion and strengthening of mental health services in Peru and for her significant contribution to the development of policies, regulatory frameworks, programs, and technical guidelines promoting the coverage and access to health services to meet the needs of the population, particularly those in conditions of vulnerability. The Executive Committee thanked the Award Committee for its work and adopted Resolution CE 176R7, conferring the PAHO Award for Health Services and Management and Leadership 2025 on Dr. Julie Esther Caballero Peralta. Thank you, Mr. President. This concludes my report on the item.
Thank you. Ladies and gentlemen, every year the governments of the countries of the Americas, acting through their representatives at the meetings of the governing bodies of the Pan American Health Organization, confer the PAHO Award for Health Services Management and Leadership, previously known as the PAHO Award for Administration, in recognition of an outstanding contribution in the field of administration within the framework of national health services. I am pleased to present this year's award to Dr. Julie Esther Caballero Peralta from Peru for her leadership in the expansion and strengthening of mental health services in Peru, for her ability to identify the mental health needs of the population, for her participation in regional studies, and for her significant contribution to the development of policies, regulatory frameworks, programs, and technical guidelines promoting coverage and access to health services to meet the needs of the population, particularly those in conditions of vulnerability. Dr. Caballero Peralta has been key in the implementation of the mental health law in Peru, particularly in the establishment of more than 290 community mental health centers, mobile care teams, and integrated services. She has led various initiatives on emerging issues, including the risks associated with the use of new drugs such as fentanyl. Her work has strengthened community mental health services and contributed to reducing its associated stigma and improving access to health throughout the country. Noting her contributions, it is for me a great honor to confer this award to Dr. Julie Esther Caballero Peralta.
Muchas gracias. Excelentísimo señor.
Thank you very much, Your Excellency, President of the, or Director of the Pan American Health Organization, members of the Directing Council, honorable representatives of the countries of the Americas, esteemed colleagues and friends. I greet you all warmly. I would like to start by expressing on my behalf and that of the Ministry of Health of Peru our deepest of thanks for this recognition that we humbly and happily receive. This award means a lot to me. I link it to God and my family, who have always held me up, and everyone else who on a daily basis work tirelessly for the well-being and the mental health of our communities. This honor inspires us to renew our commitment, reminding us that mental health is not a marginal matter, but a fundamental human right. I'm very excited that this acknowledgement underscores leadership that isn't that of one person. It's a shared leadership, a leadership that is built through dialogue, collaboration, joint efforts with regional, local government, universities, professional schools, civil society organizations, and above all, with the communities themselves. Mental health is inseparable from health. However, even today, it is still rendered invisible by stigmas and prejudices, even within the healthcare systems themselves. That's why I am particularly happy to see that this award reasserts the need to place mental health on the regional health agenda. I also believe that it will encourage public health professionals, and especially to motivate more women to lead the management of health services. In Peru, neuropsychiatric diseases over the last couple of years have been a big part of the disease burden. Just up until not that long ago, only 10% of those who needed specialized care received it. In 2012, we decided to start to close this very painful gap, taking firm steps toward establishing a sound legal framework, first in the Law 29889 and then Law 3094-7. This ushered in a deep transformation based on a model centered on psychiatric hospitals, turning it into a community-based one, offering care that's more comprehensive and closer to where people live, and that's offered in a very respectful way. Thanks to this joint effort, thus far, we have stood up 292 community mental health organizations, 52 different hospital units with mental health modules, 94 protected homes, and 6 mental health services in penitentiary centers as well. 11 mobile teams and more than 1,700 establishments at top level. This was done only as a result of the commitment of so many people, but also given the greater investment in mental health, which has made it possible to broaden coverage, strengthen capabilities, and to ensure specialized medications for those who need it. As a result of this, we have more than doubled mental health care, going from 690,000 cases in 2014 to close to 2 million in 2024. Today, close to 70% of these cases have been treated at the first level of care. This is a leap forward that shows that we are creating a system that's closer to people, that is more equitable and humane. Now, this award gives me the opportunity to express my sincerest of thanks to the Minister of Health, Vice Ministers, the technical teams and authorities of the different ministries that have made this process possible, and of course my friends and colleagues from the Ministry of Health in Peru, and especially the Office of Mental Health. I also would like to recognize those who came before us, because their vision is what really kicked off this transformation. Lastly, I would like to underscore that this award isn't a point of arrival, but it spurs us to move forward, to continue. It challenges us to strengthen our human resources, the infrastructure, the technology, and the information systems throughout the region. Let's continue working together with resolve and hope to ensure a more dignified, accessible, and profoundly humane mental health for all of the peoples of the Americas. Thank you.
Thank you. We now turn to item 4.5 and item 7.5. Plan of Action on Non-Communicable Disease Prevention and Control 2025 to 2030 and Strategy for the Prevention and Control of Non-Communicable Diseases Final Report. I would like to bring the documents CD62/8 and CD62/INF/5 to the attention of the Council and invite Dr. Anselm Hennis, Director of the Department of Non-Communicable Diseases and Mental Health of the Pan American Sanitary Bureau, to come to the head table. Welcome. I now yield the floor to the representative of the Executive Committee to report on this item.
Thank you, Mr. President. Item 4.5, Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030, and item 7.5, Strategy for the Prevention and Control of Non-Communicable Diseases, Final Report. The Executive Committee reviewed the final report on the strategy for prevention and control of non-communicable diseases during its June session, and also discussed the proposed new plan of action on NCD's prevention and control. The committee expressed support for the proposed strategic lines of action under the new plan of action, with delegates affirming the importance of integrating NCD's prevention and control into primary health care, and stressing the need for a life course approach and a focus on NCD prevention starting in early childhood. The importance of promoting healthy habits and diets were underscored, with several delegates highlighting the need to discourage consumption of ultra-processed foods. A multidimensional, multi-sectorial approach was considered crucial to address both risk factors for NCDs and social inequalities and determinants of health that can influence those risk factors. It was also considered essential to work with stakeholders outside of the health sector, including private sector actors, to combat the chronic disease epidemic and expand opportunities to promote effective, evidence-based interventions to improve health outcomes. It was also suggested that the plan should be strengthened through linkages to ongoing work on environmental risks to health, particularly air pollution as a leading cause of NCDs. Some concerns were raised about taxation measures mentioned in the Strategic Line of Action 1 of the Plan of Action. In the discussion of the proposed resolution on this item, several amendments were discussed. Following deliberations and in the interest of advancing collective work to reduce the burden of NCDs in the region, the Executive Committee subsequently adopted Resolution CE 176.R9, recommending that the Directing Council approve the plan of action. Thank you, Mr. President. This concludes my report on the item.
Thank you. I now yield the floor to Dr. Hennis to present the item.
Señor Presidente, Dr. Barbosa, distinguidos delegados.
Distinguished delegates and colleagues, I'm pleased to present the final report of the strategy for the prevention and control of non-communicable diseases and the plan of action for prevention and control of non-communicable diseases 2025-2030 on behalf of the Pan American Health Organization. Non-communicable diseases continue to be the main cause of disability in the Americas. It's estimated that 240,000 people in the a million people in the region live with at least one NCD, and they were responsible for nearly 6 million deaths in 2021. I should underscore that 2.3 million, 38% of these deaths happened prematurely in people under 60 years of age. Most of which are imminently preventable. Now, the strategy for the prevention and control of NCDs was pushed through by the high-level meeting of the UN on the prevention and control of non-communicable disease 2011, defining the World Plan of Action of WHO for the prevention and control of non-communicable diseases 2013 to 2020. During the period covered, premature death owing to NCDs dropped slightly from 15% to 14%, and only 5 countries currently are on a path to achieve a reduction of mortality by NCDs 25 to 25%. Now, the premature death of boys, girls, adolescents, and adults, as well as a lack of physical activity in adults.
Sin embargo,
that said, there has been progress in tobacco control, and tobacco use in adults dropped by 5% from the baseline, whereas 24 countries implemented new legislation governing smoke-free public spaces. However, the Americas continue to lead in front labeling. This has been implemented in 10 countries. As regards primary health care, 33 countries and territories have pledged to implement the HEARTS initiative, and nearly 5,500 primary health care centers are already applying the protocols, which have led or have brought down brought down high blood pressure, hypertension in 75% of people. Now, there has been progress in control and progress in with the NCDs. The COVID-19 pandemic largely interrupted those services for NCDs, hitting hardest those people with underlying or pre-existing chronic diseases.
NCD strategy, the proposed plan of action on non-communicable disease prevention and control 2025 to 2030 aims to support member states in accelerating actions necessary to meet the global NCD targets, including the reduction of premature mortality from NCDs by 1/3 by 2030. This plan of action was developed through a collaborative process with online consultations with member states, in addition to submission of written inputs. PAHO also conducted an interprogrammatic review, which included inputs from the technical departments. There are further consultations with member states following the 176 executive committee meetings to address the issues raised, as highlighted by the rapporteur. Several countries subsequently submitted inputs, many of which have been included in the amended document, such as more emphasis on chronic kidney disease and obesity. Building on the lessons learned from the strategy about the need to scale up disease prevention and control, improve delivery of NCD care in primary health care, and address information gaps, the plan of action outlines 3 overarching strategic lines of action, which are 1. NCD risk factor reduction and health promoting actions, recognizing multi-sectoral collaboration needed for NCD prevention. 2. Integrating NCDs into primary health care to increase the proportion of people diagnosed, treated, and controlled. And 3. Strengthening NCD surveillance to ensure routine monitoring and reporting of the NCD situation by countries. The PAHO Secretariat is committed to supporting member states in their efforts to achieve the SDG targets, aimed at accelerating efforts to reduce premature mortality from NCDs by a third by 2030. Furthermore, the PAHO Secretariat has provided support to member states in their preparations for the 4th UN high-level meeting on NCDs and mental health held earlier this month, and will support countries in the implementation of the outcomes of the political declaration when these have been approved. We invite the Directing Council to review and consider the approval of this plan of action and its recommendations. Thank you for your attention.
Thank you, Dr. Hennis. The Directing Council is invited to review the information presented in these 2 documents and provide any comments it deems pertinent. The discussions on the proposed resolution presented in Annex A of document CD 62/8 will take place once the rapporteur has read the proposed resolution. I will now open the floor to the plenary for discussion on the document presented. Bahamas, you have the floor.
Thank you. Thank you, Chair. The Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030 is a well-thought-out document that provides member states with the guidance that are peculiar to the goals and ideals of the PAHO region, while ensuring alignment with the global plan adopted at the World Health Assembly. As such, the Bahamas commits to the pursuit of the attainment of the indicators that are relevant. Mr. Chair, the NCD Plan of Action, with its 3 strategic lines of action, provides a clear plan that seeks to characterize and count the steps taken by member states to prevent NCDs, manage NCDs, and mechanisms taken to monitor how member states' residents are responding to the care that is being provided and the policies introduced and enacted to reduce the onset and prevalence of NCDs and related morbidity and mortality. Mr. Chair, the Bahamas is in alignment with Strategic Line Action 1, passed the Health Promotion and Wellness Act 2025, which in part calls for and legislates inter-ministerial coordination, multi-sectoral collaboration, and joint initiatives with relevant stakeholders for the integration of strategies to promote physical activity and mental health, introduces interventions to address social determinants of health, to promote strategies for strengthening health education and promotion, and implementation of health-promoting priorities, policies, and programs. As mentioned in Minister Darville's remarks in response to Barbados's report yesterday, the Bahamas' work with Strategic Line Action 2 is being implemented through efforts geared at strengthening of the care for persons with non-communicable diseases as guided by HART's protocols and the Better Care for NCDs initiative. Mr. Chair, having trained 75% of public sector primary healthcare staff in the application of the adopted protocols, the Bahamas is now expanding access to medicines and to diagnostic, imaging, and laboratory services for rural residents. And finally, Mr. Chair, in alignment with Strategic Line Action 3, the Bahamas is current in its cycles of the NCD Steps Risk Factor Survey and the Global School Health Survey. In addition, with the engagement of national experts, we are grateful for the technical guidance and funding from both PAHO and IDB to implement a public health sector electronic medical record that, through a National Health Information Exchange platform and with agreements with private sector health information systems, will provide the data necessary for national monitoring systems or national monitoring of slower targets 3 and indicators. We are grateful to Jamaica's Ministry of Health and Wellness's IS4H team for collegial advice on honest experience with the implementation of health information systems. Mr. Chair, having spoken to the merits, the Bahamas approves the Plan of Action on Non-Communicable Diseases Prevention and Control 2025-2030, document CD 628, and endeavors to work toward achieving the relevant targets contained therein. The Bahamas also takes note of the Strategy for the Prevention of Control and Non-Communicable Diseases final report. Thank you.
Thank you, Bahamas. I now give the floor to St. Kitts Nevis.
Chair, Director, distinguished delegates, the Federation of St. Kitts and Nevis welcomes the Plan of Action on Non-Communicable Disease Prevention and Control 2025 to 2030 and its 3 strategic lines of action. Like many small island developing states, St. Kitts and Nevis continues to experience a disproportionate burden of NCDs, which account for the majority of premature deaths and place significant strain on our health system and economy. Hypertension, diabetes, cardiovascular disease, and cancers remain leading causes of morbidity and mortality, exacerbated by lifestyle risk factors, climate change, and health system vulnerabilities. We commend the plan's focus on prevention, equity, and multi-sectoral action. The Federation is committed to advancing this agenda through 1, the strengthening of primary healthcare systems to ensure integrated screening, early detection, and management of non-communicable diseases while expanding access to diverse screening modalities. 2, expanding health promotion and community engagement efforts for youth, along with applying evidence-based behavioral science approaches to drive meaningful change. 3, leveraging digital health tools to improve surveillance, continuity of care, and patient empowerment. And 4, building resilient health systems with adequately trained human resources for health, access to essential medicines, and the use of technologies to address the NCD burden, even in times of crisis. We underscore the importance of technical support for small island developing states in implementing this plan of action, given our resource constraints, limited economies of scale, and vulnerability to external shocks. Regional solidarity and PAHO's continued leadership will be critical to ensuring that no country is left behind in achieving the targets set out. Chair, St. Kitts and Nevis reiterates its commitment to implementing the 3 strategic lines of action. We stand ready to work with member states, PAHO, and key strategic partners to accelerate progress on NCD prevention and control, safeguard the health of our people, and contribute to the achievement of universal health and the Sustainable Development Goals. Thank you.
Thank you, St. Kitts Nevis. I now give the floor to Cuba.
Mr. President, I'm certain that we can't continue doing the same we've been doing and achieve within the next 5 years our goals in a more complex world in every way. Addressing NCDs is something we do have to do, and it should be stressed in the plan from the standpoint of social determinants that lead to them, as well as with a more intersectoral, cross-cutting approach. And all of the evidence that is produced in the field is important, and the clinical importance of the first 100 years of life. We think that we need to focus on the categories of burden of disease and healthy life expectation to a certain degree. The premature death is an indicator that we should overcome. Now, given the demographics for 2030, in some countries such as Cuba will reach and overcome or surpass 30% of the population over 70 years of age, which is those 80 years and over is the fastest growing group where we see more and more chronic disease. Therefore, we should not only focus on those conditions that lead to greater mortality and chronic diseases that lead to more mortality, but to include chronic diseases in the regional plan as a ever more complex phenomenon with a big impact. Now, the health sector, that is, we should do this in a holistic way, not piecemeal. We can't stop focusing on access to effective treatment for controls of NCDs. Cancer becoming a chronic condition, as well as others, show that this is a growing matter that we have to address better and focus on people's quality of life and palliative care. The levels of NCDs is something of great importance. We don't always have the necessary and timely data showing the prevalence of these diseases. This plan does not contain explicit objectives and indicators tied to scientific evidence. It does not allude to the role of universities in the production and reproduction of knowledge tied to this problem. The trend of rise in cost of healthcare clashes with the objectives of the impact that this will have on the population. Action plan should reflect this contradiction, which is the result of a medical industry that's only profit-seeking. We need to break away from the trend to victimize people. Mental disorders is not included here, nor are other public health problems that don't lead to a high level of mortality, but still entail a burden such as epilepsy, which are a major cause of death in countries like Cuba. We have to look at the risk factors, climate change and pollution in the environment. Primary health care is key, but there are other levels of development of the services that can have in the mid and short term a positive effect, and that they should not be overlooked. Thank you.
Thank you, Cuba. I now give the floor to Belize.
Thank you, Chair. Excellencies, colleagues. Belize accords the highest priority to addressing non-communicable diseases and their risk factors, and we welcome both the final report on the strategy for the prevention and control of NCDs and the proposed plan of action 2025-2030. Together, these provide a valuable continuum, lessons learned from the past 12 years and a roadmap to accelerate progress towards the 2030 targets. Belize takes note of the lessons identified in the final report, including the importance of multi-sectoral action, primary health care strengthening, population-level surveillance, and sustained advocacy. We acknowledge the disruptions caused by COVID-19, but also the opportunities created to build stronger, more resilient health systems. At the national level, Belize has made meaningful progress. We have rolled out and expanded the HEARTS initiative across all primary health care facilities, developed clinical pathways for hypertension and diabetes, and advanced our cervical cancer elimination strategy through HPV vaccination and testing. Our global youth tobacco survey has been completed, and we are in the process of tabling comprehensive tobacco control legislation. We are also expanding telehealth and digital tools to strengthen NCD detection and management. Importantly, Belize is committed to political and policy action. We have mechanisms in place for NCD policy development. We are strengthening regulations around harmful products such as tobacco and alcohol, and we continue to roll out nutrition and healthy lifestyle interventions in communities and schools. Gender equity has been mainstreamed into our health system, supported by data disaggregation and governance frameworks. Chair, Belize strongly supports the adoption of the new plan of action. We also recognize the need to develop a comprehensive national strategy that incorporates the lessons learned from the final report and aligns with the regional plan. Our government is committed to providing resources, strengthening surveillance, and deepening whole-of-government and whole-of-society approaches to reduce premature mortality from NCDs by 2030. Thank you.
Thank you, Belize. I now give the floor to Peru.
Thank you very much, President. Peru is grateful for presentation of the Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030. This is a roadmap to accelerate the necessary measures and reduce the burden of NCDs in our region. We acknowledge its integral approach in three essential lines: in reduction of risk and the strengthening of surveillance. Nationally, we have moved forward to implement policies such as the law on healthy nutrition that introduced front labeling on nutrition targeting youth. The community model for mental health has made it possible to implement 292 community mental health centers that are protected, mobile units, hospitalization facilities, all providing high levels of care. Furthermore, there has been a scale-up of the Hearts Initiative so that over 70% of high blood pressure patients that are taken care of at the primary level maintain a good blood pressure. In cancer, we've exceeded 95% in vaccine against the HPV and have reduced by 50% the diagnostic time in pediatric cancer. This can be seen in a community preventive model. Nonetheless, the challenges persist. The prevalence of obesity, consumption of alcohol, and gaps in access to essential medicine demand multi-sectoral sustainable responses. Therefore, Peru decidedly supports this plan as it will coordinate regional action, strengthen international cooperation, and ensure financing through cost-effective interventions. Lastly, we reaffirm that to invest in prevention and control of NCDs and mental health is to invest in human development and equity. Peru will work together with member states to achieve the global objectives by 2030, guaranteeing a healthier future for all our peoples. Thank you very much.
The floor to Guatemala.
Thank you very much, Mr. President. We're grateful for a presentation of the Plan of Action and report on the strategy for control of non-communicable disease. This is an integral panorama of advances in the region and persistent challenges. Although there has been a modest decrease in premature death due to NCDs, there are still countries with increases in this rate, which underscores the need to accelerate collective action. For our country, prevention and control of this kind of disease is a national priority. We have participated actively in drafting the PAHO strategic plan, which recognizes the urgencies of reducing burden from NCDs in the region. The government of Guatemala has redoubled efforts to have increased prevention and to guarantee the right treatment for diseases such as renal diabetes, cancer, recognizing the deep socioeconomic impact on our communities. We acknowledge that risk factors that can be modified, such as tobacco use, alcohol, unhealthy eating, physical inactivity, and exposure to environmental aspects, have a negative impact on our population. It is therefore crucial to have multi-sectoral actions contributing to timely approaches. And a sample of our commitment, we have a kidney resolution that was approved recently. The resolution promotes inclusion of screening in the care of diabetes and high blood pressure, as well as progressive inclusion of inclusion of kidney disease in universal coverage. It is furthermore important to assess the environmental risk factors, so we are working to guarantee access to safe water for human consumption, recognizing that contamination can result in gastrointestinal cancer, cardiovascular, and mental diseases. Implement programs for sanitation to reduce contamination of water sources, ground, and air. Have greater tobacco controls, because they can increase risk of cancer and stroke. We share the report's comment on the need for international cooperation to close gaps to access and coverage. Guatemala will continue promoting implementation of effective strategy for NCD prevention and control, and to have measures with other sectors to guarantee safety, such as labeling, reduction in sodium, elimination of trans fats, and strengthening the tobacco control framework. We're grateful for the PAHO's support and technical contribution, and we will continue collaborating closely with the organization and member states towards prevention, care, and treatment of the NCDs. Thank you very much.
Guatemala, I give the floor to Brazil.
Thank you, Mr. President, Director General, distinguished colleagues. The burden of NCDs in the region of the Americas is of concern, especially suicide rates. This isn't just a health challenge, but also has to do with economic and social determinants, which call for coordinated actions and cross-sector strategies. Brazil recognizes the importance of the 2025-2030 Plan of Action and supports its adoption as a key instrument to speed up progress with global and regional goals. We think it's urgent and necessary for us to tackle these new digital marketing strategies of unhealthy products. Brazil has made strides in regulating tobacco, alcoholic beverages, and ultra-processed goods and substitutes for mother's milk, which can harm children's development. We support the adoption of this of the resolution by the World Health Organization, the 7818, as regards substitutes for mother's milk. We see breastfeeding as a public health priority in our region, our country. We are a worldwide reference in banks for mother's milk, and also the 2011-2022 NCD plan was updated in the 2021-2030 for non-communicable diseases and chronic diseases. This includes foreign or outside causes such as violence, which is an important matter in our country. Another aspect of the utmost importance is strengthening primary health care, including screening, early diagnosis, timely treatment, and access to essential technologies and medications. These actions should be combined to intersectoral strategies which are key to reduce inequalities and to allow broad access to the ongoing health care for those with chronic diseases. The program of Health in School highlights this effort for mouth health and mental health, as well as the HPV vaccination program, in which we have reached 82% of children without vaccines and 77% of boys in Brazil. To invest in early prevention is also essential, not just for health, but also to make sure that we have an equitable future in our society. In addition to this, we stress the need to consolidate the national research and surveillance systems, which are essential to guide public policy that are evidence-based. Since 2006, the digital system monitors the risk factors and social and protection factors for chronic diseases to enhance the quality of life of the population. To invest in populational surveys and digital innovation is essential to generate quality data and to monitor progress. Also necessary is for there to be integrated research with health data and national health research in our country and mental health research. We reiterate in Brazil our commitment to science as a comprehensive response to NCDs for reduction, prevention, and control of the risk factors in keeping with the 2030 Global Health Agenda and equity. Thank you very much.
Thank you, Brazil. I now give the floor to St. Lucia.
Thank you, Mr. President. St. Lucia reviewed document CD 62/6 and supports the Plan of Action on Non-Communicable Disease Prevention and Control for the period 2025 to 2030, utilizing the whole-of-society approach with multi-sectoral partnerships. According to the World Health Organization, non-communicable diseases, mainly cardiovascular diseases, cancers, chronic respiratory diseases, and diabetes, are the main conditions with more than 43 million deaths globally in 2021. In St. Lucia, NCDs account for about 82.1% of the deaths, with malignant neoplasms, cerebrovascular diseases, heart diseases, hypertension, and diabetes being the leading 5 causes of death over the period 2017 to 2020. In 2019, PAHO conducted the STEP survey. A significant percentage of the participants were found to be having 3 or more cardiovascular risk factors. Over the last decades, the Ministry of Health has implemented several initiatives to address these cardiovascular risk factors while trying to reduce the incidence and prevalence of NCDs. These include the National NCD Policy and Action Plan 2017 to 2025, access to primary care available free of charge at 34 wellness centers, recognition of main health observances or health education campaigns, universal health coverage, the first phase diabetes and hypertension, cervical and prostate cancer screening free of charge at wellness centers, implementation of St. Lucia Moves initiative, tobacco taxation, 63% ad valorem tax, public health smoking regulations in June of 2020, and the HOTS initiative in 2019. Notwithstanding, we note the need for scaling up cost-effective population-based policies, laws, and regulations to create and sustain healthy environments. In concluding, St. Lucia supports the 3 strategic lines of action outlined in the document and the relevant monitoring and evaluation component. St. Lucia looks forward to the continued support and resources from PAHO to facilitate the implementation of this strategy. I thank you.
Thank you, St. Lucia, and I'll give the floor to Uruguay.
Thank you very much, Mr. President. Uruguay would like to express support for the Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030 and its strategic lines of action. In this context, we underscore the importance given by our country to international cooperation as a tool to respond to challenges posed by prevention and control of non-communicable diseases, especially given they represent the main cause of death and disability in our region. In our country, cardiovascular disease, neoplastic, and respiratory diseases are responsible for over 60% of deaths. According to the most recent census in Uruguay, there is a great prevalence of overweight and obesity, high blood pressure, insufficient consumption of fruits and vegetables, low physical activity, high glucose in blood, and cholesterol. Likewise, cardiovascular diseases are the main cause of death among women, and amongst men, it comes second after cancer. Given these challenges, Uruguay built a solid policy framework over decades. In the period 2020-2024, we strengthened the program for the prevention of non-communicable diseases, which has 5 strategic axes. The current administration adopted national health strategies to impact critical programs from a perspective of rights, promoting greater equity, and the integral care of the pathologies. These objectives, 1 to 3, are directly tied to addressing NCDs. The consideration has also been included among the new health priorities, and specific objectives have been identified. Mr. President, Uruguay would like to take this occasion to reaffirm its willingness to continue working together with PAHO to advance in a holistic approach of NCDs in the region that leave nobody behind and contribute to achieving the global objectives for 2030. Thank you very much.
Thank you, Uruguay, and I'll give the floor to Costa Rica.
Thank you very much, President. Costa Rica is grateful for the presentation of the Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030. We find that the proposed roadmap is well aligned with national efforts, and we recognize the importance of strengthening the promotion of factors for protection as well as the reduction of risk factors. There are 3 things in particular we'd like to mention. First, in line of action 1, we think it is timely to incorporate an objective for the promotion of healthy habits from early childhood, including specific actions at school. We also need indicators having to do with research to have solid data supporting decision-making at primary care level. Second, with regards to line of action 2, we underscore the need for strengthening primary care with clear protocols, screening tools, and early technologies for diagnosis. This needs to have sufficient sustainable financing to guarantee the objectives and targets and continuity of actions. Third, to improve quality of care, it is essential to invest in ongoing training of health workers, update clinical manuals, ensure the correct structure, and guarantee access to essential drugs. Costa Rica reaffirms its commitment to this process, convinced that integral approach of NCDs from prevention, detection, early detection, and primary care are fundamental in order to move forward for a healthier region. Thank you very much for the presentation.
Costa Rica, I now give the floor to Canada.
Thank you. I'm honored to deliver this statement as Canada's youth delegate to the 62nd Directing Council. Canada's youth strongly believe that addressing the social determinants of health is critical to reducing the burden of non-communicable diseases in the Americas. Economic stability, food security, and adequate access to housing and transportation are critical determinants necessary to achieve good health and well-being. Reducing the prevalence of non-communicable diseases and mental health conditions requires addressing these upstream factors. More specifically, investing in sustainably built environments that promote physical activity through safe and walkable neighborhoods, adequate access to healthy foods, and efficient transportation to healthcare facilities is necessary. This year, I held consultations with youth across Canada who shared a deep concern of the impacts of climate change on the non-communicable disease burden. The adverse effects of climate change have the potential to reverse important progress made by member states in promoting health and well-being across the Americas. An increase in adverse weather events such as wildfires and heat waves exacerbates cardiovascular diseases and chronic lung diseases such as asthma and chronic obstructive pulmonary disease. Further, a loss of infrastructure and an increase in forced displacement due to these adverse weather patterns negatively impact the social determinants of health, causes disruption to healthcare services, and negatively contribute to mental health outcomes such as anxiety, depression, and post-traumatic stress disorder. It is essential to continue to treat climate change as a serious public health emergency and act accordingly to prevent its disastrous impact on global health. Investing in infrastructure that can withstand the changing climate and creating environmentally sustainable solutions is critical to continue to achieve the goals listed in PAHO's Plan of Action on NCD prevention and control. Canada's youth recognize that addressing the social determinants of health, climate change, and sustainability requires a multifaceted approach, and we are eager to contribute to this change. We believe it is necessary that solutions are intersectoral, multidisciplinary, and collaborative to create sustainable and innovative solutions that improve health outcomes for all. Thank you.
Thank you, Canada. I now give the floor to Grenada.
Thank you, Mr. President. I am pleased to share Grenada's progress in implementing PAHO Health Initiative, a cornerstone of our national strategy to combat non-communicable diseases. In Grenada, NCDs account for over 80% of all deaths, with cardiovascular diseases leading the burden. Hypertension and diabetes are among our top causes of morbidity, and in 2022, over 80% of chronic disease hospital discharges were due to cardiovascular conditions. In response, Grenada joined the Hearts Initiative in 2023 and officially launched in February 2025. We are proud to report that all primary care clinics are now implementing Hearts, achieving full national upscale. We have adopted standardized clinical pathway for hypertension, extended it to private providers, and ensured that essential medications are available at low or no cost. Our transition to digital hypertension registers is improving data quality and guiding evidence-based decisions. To date, 231 health professionals have completed PAHO's heart training. These efforts are already showing results, better care delivery, and improved blood pressure control among our population. Looking ahead, we aim to institutionalize the pathway across all facilities, require validated blood pressure device in public clinics, launch a Heart Champion campaign to engage communities, integrate our registry into DHIS2, including private sector data, expand to Hearts D, addressing broader NCD management. We recognize that even modest improvements in hypertension control can prevent hundreds of stroke and heart attacks annually, while reducing long-term healthcare costs. Grenada is committed to sustaining this momentum. With Hearts, we are building a stronger, more equitable health system, one that protects lives and promotes well-being. Thank you.
Thank you, Grenada. I now give the floor to El Salvador.
Thank you, Mr. President. El Salvador appreciates the report, and we recognize that given the persistent burden of NCDs in our populations, and in keeping with the analysis of the PAHO final report, we declare our unavoidable commitment as an integral national strategy. It is multi-sectoral for the prevention and control of these diseases. The strategy has achieved a 10% reduction of the global target of reducing premature death due to NCDs, and 14% reduction in cardiovascular disease, 19.5% diabetes, and 14.5% cancer compared to 2019. We have strengthened primary or first-level care with the Hearts 2.0 strategy in 100% of health facilities, with validated blood pressure cuffs, single doses applications. And furthermore, we have reinforced the training of human resources, 74.5% case detection and 72.5% of cases with hypertension, and these have been controlled. There is an accelerated detection of cervical cancer. 73% of women of 30 to 59 years have been screened with HPV, and 76% of women treated for the early detection, diagnosis, treatment, and follow-up of ENTs. This way, NCDs. This way, we can ensure access to medication, technologies, and at the same time, we are fighting to eliminate these diseases, and we know that is achievable, especially with PAHO's support. Thank you.
Floor to Chile.
Thank you, President. Chile is grateful for presentation of the plan of action on non-communicable disease prevention and control 2025-2030, and we understand how pressing this social and health challenge is. We understand it is strategic important for our region. The NCDs are the main cause of mobility, disability, and premature death in the region, and our country is not foreign to this reality. Chile fully shares this view and wants to contribute some notions of what contributes. From the regulatory standpoint, we have implemented public policy in order to improve information for the citizens to be in smoke-free rooms, and also the consideration of the vapors, and to have front labeling for nutritional elements that is well recognized, and also taxes applied to sweetened beverages and also to achieve reduction in consumption of alcohol. These tools are aligned with the best investment because of the high cost benefit they can achieve with an intersectoral contribution. In primary care, we have prioritized comprehensive management of NCDs with standardized clinical methods, access to methodologies, essential medicines, and digital solutions for monitoring and support of self-care, which corresponds with the line of better attention for NCDs and the approach of a patient and course of life guidance supported by the document. Chile supports approval of this plan. It's a practical roadmap with cost-effective measures to reduce risk exposure, and to have protocols and technologies that are accessible and surveillance to govern by results. Experience in our country confirms that when these pieces are coordinated, the systems can generate benefits in equity and efficiency. We are grateful to the organization for the approach and for also basing it on accountability. Thank you very much.
Thank you, Chile. I now give the floor to Barbados.
Thank you, Chairman, President, distinguished delegates. Barbados fully supports the proposed Plan of Action 2025 to 2030. Barbados has indeed taken steps to fully align our national NCD plan, which covers the identical period. Faced with a society in which one's decade of birth defines culture, entertainment, education, and even language, health promotion and education activities must be more broad-based and diverse in order to effectively impact today's citizens. Local efforts continue in expanding media and other technological modalities in an effort to keep pace with this changing landscape of information. With respect to the management of non-communicable diseases, primary, secondary, and tertiary preventative care have long been integrated into primary health care services in Barbados. We continue to accelerate the implementation of HEARTS and HEARTS-D and have rolled out screening protocols for the management of colon, breast, and prostate cancers. Barbados congratulates PAHO for their unswerving commitment in addressing the burden of NCDs within the region. We acknowledge the efforts of civil society, for example, the Healthy Caribbean Coalition, for their tireless efforts in advocacy and health promotion. Strides have been made at the national policy level and within the legislative agenda framework, and successes have been reported on sugar-sweetened beverages and foods produced with high salt content. Activities are ongoing regarding trans fatty acids, and we are working towards eliminating trans fatty acids from our domestic and international food supply by the end of 2025. We remain committed to reducing the burden of NCDs in children and young adults, and we encourage PAHO to work with member states towards addressing the commercial determinants of health impacting our youth. We, in collaboration with the University of the West Indies, have started our third step survey. While we assent to the critical nature of this attainment, achievements are often challenged by the availability of appropriately trained personnel and the prohibitive cost of research, particularly for small island developing states. Barbados wishes to express its profound appreciation for the generous support of PAHO through the years and welcomes future support in maintaining and surpassing current gains. With this legacy, Barbados expresses commitment to the mission at hand. Thank you so much.
Thank you, Barbados. And I give the floor to Antigua and Barbuda.
President of the Directing Council, Director of the Pan American Health Organization, esteemed delegates, good afternoon. The PAHO Plan of Action on Non-Communicable Disease Prevention and Control 2025 to 2030 is a robust document that entails the multifaceted approach that is necessary to the successful implementation of a unified strategy to non-communicable diseases in the region of the Americas. Antigua and Barbuda has identified as a national priority that confronting the growing crisis of non-communicable diseases and mental health conditions will mitigate the enormous socioeconomic impacts of these conditions. The integration of care for non-communicable diseases into primary healthcare services is crucial to achieving positive health outcomes in the population. The country has implemented disease prevention mechanisms such as decentralization of cervical cancer screening and its availability throughout the primary care facilities, collaboration of the Ministry of Health with government agencies in carrying out employee health education sessions and screening for NCDs, and collaboration with the Ministry of Education in body composition studies and screening for childhood obesity, and cervical cancer awareness campaigns. Antigua and Barbuda has focused on the reduction of complications of non-communicable diseases. The country has advanced in the implementation of the HEARTS and HEARTS-D initiatives through the establishment of the clinical pathways and ensuring accessibility of medications through review of the National Drug Formulary, which was completed in 2025. Antigua and Barbuda recognizes that mental health is an essential component of overall health and a basic human right. The country has committed to updating the Mental Health Act through a multi-stakeholder and multidisciplinary approach under the technical guidance of PAHO. Antigua and Barbuda and PAHO co-hosted the side event on mental health at the Organization of American States 55th General Assembly held in Antigua under the theme, Leveraging Regional Momentum to Advance Mental Health. We joined the call of action to prioritize mental health care. The country continues to equip healthcare workers through scholarship awards for needed healthcare disciplines and partners with regional agencies to conduct training workshops. In 2025, CAFR provided training on diabetes care for healthcare workers, caregivers, and members of the Antigua and Barbuda Diabetes Association. The plan of action calls for information sharing and progress reports that will historically document lessons learned and targets reached. This will enhance future collaborations among member states. Antigua and Barbuda will continue to collaborate with PAHO and partner agencies to this end. Thank you.
Thank you, Antigua and Barbuda. I now give the floor to Suriname.
Thank you, Mr. President, for giving me the floor. Suriname wishes to commend the Pan American Health Organization for the development of the Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030. We recognize this as a critical step towards addressing one of the most pressing health challenges facing our region. In alignment with regional and global commitments, Suriname fully supports the Regional Plan of Action on NCD Prevention and Control 2025-2030. Non-communicable diseases remain the leading cause of mortality and morbidity in Suriname, with cardiovascular diseases, diabetes, cancers, and chronic respiratory diseases exerting a heavy burden on individuals, families, and our health system. This is evidenced in the completed burden of disease study that was supported by PAHO this year. The social and economic impact of NCDs is profound, disproportionately affecting vulnerable populations and deepening inequities. This plan of action is therefore timely and relevant to our national priorities. We particularly welcome the emphasis on multisectoral collaboration, community engagement, strengthening primary health care, and addressing the social determinants of health, all of which are aligned with Suriname's ongoing health sector reforms. We also underscore the importance of surveillance and reliable data for informed decision-making, as well as the integration of digital health solutions to improve prevention, early detection, and continuity of care. Suriname stands ready to implement this plan of action in partnership with PAHO and strategic stakeholders to guarantee prevention, best practices, and strengthen health systems. However, we wish to highlight the need for technical cooperation and resource mobilization to build national capacity, strengthen human resource for health, and ensure access to essential medicines and technologies for sustainable progress toward reducing the NCD burden. Esteemed President, Suriname fully supports the adoption of this plan of action and reaffirms its commitment to actively participate in the regional efforts, monitoring progress, and report on achievement to ensure that the aspirations of the plan are effectively translated into tangible health outcomes, protecting the population for premature mortality and ensure healthier lives for all by 2030. Thank you.
Thank you, sir. Now I now give the floor to the Dominican Republic.
Thank you.
The Dominican Republic appreciates the Plan of Action on Non-Communicable Disease Prevention and Control 2025-2030. It is strategically important to confront the main cause of death in our region that limits economic development and commits sustainability of our health systems. Today, we see an undeniable reality in NCDs and health systems that cause more than 43 million deaths per year, of which 18 million are premature. Almost 1 billion people live with mental health problems, and suicide is the third cause of death in young people from 15 to 29. The crisis requires urgent action. There is a path to reduce 1/3 the deaths by NCDs, reduce tobacco use, control hypertension, integrate mental health in healthcare. To achieve this, we need healthy environments and especially international financing to support cost-effective interventions. The Dominican Republic endorses the lines of action of the plan with involvement of public and private sectors and generating data for evidence-based decisions. We recognize the inclusion of mental health as a key element for a comprehensive response centered on people. In our country, we have the commitment to raise life expectancy from 75 to 81 by 2036, with the first jump to 77 by 2028. For this, we approved the National NCD Plan on Mental Health, implemented a program for better health under the Heart Strategy. We are one of the leader countries in the region. We have moved forward in combating child obesity with front labels, and we have a school program to provide primary care that is personal and collective, and we integrated mental health in primary health care. These efforts have resulted in recognition throughout the world, but especially to better well-being. Director, colleagues, we propose the creation of a regional repository of actions, including digitalization, strengthening primary health care, regulation of medicine, innovating financing for social determinants, so each country can share local experiences and with others, sharing common knowledge and developing health systems that are more resilient and equitable in the region. A regional repository of experience and solutions will allow us to turn our local successes in collective effort. Ladies and gentlemen, history calls us to join efforts. So 2030 will be reckoned the year in which the world elected life and well-being of their people with equity, ethics, and integrity. Each life saved is a victory for humanity. Each mind taken care of is a step forward. Thank you very much.
Dominican Republic, I now give the floor to Guyana.
Mr. Chairman, Guyana welcomes the presentation of the Plan of Action for the Prevention and Control of NCDs in our region. We commend PAHO for keeping NCDs high on the agenda, as they remain the leading cause of death and disability in Americas. In Guyana, we face significant challenges with cardiovascular disease, diabetes, cancers, and chronic respiratory conditions. In response, we have implemented a national NCD strategic plan, strengthened NCD services in primary health care, and with PAHO support, enhance our surveillance of risk factors to better inform policy. Guyana strongly supports this plan and would like to highlight a few priorities. First, equity must guide our action, ensuring that vulnerable and remote populations can access affordable care and medicines. Second, prevention requires a whole-of-society approach. We encourage strong engagement of education, agriculture, finance sector to tackle tobacco use, poor diets, and alcohol misuse and physical inactivity. Third, robust surveillance and harmonized indicators are essential to monitor progress. And finally, states like ours need sustained technical support and capacity building to accelerate results. Guyana endorsed the adoption of this plan and calls for practical, phase, and adequate resource implementation. We affirm our commitment to working with PAHO and member states to reduce NCD risk factors, strengthen primary health care, and promoting healthier lives for all. Thank you.
Thank you again. I now give the floor to Paraguay.
Paraguay supports the approval of the proposed plan. We recognize that NCDs are the main cause of death and disability in the region of the Americas and represents a challenge for health and well-being of our populations. We believe that the plan addresses the main risk factors in the 4 non-communicable diseases that are most prevalent: cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases. And we identify with the strategic line addressed, which is aligned with the first survey of risk factors that we conducted in NCDs held in 2022 using the standardized STEPS method of WHO and with our national report on obesity and hypertension, diabetes, and death by NCDs. In Paraguay, we have a national action plan for the prevention and control of NCDs. We've made progress in cancer. This gives us a solid foundation to implement a regional strategy. However, we recognize the need to update and harmonize our method and deadlines for 2025-2030 timeframe. Clinics need to be set up for hypertension, and we need to consolidate the regulatory policies of front labeling and on food items. For this, we request the technical financial support of PAHO to ensure this implementation and that it actually be effective, as well as protecting our policies vis-a-vis the interests of industry and actions by industry aimed at the populace, the most vulnerable people. We believe that this plan provides concrete goals and it will help to coordinate multi-sectoral approaches and equitable access to services and technology in health. Thank you.
Thank you, Paraguay. Honorable Ministers and Delegates, this has brought us to the end of this evening's session. Before we depart, I'm going to ask the Secretary to give the announcements.
Thank you, Mr. President. I have two. First, we would like to remind delegates that tomorrow at 8:30 a.m. will take place the meeting of the heads of delegation in Room B. And I want to warmly remind you of the kind invitation of the Permanent Observer of France and the Permanent Mission of St. Kitts and Nevis to the OAS, to all delegations to attend the talk, quote, Innovation for Better Healthcare, Insights from the French Caribbean, which will highlight the experience of the University Hospital of Martinique. The event will take place at 6:30 at La Maison Francois, followed by a cocktail reception and a musical performance kindly offered by the Permanent Mission of St. Kitts and Nevis. We look forward to seeing many of you there. Thank you, Mr. President.
Thank you. We've had 20 interventions on this agenda item, and there's still several requests for the floor. I propose to commence tomorrow. We will continue these two agenda items, 4.5, 7, and 7.5. Then we will go to 3.3, the elections for the executive board. And then we will continue item 4.7 and 7.6, and thereafter 7.2.
And continue with the program.
We will continue with the program, sorry, I said.
After 7.2.
We'll continue 7.2, we'll continue thereafter. But the list is there of the persons who requested, and we will continue with that list tomorrow morning. I thank you and have a good evening.
Brazil.
Yeah. Brazil.
Obrigada.
Thank you, Mr. President. Brazil would like to stress our invitation to the South American countries for a presentation which we are going to organize now, put together now, on the 7th floor to present the Belém Health Plan, which is an activity that we hold in the run-up to COP30. So South American countries in particular are invited. Thank you very much, Mr. President, and thank you, delegates. I'll be very brief. Brazil would like to invite countries of South America to take part in a meeting for the presentation of the Belém Health Plan right now. When we conclude this meeting on the 7th floor, we are celebrating or holding separate meetings for groupings of countries. Today is going to be for South American countries who have been invited. Thank you.
Thank you.